Honourable Senators, the President.
I acknowledge the Ngunnawal and Ngambri peoples who are the traditional custodians of the Canberra area and pay respects to the elders past and present of all Australia's Indigenous peoples. Senators, I invite you as I read the prayer to pray or reflect in your own way on your responsibilities to the people of Australia and to future generations. Almighty God, we humbly beseech Thee to vouchsafe Thy special blessing upon this Parliament, and that Thou wouldst be pleased to direct and prosper the work of Thy servants to the advancement of Thy glory and to the true welfare of the people of Australia. Our Father, which art in heaven, hallowed be Thy name. Thy kingdom come. Thy will be done in earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses as we forgive them that trespass against us. And lead us not into temptation, but deliver us from evil. For Thine is the kingdom and the power and the glory for ever and ever. Amen. Are there any documents to be tabled by the clerk?
Yes, President. I table documents pursuant to statute as listed on the dynamic red.
Are there any proposals for committees to meet during the sittings of the Senate?
The Community Affairs Legislation and References Committees have lodged proposals for private meetings today from 1:45 p.m.
If there is no objection, the meetings are authorised. And pursuant to order, I call Minister McAllister.
Well, thank you, President. And I begin by saying that it is a great honour to hold this portfolio, and I've really relished getting to grips with the brief over the last couple of months. I've sat down, of course, with the Department and the NDIA and the Commission, as you would expect. I've been making my way through the thousands of pages of analysis and reviews that have been produced, and I've spoken with my state and territory counterparts. I've been out and about, talking with advocates, speaking with service providers, regulators, academics, as well as workers in the sector and their representatives. But the most important conversations that I've had have been with people with lived experience of disability, the people who participate in the NDIS. And I want to thank the sector and the disability community for how generous they have been with their time and their knowledge. So for decades, people with disability have told policymakers, nothing without us, about us without us. And I understand the need. I understand that call, and I understand my responsibility to make sure that their voices are heard and that they carry weight. And as Minister for the NDIS, I have a responsibility to ensure the NDIS is not done to or for participants without their input. The scheme must be designed, overseen and implemented in partnership with the people who have a lived experience of disability. And, Deputy President, this will continue to be the government's position going forward. I also want to make it clear that the NDIS is part of the unique Australian social safety net, and it stands alongside Medicare as one of Labor's great achievements. And so Labor will continue to make changes to improve the NDIS. We know that the scheme has been life-changing. We know it isn't perfect. We want to ensure that the scheme delivers on the vision as originally set out. We want to protect the safety and uphold the rights of every single participant in the NDIS. We want to ensure that the scheme delivers consistent and fair decisions. And we want every dollar allocated to NDIS participants to reach them and to be spent in a meaningful way that makes a difference to their lives so that people with disability can continue to live with dignity and exercise control over their future. And we will pursue these things in line with this very clear principle. If you are a person with a disability, your interests deserve to be at the centre of the policies and the government decisions that affect your life. And this is how I'll approach this portfolio as the Minister, and it will be at the heart of the Albanese government's approach to the NDIS. And we know how important it is to make sure that the NDIS is there for the long haul. In relation to the order being discussed, the government has previously outlined that we have claimed public interest immunity over the requested documents, as disclosure would prejudice relations between the Commonwealth and the states and territories. And the government continues to reiterate our view that we cannot agree with this motion. We do, however, acknowledge the interest in the Chamber in continuing to reform the NDIS to get it back on track and ensure its sustainability for future generations of Australians. And I thank those Senate colleagues who have reached out to offer support for that broad objective. On the 8th of February 2024, the government tabled the final report of the independent review into the National Disability Insurance Scheme, and that was publicly released on the 7th of December 2023. The review delivered 26 recommendations and 139 supporting actions to respond to its terms of reference. In delivering its recommendations, the review provided exhaustive analysis and proposals to improve the operation, effectiveness and sustainability of the NDIS. The independent review panel has said that its reforms can improve the scheme and meet National Cabinet's annual growth target of no more than 8% growth by 1 July 2026. The NDIS bill was the first legislative step by our government towards ensuring this annual growth target is achieved, and the Minister representing the Treasurer has already tabled key documents for the benefit of the Senate in addition to the aforementioned review.
Senator Ruston. Senator Steele, I assume both of you are going to move to take note, so...
Thank you.
Senator Steele, John, you have the call.
Thank you, Acting Deputy President. Let's recap where we are. We are seeing confusion reign when it comes to the NDIS and the legislation that is meant to support it. The changes that the government rammed through last year are wreaking havoc in the lives of so many disabled people, their families and their allies. Participants are receiving conflicting information from staff. Agency staff are not interacting in a trauma-informed way. Planners continue not to read the evidence they have been provided with and have often requested. There is a continual pattern of planners and agency delegates making a call, giving a view in relation to clinical evidence that they are not qualified to assess. Meanwhile, we also continue to see agency staff breach participants' privacy through the sharing of confidential information without the consent of participants, continuing to email the wrong people with the wrong information again and again. This new 3-month funding period that has been introduced by the government continues to limit choice and control. Because guess what? Some people's funding needs and the expenses that go with them don't fit neatly into a 3-month funding period. Sometimes they need intense supports requiring additional funding for longer periods than 3 months. It just does not make sense. It's the type of bureaucratic nonsense that the NDIS was created to eliminate. The biggest casualty, though, of this new NDIS Act is the fact that the legislation no longer considers reasonable and necessary in its determination of funding or of supports. And what have we seen as a result of that? We have seen over 700 new appeals to the tribunal in May of 2025 alone. It also seems, by the way, that the Participant Service Guarantee, much celebrated when it was passed, has just been chucked out the window. In March 2025, in that quarter, only 9% of people who applied to get access to the NDIS had that request actioned in the required 21-day period. 9%. Meanwhile, the agency continue to make unreasonable requests on participants. Things like saying that they have 2 business days to apply in relation to the progression of complaints, an unreasonable deadline in itself, but then in fact closing the complaint as they hadn't received the information within their own 2-day deadline. We are continuing to see participants kicked off the scheme because of what appears to me to be a culture in the agency that prioritises media management over supporting participants and their families, seeing participants kicked off their supports because selectively edited bits of information were presented to a minister by a shock jock during an interview, resulting in a diktat to kick that participant off the scheme. What happened? 10 months later, after appeal after appeal after appeal, they got their funding back because guess what? The information the agency had was not sufficient to make the decision, and in fact, if the evidence was looked at, the person very much did meet the access requirements and needed those supports. This is an absolute shame on this government and indeed on the entire body of the political system dominated by the major parties. Both the Liberal Party and the Labour Party and the National Party should hang their heads in shame when they hear what is happening to NDIS participants right now. The fear and uncertainty, the cuts and the pain from people that deserve so much better. Well, we in the Greens will keep fighting for disabled people and their families.
Senator Ruston.
Thank you, Deputy President. Well, I too stand to speak on the sad fact that this government lacks transparency, and this is just another classic example of the government trying to hide what are clearly documents that are in the public interest about a scheme that is so important to so many Australians. And I heard the contribution of the new Minister for Disability and the NDIS, Senator McAllister, and I can only hope that despite the words that she just spoke, that she is going to be more transparent than those that have gone before her. Because the NDIS is important, as the Minister outlined, and it is not something that is owned entirely by the Labor Party. It has been the NDIS is something that's been supported across all areas of this chamber because we clearly all believe that it is very important that we support those people that live with permanent and stabilised disability by supporting them to have the opportunities, the best opportunities they can. But that is not the point of this particular attendance by the Minister. The point of the attendance of the Minister is based entirely around transparency. For months and months and months we've been coming into this place and hearing a whole heap of waffle around why this government will not release documents in relation to the financial sustainability framework for the National Disability Insurance Scheme. Nothing could be more important than the financial sustainability of this scheme because it goes to the very essence of what Senator Steele-John said, and that is supporting Australians who live with disability. So the government can say all they like about the scheme. The reality is they are not being transparent. In the process of not being transparent, they are denying Australians the opportunity to be able to look under the hood and see what's going on with this, to be quite frank, very expensive scheme that we want to make sure is delivering the best interests for those Australians that it was designed to support. But this is just another example of the lack of transparency of this government. In fact, the Centre for Public Integrity recently called out the alarming rise in the lack of transparency as delivered by the Albanese government as being deeply troubling. Well, it is deeply troubling because the purpose of this parliament and the purpose of this Senate is to make sure that we understand what's actually going on behind what the government is doing. They do not have the right as government to be able to cover everything up and not allow Australians to see what they are doing. So these motions like we have today and these attendances are really important to make sure that we do have a system by which the government is required to come into this chamber and answer the Australian people about what it is doing with the money that it collects from Australians through their taxes. The question it begs in all this is, what is the government hiding with its refusal to come in here and tell us and to provide documents that are absolutely fundamental to the administration of a very important scheme under the government? It goes to the fact that this is a government that's prepared to lie and then is prepared to go to actions to cover up those lies, because quite often, if information was made available, you would actually see that much of what the government is saying is actually untrue. We saw that with the Medicare campaign that they ran in the election campaign, only to find out that the department itself had told the government that their claims that the only thing you'd need when you went to see the doctor was a Medicare card was actually untrue. Their department themselves said that a significant number of practices would still require people to pay out-of-pocket costs, which we are seeing right now. We also saw the same thing, with the taxation that they took and promises they took to the election. We now find Treasury itself has been working up more opportunities to tax Australians more. Once again, if you don't have transparency, the government gets away with things that it would otherwise not be able to get away with if you were actually being honest with the Australian public about what you're doing. And this particular attendance by the Minister goes exactly to that point. The government needs to be transparent so that we know what you're doing, and it would actually also be in your own best interest, because then it would be very difficult to call you a liar if you're actually providing the information so that you can defend yourself on what you're saying. The fact that you keep hiding things and then found out for lying, I think, is a very sad indictment on the government.
Order. Sorry, Senator Ruston, please resume your seat. Minister.
Point of order. I'd ask Senator Ruston withdraw.
I don't think it's unparliamentary. However, for the smooth operation of the chamber, I will ask you to withdraw, Senator Ruston.
Thank you. At your request, I will withdraw, Deputy President. But it does highlight the fact that this government is quite happy to hide things that actually end up causing incredible distress and uncertainty to some of the most vulnerable people in our community. As Senator Steele-John pointed out, some of the things the government has been doing, the lack of transparency, the lack of consultation, all it does is to say to Australians who live with disability, this government actually doesn't care about you. We're happy to leave you as a government in a state of permanent uncertainty, which only creates distress. You should be ashamed of it, and you should come clean with those documents so Australians can see what you're up to.
Senator Scarr.
Thank you, Deputy President. I too rise to speak in relation to this matter and raise my concerns regarding transparency. I do want to touch on some of the points that both Senator Steele-John and the Minister made. Firstly, Senator Steele-John, I acknowledge and deeply respect your ongoing advocacy with respect to these matters, and the example which you gave of the participant being off the system and then having to go through numerous appeal procedures to get back onto the system is deeply disturbing, to be frank. And I hope that person's doing okay. It shouldn't come to that. I also acknowledge the responsibility which Senator McAllister has with her new portfolio. I note her comments with respect to the new portfolio. I note that she recognises the gravitas and the weight of the responsibility of this new portfolio. I also note her comment around engagement with those with lived experience of dealing with the system. I also note her reference to the introduction of the NDIS, and it should be noted that the NDIS was implemented with the support of all parties in this parliament, so the coalition certainly supported the introduction of the NDIS and supports the ongoing sustainable operation of the NDIS. There's no question about that. But what the Minister didn't touch upon was what goes to the heart of this matter, and that is transparency. This is one of the largest, if not the largest, social benefit schemes that the Commonwealth legislates and managers. Hundreds of thousands of Australians are impacted by this scheme directly and millions indirectly. And when you have a scheme of such magnitude, it is incredibly important that there's transparency around fundamental aspects of the scheme, and there can be nothing more fundamental than the financial sustainability of the scheme. And the Senate, discharging its role, discharging its obligation, sought documents which go to the heart of that financial stability. And all we've faced is roadblock after roadblock after roadblock constructed by the Albanese Labor government to give us the information, to give the Australian people through the Senate the information which they deserve with respect to the financial sustainability of this scheme. This isn't about the senators. This is about us discharging our role on behalf of the Australian people, discharging our role as a House of Review, discharging our role as an upper house to keep the executive accountable. That's what this goes to. And as Senator Ruston said, latest research indicates, including a report issued by the Centre for Public Integrity entitled "Still Shrouded in Secrecy." That's what the report says, still shrouded in secrecy. There has been an appalling lack of transparency on behalf of the Albanese Labor government. And I just want to quote some of these figures, which are quite shocking in many respects and which are quoted in this report. The compliance rate with orders for production of documents has fallen to 32.8%. 32.8%. Less than 1 in 3. Less than 1 in 3. That's the current performance rate. It's materially less than the performance of the previous Morrison government in the 46th Parliament. It's fallen from 48.7% to 32.8%. It's collapsed. It's collapsed. If you go back a number of decades, it used to be 90%. But 90% of the orders for production of documents called for by this Senate, called for by a majority of the senators sitting in this chamber, called for by a majority of senators representing a majority of states. Senators across the political spectrum representing all the states and territories have called for this information, and yet the government denies providing the information on the basis of parliamentary interest immunity. And there's no transparency as to why release of these documents would in some way compromise federal and state relations. I previously asked, did you ask the states whether or not you could release the documents? I would have thought that's the first thing you do. Is there any problem in terms of the states releasing the documents? And they won't even answer that question. So how can they make a substantial argument of parliamentary interest immunity?
Senator Kovacic.
Thank you, Deputy President. I too rise to speak in relation to the attendance by the Minister in relation to the NDIS. And I thank everyone that's spoken about it, and I associate myself with the comments of my colleagues, Senators Ruston and Scarr. And I also thank Senator Steele-John for his comments. When I started in my role as a whip in this chamber, I noticed this regular pattern on a Monday morning in relation to the NDIS. And one of the things that struck me was the fierce and relentless advocacy of Senators Steele-John, Senators Hughes and Reynolds in relation to this issue. And I thank you, Senator Steele-John and Senators Hughes and Reynolds in their absence now from this chamber, as to something that is critically important. And that's the right for Australians to know what is going on with the NDIS. That's the transparency that we speak of. They have spoken about this throughout the entire 47th Parliament. And here we are again at the beginning of the 48th Parliament, and those questions have not been answered. What is fundamentally at the core of what we are asking is for basic information around what is happening with this scheme. That shouldn't be very hard to answer, but what is even more concerning is why the secrecy. Why won't this be disclosed? Why are we here every Monday of a sitting period asking this same series of questions? Why does Senator Steele-John have to keep asking these questions? Why did Senator Hughes and Senator Reynolds keep asking these questions? Because we haven't had the answers that we deserve to have. And as Senator Scarr rightly put, we're not asking for ourselves. We're asking for Australians. We're asking for those in the disability sector. We're asking for Australian taxpayers. And we're asking for some of our most vulnerable Australians who are meant to be protected by this scheme. The Coalition wants a strong and sustainable NDIS. We want to ensure that we protect the people that need it, but we also want to make sure that we punish the people that abuse it, those that most egregiously abuse a system that is there to protect some of our most vulnerable and to provide them the dignity and independence that the NDIS should deliver. That's where we stand on this. We want clear answers to the questions that have been asked in this Senate chamber for the past 3 years. And we'd also like an understanding about why you want a process where we are constantly asking these questions with no answers, especially from a Prime Minister who campaigned before the 2022 election on a transparent government, on a government that will tell you what is going on. Well, anybody that wants to see whether this government is transparent or not just needs to listen to what is happening here this morning and have a look at the Hansard of every other discussion related to this one, because there has been no transparency, none whatsoever. Senator Steele-John made a comment about planners that I wanted to touch on as well. We were in Senate estimates when this came up, and there was a collective chin drop where we found out that participants are being forced to go through the process, costly and time-consuming process of putting together evidence that the NDIS has asked of them in relation to their plans. Time and energy and resources that should actually be spent on the care of participants, but instead, a report, they provide that report, and guess what? No one reads it. Yet, if they were not to submit or provide that report, the example that Senator Steele-John provided of someone who lost their plan and would have to fight to get it back would eventuate. Why are we standing by and allowing that? Why are we forcing families who have children with permanent conditions to provide evidence of those conditions year on year or plan on plan? Something that is permanent is not going to change. There is something fundamentally wrong here, and this government needs to explain to us why they won't give us the information that we're seeking, why they won't make this simpler, and why they have made hard-working senators in this place rise week after week to get the answers.
There being no further contributions, the question is that the Senate take note. Those of that opinion say aye, against say no. The ayes have it. Clerk.
Government Business Order of the Day number 1. Health Legislation Amendment Improved Medicare Integrity and Other Measures Bill 2025. Resumption of debate on the second reading and the amendment moved by Senator Steele-John.
Senator Murray-Smith in continuation.
Thank you, Deputy President. Yes, I'm in continuation from my remarks late last week. Seeing a GP regularly helps to catch health issues early before they worsen and escalate, needing more intensive and more costly care. And that's why the Albanese Labor government is investing $660 million in a workforce package that will expand the largest GP training program in Australian history. We're training 2,000 new GPs a year by 2028, supporting hundreds of nursing scholarships and helping overseas trained doctors register faster, with 17,000 joining the system in the past 2 years alone. We've expanded bulk billing incentives to all Australians and introduced a new incentive for practices that bulk bill every patient. Bulk billing is rising again in every state and territory, and we are doing this because we know bulk billing is something that Australian families rely upon. In fact, it's a critical part of our Medicare system. Our record investment in Medicare restores every dollar the Australian Medical Association says was cut from Medicare through the funding freeze implemented by the previous coalition government. This is a policy about lifting up our nation and ensuring no one is held back, and of course no one is left behind. We also promised 50 Medicare urgent care clinics, but we delivered 87, and more are on the way. Another $658 million to open 50 more clinics nationwide. 5 of those will be in my home state of South Australia, with an additional 3 announced earlier this year, including in my community of Sturt, something that our local MP, Claire Clutterham MP, was a fierce advocate for and was very pleased to see announced. These clinics provide free walk-in care 7 days a week, taking pressure off emergency departments and saving families time, stress and money. Over 1.5 million patients have walked through the door of a Medicare urgent care clinic and received the free urgent care they need. I am one of those patients. I've taken both myself and my children to these clinics, instances where we would have otherwise been going to the emergency department. Our Medicare urgent care clinics have filled a much-needed gap in our healthcare system. Now, patients all around the country, including parents of young children, just like me, don't have to spend hours in a hospital emergency department. We're building on our historic investment in Medicare to take pressure off hospitals and make free urgent care available to Australians in every community with the launch of 1800 Medicare, a free nationwide 24/7 health advice line and after-hours GP telehealth service. And of course, when it comes to women's health, an area of public policy which I've been advocating for my whole parliamentary career, we are providing Australian women with more choice and better treatments at a lower cost. And when it comes to women's health, as I've said many, many times in this chamber, you simply do not need to look very far to see where women's pain and symptoms are too often ignored, and often their pain and symptoms have been outright dismissed. We've seen this with endometriosis. We certainly see it with symptoms of menopause and perimenopause, but we see this right across the spectrum of women's health issues, and that has to change, because the consequence of it is women have been suffering in silence, and they should not have to in a modern Australia. Now, the Senate inquiries, which we ran in this place last year into maternal health and into menopause and perimenopause, helped spark a national conversation about the level of support women were getting and where they were being let down. And I am deeply proud that our government has invested in women's health so significantly, some $800 million worth of investments in women's health. This is a massive step change in the way women's health is funded, in the way women's voices have been heard, and in the way we've chosen to prioritise these issues within our healthcare system when women have been ignored and silenced for far too long. We're making contraceptives cheaper and funding more treatments for menopause. From the 1st of July, new menopause and perimenopause health assessments are available under Medicare so that women can receive the holistic care that they need from their family GP when they need it. We know to have these conversations with your GP, you simply need more time, and that's what this investment achieves. And we've also added contraceptives like Yaz, Yasmin and Slinda to the PBS, giving women more choice at a lower cost. And for many of the women who use these medications, there is no alternative. The consequences of other medications are too high. We need these medicines on the PBS so women have that choice, the choice to access the medicines that work for them and their bodies. And we've also added hormone replacement therapy and IVF medications to the PBS, some of these for the first time in 20 years. For decades and decades and decades, there was just simply no action to provide and fund diversity and more choices for women when it came to the PBS. That has changed now. And we're also helping Australian women suffering from endometriosis and complex gynecological conditions to have access to longer specialist consultations, also covered under Medicare. We've opened Australia's first endometriosis and pelvic pain clinics, and we will open an additional 11 clinics to bring it to a total of 33 across every state and territory. These clinics do amazing work. I've visited the Thrive Clinic in South Australia. I've met with their patients time and time again, as well as their practitioners. This is life-changing care, which is enabling women not just to get the health care that they need, but also to re-enter the workforce. Endometriosis can be debilitating, so can pelvic pain. These clinics are absolutely changing lives. We need more of them, and we have that investment. It's about receiving care which is tailored to your needs as a woman, and care where you felt listened to, understood, well treated, and like your pain and your symptoms aren't being dismissed. Women have told me that before accessing the support of these specialist endometriosis and pelvic pain clinics, they had been dismissed and told things like, if you have a baby, your endo will go away. It's nonsense, it's not true, and we need better quality care for these women. We're also expanding the remit of these clinics to help women with symptoms of perimenopause and menopause. Again, not an optional part of a woman's life journey at all. Any woman fortunate to reach midlife will go through menopause. So the idea that we simply haven't had appropriate care for women in this stage of life is nonsense. It is not optional for women. Good quality healthcare and treatment for menopause should not be optional either. We are determined to build a stronger, fairer healthcare system, one that does not dismiss women's pain, but responds to it with compassion, expertise, and the time women need with their GPs. We're strengthening Medicare with real, lasting support for women's health. I am extraordinarily proud of this work and have been extraordinarily proud to advocate for it. We're also making medicines cheaper than ever before, cutting the maximum PBS co-payment to $25 and expanding 60-day dispensing. We know Australians have saved over $1 billion on scripts under the Albanese Labor government. This is a key cost of living measure. We don't want a single Australian to forego medicine that they need because they cannot afford it, and we know this has happened. Having already slashed the cost of medicine with the largest cut to the cost of medicines in the history of the PBS in 2023, we are going further. This represents a more than 20% cut in the maximum cost of PBS medicines, which will save Australians over $200 million each year, again delivering real cost of living relief for Australians. We're also investing to protect the next generation of Australians from harm with world-leading vaping reforms and a $350 million crackdown on illegal tobacco, supporting our health and law enforcement agencies. Finally, we are delivering an extra $1.8 billion to public hospitals next year, bringing our Commonwealth contribution to a record $33.9 billion in 2025-26, and there will be further long-term reforms underway. This one-year agreement means Australians will benefit from better funded public hospitals as cooperation builds on long-term sustainable health system reform. From doctors and nurses to public hospitals and urgent care, from integrity in the system and compliance to cheaper medicines, our government is working to strengthen every part of Medicare. This is what Labor does. We created Medicare. It is part of our legacy, and only a Labor government will continue to protect and strengthen it. This is in stark contrast to the Liberals and the coalition government previously, who cut $50 billion from public hospitals and froze the Medicare rebate. We are building a system which supports Australians with the cost of their healthcare, which makes sure women's voices are heard, which doesn't dismiss their pain, but actually funds women's health properly and takes these issues seriously. We are investing Medicare, but we are also doing what we need to strengthen the integrity of it. It is too important for Australians not to, and I commend this bill to the Senate.
Thank you, Senator Smith. Senator Scarr.
Thank you, Madam Acting Deputy President. The Coalition supports Medicare. The Coalition supports Medicare. Funding into Medicare increased every single year under the former Coalition government. So every single year that the Coalition was in government during the last, before the election of the Albanese government, every single year, year on year, there was an increase, every year, in Medicare funding. So the first year, we went from, when we came to power, there was $18.6 billion of funding under Labor in 2012 to 13. 18.6 billion. When the Coalition left office in 2021 to 2022, the funding was 30 billion. 30 billion. Under Labor, 2012 to 2013, the figure was 18.6 billion. Under the Coalition, in its last term before the election, it had increased to 30 billion. Nearly an increase of $12 billion through the terms of 3 coalition governments. So they're the facts. They're the facts. We have a system in our country where both parties of government support Medicare, and rightly so. And rightly so. Absolutely. I should note also that Medicare bulk billing was higher under the Coalition than it was under the last term of the Labor government. It was actually higher under the Coalition. Bulk billing rose consistently across our entire term of government. It rose to 86% before the COVID pandemic, and it was a record high of 88% when we left government. 88%. In the Coalition's last year in government, there were 167.2 million free GP services delivered, and this is 61 million more than the previous Labor government. 61 million more. Now, I'd forgive those listening to the debate if they were surprised by those facts because of the rhetoric coming from the other side. But the fact of the matter is the Coalition supports Medicare and has always supported and always will support Medicare as being a foundational principle of making sure Australian people have access to the medical services which they expect in this country. The Coalition also has a proud record of supporting a strong PBS in this country. In government, we made 2,900 new or amended listings on the PBS to expand access to cheaper medicines. And I know, Madam Acting Deputy President, that some of the achievements which mean the most to representatives in the other place and to senators in this place is when they have advocated on behalf of constituents and their families who have sought the listing of a PBS medication where it has been life-changing. When families have been faced with the awful predicament where there's only one drug available to treat a chronic condition, and without it being listed on the PBS, it would cost hundreds of thousands of dollars and they simply wouldn't be able to afford it. And I would like to place on the record in this context, and I think it's appropriate to do so, I'd like to place on the record my gratitude to Senator Ruston when she was Health Minister and now in her existing role, and to one of her advisors, Lily Ballum, in relation to the work that they've done in that particular regard, in relation to getting drugs listed on the PBS, and for listening to representations I've made in that regard. It's greatly appreciated. So the Coalition has a proud record of supporting the PBS. Our last term in government, the funding for Medicare increased from $18.6 billion when we took government back in 2012-2013 to $30 billion in 2021-2022. So don't accept this propaganda, this nonsense about the Coalition not supporting Medicare, because all the facts are to the contrary, including the money that's been spent. That increased between $18 billion to $30 billion. Those are the facts. So don't listen to the political rhetoric and the propaganda. The Coalition has also supported and focused on mental health and suicide prevention, something very close to my heart and something which is extraordinarily important to the people of Queensland. And I particularly refer to those regions of Queensland which don't have access to mental health specialists and practitioners. In many cases, a few hours out of town, a few hours drive out of Brisbane, there are areas which have unacceptable rates of suicide and attempted suicide, who simply do not have the practitioners on the ground to provide the services people in those areas need. And I've spoken to families who've been impacted in that regard, and those discussions are absolutely heartbreaking, absolutely heartbreaking. And in that context, I note that the Labor government took away Medicare mental health sessions from 372,000 vulnerable Australians. And in that regard, they went against the advice of their own review, and all of the Australian peak mental health experts. They cut away those mental health sessions, and they were critically important to some of our most vulnerable Australians struggling with mental health issues. And that was a great tragedy. And I would like to see those reinstated, ideally would, because I think that those are the things which make such a difference to people's lives. Data from the Productivity Commission in that regard shows that access to Medicare mental health support has fallen to the lowest point in at least 10 years. In at least 10 years, we've gotten to the lowest point of access to Medicare mental health support. That's a shocking state of affairs. We all know, people listening to this debate will know, of people struggling with mental health issues, and then when they seek help, they're faced with these awful waiting times to see the specialists they need to see. It's heartbreaking. Under Labor, mental health has been completely neglected. They cut the Medicare subsidised mental health sessions in half. They abolished the National Mental Health Commission, and the chair of Mental Health Australia even resigned out of frustration for the Prime Minister's neglect of mental health and refusal to meet with him. This is a crisis. There's a mental health crisis in our country, impacting so many vulnerable young people in our society. This should be one of the greatest priorities of government, to try and deliver services to the people most in need in this regard. I'd also like to refer to the Prime Minister's Medicare election promise. The Prime Minister said, under Labor, and I quote, you all heard this many, many times, under Labor, all you'll need is your Medicare card, not your credit card, end quote. And when that statement was trotted out, you'd wave the Medicare card around and the credit card and whatever else. But the Department of Health's incoming government brief, so if you want to know what's really happening, one of the things to do is to look out for the incoming brief that the actual department prepares and submits to an incoming government, whoever wins the election. The department actually advises the government of the day, whoever won the election, what's actually happening, what's actually happening on the ground. And this is what the government's own incoming government brief said. This is what the department told them. Now, this had to be released under FOI. Someone had to go through the Freedom of Information Act process to actually get this truth, from the government department. It estimated that a quarter, 23%, near enough to a quarter, of GP clinics across Australia will not bulk bill, despite all of the Albanese Labor government's promises. That's what the specialists in the department are saying. In the incoming brief to the government, after the Prime Minister had run around the country waving his Medicare card and saying, quote, under Labor, all you'll need is your Medicare card, not your credit card, end quote, the government's own department, considering the promises made by the Labor Prime Minister during an election campaign, the department actually belled the cat in relation to the issue and said, again I quote, a quarter, near enough, 23% of GP clinics across Australia will not bulk bill, despite all of the Albanese Labor government's promises. And this data from the Health Department shows that millions of Australians will still need their credit card, notwithstanding what the Prime Minister promised to the Australian people during the course of an election campaign. What the Prime Minister said during the course of an election campaign is totally disconnected from the reality which the Australian people are going to face now that the Labor government was re-elected. The reality is going to be different from the election campaign. And this data from the Health Department has said that millions of Australians will still need their credit card as well as their Medicare card when they go to see a GP. Nearly a quarter of medical clinics will not bulk bill, notwithstanding the promises made and the statements made by the Prime Minister. And the worst part of all this is that when Australians are charged, their credit card is charged to go and see their GP, they're being charged the highest out-of-pocket costs on record under Labor. The highest out-of-pocket costs on record under Labor. At a time when they can least afford it, Australians are forking out more than they've ever had to do before from their own pocket to access essential health care. And it is really quite appalling that the Prime Minister made those representations during the course of an election campaign And then the incoming brief. It's not like there was 12 months that passed between when the Prime Minister made these statements and when the advice was received from the department. It's not as if there was a change of circumstances that one could reasonably accept. These promises were made by the Prime Minister during an election campaign, and the incoming brief from the Department of Health, that knows the data, knows the reality, said it can't be achieved. You're not going to achieve what you promised. Barely a month had passed. That's the reality. And this calls into serious question Labor's claims that by 2030, 9 out of 10 visits to the GP will be free. How does that stack up if the department's actually saying that 23% of GP clinics aren't going to bulk bill? How do you achieve that figure of 9 out of 10 visits to the GP being free? It's impossible. It's impossible. The Prime Minister needs to be transparent with the Australian people. Was this advice provided to the government prior to the election? Did the Prime Minister know that the Department of Health, who knows the data, who understands the process, who are the best to give these estimates, did the Prime Minister know that the Department of Health, notwithstanding the Labor government's promises, that the Department of Health estimated that a quarter, 23% of GP clinics across Australia would not bulk bill? Did the Prime Minister know that? Did the relevant minister know that? And if not, why not? If not, why not? Why not get the data? Why not get the opinion from the relevant government department before you make the promise? Isn't that the way it should work? Get the data, get the opinion of the senior public servants who are across the system before you go out to the Australian people and make a promise. And now we're in the situation where there's a complete disconnect between the promise that was made by the Prime Minister, waving around his Medicare card, and the reality as told to us by the public servants who are the ones in charge of managing the system, who are at the coalface in terms of managing the health system. That's the situation we have. The reality of Medicare under Labor is that Labor promised to strengthen Medicare, but it's only been weakened since they were elected. Medicare bulk billing fell by 11% under Labor. 11%. GP bulk billing has fallen from 88% in the last year of the coalition government. Bulk billing was at 88%. Under Labor, it's fallen to 77%. And they want to pat themselves on the back as if they've achieved some great things in this space, when under their watch there was a material decline in bulk billing. And that translates to 40 million less bulk billed GP visits in the past year alone. 40 million less bulk bill visits to GPs in the last year alone under Labor. Australians are now paying 45% more of the cost to see a GP from their own pocket, and out-of-pocket costs have literally reached the highest level on record under Labor. This data from the government's own national accounts shows that more Australians are having to use their credit card along with their Medicare card, notwithstanding what the Prime Minister promised during the course of the last election campaign, and they're being charged the highest amount of out-of-pocket costs on record. The sad reality of our healthcare system under Labor is that it has forced more than 1.5 million Australians to avoid seeing their GP because they can't afford to. 1.5 million Australians avoiding seeing their GP under Labor because they can't afford to. A devastating statistic which makes it so unsatisfactory for Labor to be standing up here in this chamber patting themselves on the back.
Senator Dunman.
Thank you, Acting Deputy President. In the months leading up to this year's May election, I spent countless hours out in the Victorian community, knocking on hundreds and hundreds of doors, speaking to hundreds and hundreds of people on the phone, talking to them about what their concerns were, what their experiences were, and what they want to see from our country, for our country. I spoke to parents and young people, those juggling jobs and care. I spoke to older Australians who have worked throughout their lives and now need more support to access the care they deserve. and I spoke to students navigating their futures and migrants making Australia home. What I heard was really clear. People weren't asking for the world, they were asking for something much more fundamental, something that should be a given in a country like ours. They wanted a government that listens, one that focuses on what really matters: healthcare, housing, education and a fair go. That's exactly why we went to the election with a clear plan to protect and expand Medicare, putting it at the front and centre of our agenda. And Australians responded resoundingly at the ballot box, re-electing a Labor government committed to delivering on these promises. And I'm proud to be a part of that government. One of the issues raised with me time and time again across Victoria, no matter their background or circumstance, was healthcare. Parents wanted to know if they could get their kids to a local GP when they had a fever, a sprain or a worrying rash. Women bravely shared their stories of long and painful journeys through the healthcare system, searching for answers that never came quickly or easily. Older Australians told me of the frustration and anxiety that comes from not being able to afford care or get a timely health appointment. And these are stories along with statistics. They are the reality for millions of Australians, and I want to thank the people who shared their stories with me over the last 3 to 4 months. It's really not easy to open up to someone that you've just met when you're talking to them on their front doorstep or on the phone. It is a privilege to hear these stories, but it is also a responsibility that we must act on them. And that is exactly what this government is doing. Labor created Medicare, we protected it, and now we are strengthening it for the future. When we came to government in 2022, it had never been harder or more expensive to see a doctor. After nearly a decade of cuts and neglect under the coalition, bulk billing was in freefall. General practice was on the brink. People were delaying important treatment that they needed. They were waiting longer, they were paying more, and some were walking away from the system altogether, giving up. Strengthening Medicare was at the heart of our election commitment, and it remains a top priority for our government. In just 2 years, we've delivered the largest investment in Medicare since it was established more than 40 years ago. A whopping $8.5 billion to strengthen bulk billing, boost the workforce and improve access to urgent care. Let me share what that means on the ground. We promised to open 50 Medicare urgent care clinics. We've already delivered 87 urgent care clinics, well ahead of schedule. And we are not stopping there. We're opening another 50 clinics, bringing the total to 137 across the country. That means 4 in 5 Australians will now live within 20 minutes of one of these clinics. These clinics are open 7 days a week with extended hours. No appointment necessary. They accept walk-ins, and they don't need a Medicare card, just your Medicare card. And they are already having a huge impact. Over 1.5 million people have walked through the doors of a Medicare urgent care clinic across the country and received the urgent care that they need, without the wait at a busy hospital emergency department, reducing the strain on our public health system. And I've seen this impact personally. Earlier this year, my dad was visiting from Queensland in Melbourne when he came down with a nasty ear infection on a public holiday weekend. Rather than have to wait hours at an emergency department hospital, the urgent care clinic near my house meant he could see a doctor quickly, get the urgent treatment that he needed, and enjoy the rest of his stay with us. These are the kinds of services that we hope we never need, but are grateful when we do. It's easy to reduce healthcare reform to lines in a budget, but the real value is what it means to people's lives, not having to wait in pain, not having to choose between groceries and a GP visit, not having to rush to an emergency room and then wait for hours because there's nowhere else to go. This is what government is for. Not having to rush to an emergency room and then wait for hours because there's nowhere else to go, And that's the kind of stress and uncertainty no one should have to face. That is what good government is for, to make sure essential services are there when people need them, to provide security in uncertain moments, and to ensure that care is available not just for some, but for everyone. And this is how Labor government governs, building a country where dignity, fairness and compassion aren't just values that we talk about, but principles that we put into action. But we know that urgent care is only part of the solution. Australians need regular, ongoing access to high-quality, affordable care. That's why we're reversing the damage done to Medicare by the Coalition's funding freeze, and we're going further. In just 2 years, we've delivered the 2 largest increases to Medicare rebates in 30 years. As a result, bulk billing rates are on the rise again in every single state and territory. We're also making a transformative change to bulk billing incentives. For the first time, we're expanding them to all Australians, and we've created a new incentive for practices that bulk bill every patient. This will mean 9 in 10 GP visits will be bulk billed by 2030. And the number of fully bulk billed clinics will triple to around 4,800 nationally. It's not just good health policy, it's smart economic policy. Notwithstanding what you heard earlier from Senator Scarr, our government has a track record in health, and protecting Medicare is in stark contrast to those opposite, and I think the Australian people know it. Because we all know that regular checkups, preventative care and early intervention can catch issues before they become crises. It keeps people out of hospital and in their communities living healthy and productive lives. We know these reforms aren't something that can be willed into existence with the wave of a magic wand. This is not just feel-good policy, it is important for a productive and healthy society. We are conscious always of the impact these reforms will have on the workforce. And we know that to achieve the level of bulk billing that we aspire to, we need more doctors. And that's why we're also investing $662 million in the largest GP training program in Australian history. By 2028, we'll be funding 2,000 new GP trainees every year. And we're expanding our capacity with overseas trained doctors too. 17,000 new doctors have joined the Australian system in the last 2 years, more than at any time in the past decade. We're not just filling the gaps, we're building a future-ready healthcare workforce. And for Australians managing chronic conditions or filling prescriptions every month, we're delivering real cost of living relief. In 2023, we made the largest cut to the cost of medicines in the history of the Pharmaceutical Benefits Scheme, reducing maximum script prices by more than 20%, saving Australians over $200 million a year. We've made around 300 medicines available on a 60-day prescription, and we've lowered the PBS safety net threshold, saving Australians more than $1 billion on their medications so far. Over $1 billion in savings. That's more money in the pockets of Australians. And from January, you won't pay more than $25 for a PBS script. For pensioners and concession card holders, the price of a script will be frozen at $7.70 until 2030. The last time medicines were $25, it was 2004. We were all watching the Athens Olympics and the classic Jets banger, "Are You Going to Be My Girl?" won Single of the Year at the ARIA Awards. Because when people can afford their medicine, they take it. When they take their medicine, they stay well. Making medicines more affordable and accessible means people can stick to their treatment plans, manage chronic conditions more effectively, and avoid preventable hospital visits down the line. And when they stay well, they live better and they live longer. And it sounds very simple because it is. And it's one of the most powerful ways we can build a fairer health system. A system where no one misses out on the care that they need because of their income or circumstances. A system that doesn't just treat illness, but also protects dignity. because in a country like ours, no one should be left behind. We're also delivering a record funding for public hospitals with an additional $1.8 billion next year alone, bringing the Commonwealth's contributions to over $33.9 billion in the year 25 to 26. That's a 12% increase year on year, and a stark contrast to the Coalition, who cut $50 billion from our hospitals when they were in office. This investment will support the long-term reform of our health system in partnership with the states and territories, because public hospitals shouldn't be political footballs. They should be at the centre of care, staffed and resourced to meet the growing needs of our population. And finally, we are acting boldly on the health challenges of today, especially when it comes to young people. We've introduced world-leading reforms on vaping to protect children and adolescents, and the results are already coming in. The Cancer Council's Generation Vape study shows that vaping rates amongst 14 to 17-year-olds are on the decline. We're also cracking down on the black market in illegal tobacco, investing in over $350 million to give law enforcement the tools that they need to fight criminal activity and protect public health. All of this, the clinics, the doctors, the cheaper medicines, the cracking down on vaping, forms part of a single, simple mission to restore fairness, equity and dignity to the healthcare system. It's a promise, a uniquely Australian promise, that we look after one another, especially in moments of vulnerability. It reflects the best of who we are, that no matter your income, no matter your backgrounds or your postcode, you should be able to see a doctor and get the care you need when you need it in your community. It was a Labor government that built Medicare against fierce resistance, because we believed then, as we do now, that access to healthcare should be universal. Access to healthcare should not be something reserved for the wealthy or the well-connected. Labor created Medicare. We defended it from cuts and attacks. And now, under the Albanese Labor government, we are strengthening it and we are expanding it for the future. Because Medicare isn't just a health system, it is one of the defining achievements of modern Australia, a cornerstone of our social compact, which is why it was also a cornerstone of our election campaign, and the Australians roundly supported our agenda. It says something profound about the kind of country we are and the kind of future that we want to build: fairness, compassion, and a commitment to equality. And that is the Labor difference. We don't just talk about fairness, we legislate, we fund it, and importantly, we deliver it. And we don't just protect Medicare, we fight for it. We make it better because we believe healthcare is a right and not a privilege. Under Labor, the promise of Medicare will endure, and we will never stop working to ensure that promises reach every Australian, not just in name, but in reality. Labor made that promise decades ago, and we will continue to deliver it. Under this government, we're making good on it again through this bill. We are investing in healthcare not as a luxury, but as a right. We are rebuilding Medicare not for headlines, but for people. And we are doing the work, day in, day out, to ensure no Australian is left behind when it matters most. Thank you.
Thank you, Senator Darmanin. Senator Hume.
Thank you, Acting Deputy President. I rise to speak on the Health Legislation Amendment Improved Medicare Integrity and Other Measures Bill 2024, and I alert the Chamber now that my contribution won't be excessively long today, but I do think that it is very important to put things on the record, because let's face it, this bill in itself is not highly controversial, but the issue of healthcare in Australia is a very contentious one. The bill specifically seeks to strengthen the integrity of our health system. It implements recommendations from the Phillip Review to improve compliance, to deter misconduct, to protect the integrity of programs like the Medicare Benefits Schedule and the Pharmaceutical benefits scheme, all noble objectives. And the Coalition supports this legislation. They are sensible reforms, that they respond to real challenges. They improve detection and oversight and enforcement that's necessary to ensure that our health system remains fair and accountable and sustainable. So this is an important bill, but let's face it, this is compliance legislation. It's important, but it's kind of dull and it's uncontroversial. So why are we all up here talking about it? Because we cannot avoid the broader reality. While the government is bringing forward this compliance legislation, this entirely uncontroversial, rather dull but important compliance legislation, Australians are struggling with the cost and accessibility of basic healthcare. And that's why it's so important to speak about it in the chamber today. Because those up in the gallery, those on broadcast that are listening to this debate, had they have just listened to the Labor contribution, would have been subjected to the most extraordinary spin that is not dissimilar to what we heard during the election campaign. And as much as I respect Senator Darmanin and her contribution today, I've got to say there needs to be a correction of some of the facts. Senator Darmanin said when Labor came to government in 2022 that it had never been more expensive nor more difficult to see a doctor. Well, that is not true. That is not true. In fact, it had never been more difficult or more expensive to see a doctor when Labor was in office. It got worse over the last 3 years. Under a coalition, GP bulk billing fell. It was at its highest level under a coalition government. It was at 88%. That's where GP bulk billing levels were at. Under a Labor government, the great champions of Medicare, it fell to 77% on their watch. On their watch. In the past year, there were 40 million fewer bulk billed GP visits. Now, that's not marginal change. That's a system under pressure. And I'll bet you, Acting Deputy President, that the people that are sitting up in the gallery today will nod along. It has become harder and it has become more expensive to see a GP in the last 3 years. Australians are now paying 45% more of the cost to see a GP from their own pocket. Out-of-pocket costs are now, under a Labor government, the highest that they have ever been on record. So, last year, more than 1.5 million Australians actually avoided seeing their GP because they couldn't afford it. In a cost of living crisis, they traded away their health for putting food on the table. That's what happened under a Labor government. Now, this isn't just coalition commentary. This isn't just some sort of convenient narrative. It's the government's own data that told us this. And it's not just a policy issue, is it? This isn't just about dollars and cents. This is now a public health risk. Despite all of this, the Albanese government has continually relied on spin when it comes to healthcare. Just 2 months ago, we saw the Prime Minister endlessly, over and over again, promise to strengthen Medicare as he waved his Medicare card around. He said that you won't need to rely on a credit card because you'll have a Medicare card. Well, what nonsense. How many Australians still rely on not just a Medicare card, but their credit card? How many people need their credit card? How many people are suffering because they will not go to a doctor because they cannot afford to under this government? So why won't the Prime Minister be honest with Australians about the state of bulk billing in Australia? They're completely out of touch with the reality of the pressures that Australians are facing every day. The fact is that Medicare bulk billing was 11% higher under a coalition government. It's an inconvenient truth, but it is a truth nonetheless that the Labor government simply will not mention. Under a coalition government, Medicare funding increased year on year. Again, another inconvenient truth. It increased year on year because of our commitment to a strong and sustainable Medicare system. Strong and sustainable. We introduced Medicare subsidised telehealth services during COVID. And initially they were temporary, but the telehealth services have proved popular and now they've been made permanent for many services, and that's expanded access for people in regional areas. Now, if it wasn't for the Coalition, that would not have happened. The Coalition invested in primary health networks and GP clinics, especially in remote communities that have found it so hard to access quality healthcare in the past. And that has supported the need, and we've also supported the need for urgent care clinics. Importantly, the Coalition legislated a guarantee of Medicare and the PBS, enshrining that ongoing funding into law. Profoundly important change that should give comfort to every single Australian that the Coalition is on side of Medicare and the PBS, that we're on side of every Australian that needs and deserves quality healthcare. Now, that's a record of action. It's not a record of spin. Compare that to what Australians have seen today, a rise in unaffordable healthcare over the past 3 years, and that's because directly of decisions that this government has made. The Prime Minister has made a lot of promises. He made a lot of promises at the election, and the Coalition will be watching this situation very closely every single day to ensure that every single one of those promises is met. Let's be clear about exactly what this bill does. It strengthens the administrative tools that are needed to protect the integrity of the health system. It targets fraud. That's a good thing. It improves the ability of government agencies to enforce compliance. Again, terrific. They're worthy objectives. The Coalition supports them. That is entirely uncontroversial. But the bill does not address the affordability crisis that's currently facing families, pensioners, patients in regional Australia. In other words, it fixes the back office, but it doesn't fix the front door of the health system. Labor promised to fix Medicare. They promised to strengthen Medicare. Instead, GP bulk billing has fallen and Australians are paying the highest amount of out-of-pocket on record. The Coalition will support the bill because we understand and believe that all Australians deserve timely and affordable access to healthcare that they need. Of course we will. Of course we will. But we also believe that Medicare must work for patients, not just for compliance departments and not just for bureaucrats. Australians deserve more than slogans. They deserve so much more than slogans when it comes to their healthcare. They deserve more than watching a Prime Minister wave about a Medicare card and call it a promise. They deserve to be able to go to a GP appointment with only their Medicare card, as Labor has promised. And if by the time we get to the next election, if they haven't delivered on that promise, well, we will hold them to account. And I hope that the electorate will too, because otherwise it says we're happy to be lied to by Labor. I commend this bill, but I will condemn the Albanese government for its spin over substance and for its damaging record on Medicare.
Thank you, Senator Hume. Senator Sheldon.
Thank you, Acting Deputy President. I rise to speak on the Health Legislation Amendment Bill 2025. Now, this bill demonstrates yet again a clear truth in how most policies work in our country. The Liberals and Nationals, either intentionally or by their own incompetence, create a crisis and Labor comes in to clean it up and to clean their mess up. And that's exactly what's happened with healthcare. Under the previous government, Medicare faced nearly a decade of neglect and deliberate undermining. Australians watched bulk billing rates collapse, Medicare rebates remained frozen, and our healthcare system stretched to breaking point. When we came to office in 2022, Australians found it harder and more expensive than ever to see a doctor. Families faced impossible choices between healthcare and essential bills. Hospitals across Australia felt the pressure of chronic underinvestment, starved by the Liberals' relentless cuts. $50 billion. Now remember that figure. $50 billion. That's what the Liberal and National Coalition ripped out from public hospitals. Those cuts weren't just numbers on a spreadsheet. They had real, devastating consequences for Australians. It meant fewer nurses on the wards. It meant regional hospitals shutting down services. It meant cancer patients waiting longer for life-saving treatment. It meant emergency departments overflowing, parents waiting through the night with sick kids, elderly Australians left in pain because there weren't enough staff or beds to help them. In some communities, those cuts literally cost lives. Because when you strip $50 billion from public hospitals, you're not just cutting dollars, you're cutting care. You're cutting staff. You're cutting hope for families who depend on the public health system. And it wasn't an accident. It was a deliberate, ideological decision from a coalition government that has always hated Medicare. This was the coalition's legacy: cuts, neglect, and disregard for Australians' fundamental healthcare needs. That's why Labor is reversing those cuts. Next year alone, we are delivering an additional $1.8 billion in funding for public hospitals and health services. And in 2025-26, the Commonwealth funding for state-run hospitals will reach a record of $33.91 billion, year-on-year growth of 12%. Now, this isn't just restoring what was lost, it's building a stronger, fairer, and more resilient hospital system for the future. Now, we came into office with a clear commitment to revive and strengthen Medicare, a commitment Australians decisively endorsed at the ballot box. In our first term alone, we are delivering the single largest investment in Medicare since its creation more than 40 years ago. This $8.5 billion investment delivers more bulk-billed GP visits, thousands more doctors, hundreds of nursing scholarships, and significant improvements to patient care. For the first time, Labor is expanding bulk billing incentives to all Australians, not just children or concession card holders, and creating a new incentive for practices that bulk bill every patient. By 2030, 9 out of every 10 GP visits will be bulk billed, and fully bulk billed practices will triple nationwide to around 4,800. Now, already, our investment has delivered an additional 6 million bulk billed GP visits in just over a year. And this is also being recognised by healthcare professionals around the country. Associate Professor Magdalena Simonis from Victoria, from the Royal Australian College of General Practitioners, acknowledged this investment earlier this year, stating, contrary to what people say across the way, this is the facts. And she said, "This injection of funds into general practice makes good sense after such a long period of neglect from governments." Dr. Edward Cruz from Queensland described this as a much-needed boost to general practice. And Dr. Tim Senior from the RACGP, Aboriginal and Torres Strait Islander Health Faculty, said, "This is particularly welcome in practices serving socio-economically disadvantaged communities, where many people can't afford co-payments." Now, Labor values the healthcare professionals in this country and will be supporting their needs head-on. We're funding Australia's largest ever GP training program. 2,000 new GP trainees each year by 2028. Additionally, an extra 17,000 overseas trained doctors have joined our healthcare system over the past 2 years. More doctors than at any other time in the last decade. Then, of course, we've got our Medicare urgent care clinics. I had the opportunity to go out to Lindsay and to Penrith and visit one of the Medicare urgent care clinics and spoke to a number of the patients and parents bringing young children in there. And they were absolutely so delighted to see this opportunity to make sure they get quick assistance to their families. Now, Labor promised at the previous election to the last, Labor promised 50 Medicare urgent care clinics. Did we deliver 50? No, we delivered 87. Over 1.5 million Australians received urgent care through these clinics as a result of the overperformance of the outcome that we said we'd deliver. 87 new clinics rather than the 50 originally projected. That's reduced pressure on emergency departments. They filled a critical gap in our health system for parents, young children, elderly Australians who would otherwise spend hours waiting in a hospital emergency department. They're open 7 days a week with extended hours, and they accept walk-ins. All you need is your Medicare card, not a credit card. And it's not stopping there. The Albanese government is also making the biggest investment in mental health care that Australia has seen in decades, contrary, again, to what those opposite want to say about mental health. We're investing $1 billion to make mental health care more accessible, more affordable, and more tailored to the needs of Australians. This includes $225 million to build or upgrade 31 new Medicare mental health centres. Another $200 million will expand and strengthen headspace services for young people, because we know they are the front line of the mental health crisis. And $500 million will go to 20 youth specialist care centres to support young people with complex needs. Now, mental health experts have welcomed this initiative, contrary to what those opposite want to have you believe. And the mental health experts, the real experts, such as Patrick McGorry, one of Australia's leading psychiatrists, called it a groundbreaking commitment that will fundamentally improve access to youth for mental health care. And Caroline Nikolowski, the CEO of Mental Health Australia, said, it will fundamentally increase access to free mental health support across the country. That's the facts, and that's the important initiatives from those that know. That's what this investment is about, real care, where and when people need it. Now, our government has significantly reduced medicine costs as well. Australians have already saved over $1 billion because we delivered the largest price cuts in the history of the Pharmaceutical Benefits Scheme. Now, PBS scripts will cost no more than $25, saving Australians over $200 million a year. And of course, we didn't stop there. We made around 300 medicines available on a 60-day prescriptions, saving patients even more by halving the number of pharmacy visits they need. And remember what those opposite did? They opposed these sorts of initiatives that made medicines cheaper for so many millions of Australians, those that are in need, and for all Australians that need to have their cost of living reduced. We also lowered the PBS safety net threshold, which means families and pensioners reach cheaper medicine sooner. These are practical, immediate savings for households already under cost of living pressure. That contrast with the Coalition could not be clearer. Their record was to freeze Medicare rebates, cut $50 billion from hospitals, oppose cheaper medicines, and consistently vote against measures making health care cheaper and more accessible. And even now in opposition, they continue to oppose bulk billing incentives, urgent care clinics and essential cost of living measures. Their own words highlight their intentions. Let's take a quick look down memory lane. In the 70s, you had prominent Liberal figures like Billy Snedden saying that we will fight this scheme continuously and in the end we will defeat it. Or John Howard in 1984, who declared that he would stab Medicare in the gut. Well, you don't have to travel back that far. In 2015, Anne Ruston said Medicare wasn't sustainable, and earlier in 2014, that the credit card is maxed out on universal health care. That's their view, that's their consistent view, and that's their opposition to Medicare. See, if it's up to us, if it was up to them, the universal would be stripped out of universal health care. And let's not forget, Labor's investment restores every single dollar that the Australian Medical Association says was stripped from Medicare through the Coalition's rebate freeze. We are rebuilding what they tore down opposite. Now, Labor understands Medicare is fundamental to the Australian identity. It represents the promise that healthcare is a right, not a privilege reserved only for those who can afford it. This bill continues Labor's mission to protect and strengthen Medicare. It shortens the time frame for bulk billing claims so the system runs more smoothly and with greater integrity. It strengthens investigative powers so when serious fraud or non-compliance is suspected, we can act faster and more effectively. It streamlines the pharmacy approval process so communities can access essential medicines more quickly. And it reinforces our vaping tobacco reforms, protecting young people from harmful and addictive products. And we know those reforms are working. The latest research from the Cancer Council's Generation Vape study shows that the number of young people aged 14 to 17 who vape is already in decline. And we're investing over $350 million to crack down on the illegal tobacco trade, giving law enforcement the resources they need to fight back against criminal networks. It's another step in ensuring Medicare is stronger, more sustainable, and more effective for generations to come. Because Medicare is more than just a policy. It's part of who we are as Australians. It represents the simple, powerful belief that healthcare is a right, not a privilege. It means that whether you live in a remote community or a capital city, whether you're a pensioner, a patient or a student, you deserve affordable, high-quality care without going broke to pay for it. And that's what Labor has always stood for. So let's be clear. This bill is about making Medicare stronger. It's about giving Australians confidence that when you need care, it will be there. And it's about saying once again that this country will never go back to the days when you needed both a Medicare card and a credit card just to see your GP. And I say this not just as a legislator, but as someone who has seen firsthand when Medicare means for ordinary Australians. I've met those parents in regional towns who told me that without bulk billing...
Senator Sheldon, your time has expired. Senator Mulholland.
I rise to support the bill. Medicare and other pharmaceutical benefits scheme are the cornerstones of Australia's world-class health system. Indeed, they are the envy of the world, and they light the way for what a fairer, more decent health system can look like. And that's why the Albanese government committed to making the single largest investment in Medicare in this nation's history, an injection of $8.5 billion. That record funding for Medicare and the PBS is an example of this government living its values, a belief in a universal healthcare system. This massive funding injection will increase the number of bulk bill doctors' visits every year. It will fund more doctors and nurses to care for our growing and ageing population. Our investment will also reduce the out-of-pocket costs for Australian families, something that skyrocketed under the former coalition government. In fact, Labor's record funding for Medicare will mean 9 out of 10 GP visits will be bulk billed by 2030. We have also committed to delivering 50 additional urgent care clinics across the country. Already, 1.2 million Australians have been treated at over 87 urgent care clinics nationwide. Over 1 million patients. In my home state, there's 10 additional urgent care clinics in Queensland being delivered under this government. These are fully bulk billed, walk-in GP clinics that are free to attend. In Queensland, our urgent care clinics have already treated hundreds of thousands of sick patients. Last month, I visited one of our busiest urgent care clinics in Morayfield in the federal seat of Longman. While I was in the Morayfield Urgent Care Clinic, the clinic was busy, treating little kids, elderly patients, and workers seeking treatment. These are the patients who would otherwise be forced to find a pay-for-service GP appointment or wait a long time for a bulk billed appointment at another clinic. Every one of those patients arriving at the Morayfield Urgent Care Clinic came with just their Medicare card, and they were entitled to world-class care from a community GP in their local area. Earlier this year, I travelled to the seat of Groom and visited our urgent care clinic in Toowoomba. The Toowoomba Urgent Care Clinic has delivered over 6,000 bulk billed GP appointments to Toowoomba locals. With a shortage of GPs and bulk billed appointments in regional Queensland, thanks to a decade of inaction by those opposite, the Urgent Care Clinic is turning around that tide. We have worked hard as a Labor government to reverse a decade of underfunding by those opposite. But wait, there is more. In addition to Labor's urgent care clinics, Labor has committed over $255 million for 31 new Medicare mental health clinics. From the 1st of July, just earlier this month, a number of those new Medicare mental health clinic services commenced across Queensland. We now have Medicare mental health clinics funded by this Labor government operating in locations including Caboolture, the Sunshine Coast, Redcliffe, Barden, Rockhampton, Townsville, Redlands, Strathpine, Logan, and many more. These are locations where patients can get much needed walk-in mental health appointments, taking pressure off our hospital system, which particularly right now is in the midst of a lot of pressure in Queensland, as we can see in the local newspapers. And I look forward to joining the Assistant Minister in the near future to officially open some of these bulk-billed Medicare mental health clinics, and in doing so, we can get the word out about these great new clinics. This side of the chamber knows the job is never done, and we are always fighting to secure the future of our world-class health system and to continue to improve it. Labor will always fight to protect its future, a commitment we took to the last election. When Labor came to government in 2022, it had never been more harder or more expensive to find a doctor in Australia. Bulk billing rates were in free fall after a decade of coalition cuts and neglect to Medicare. Australians chose to elect the party that created Medicare, Labor, to stand up and defend our health system. In November 2021, 6 months before the 2022 election, the financial viability of general practice was in serious trouble after the Coalition's 6-year freeze on Medicare rebates. Labor has delivered the 2 largest increases to Medicare rebates in 30 years. We have increased Medicare rebates by more in just 2 years than the former government did in 9 long years. And as a result of this record investment, bulk billing has started to rise again in every state and territory, delivering an additional 6 million free visits to the GP in just 12 months. We must always fight against attacks on Medicare from those opposite, who believe access to Medicare should depend on your credit card, not your Medicare card. And that is a commitment that Labor took to the Australian people, that we would always stand up and protect Medicare, and the PBS from ideological attacks from those opposite who seek to get their hands on it and rip away vital funding from our health system. But also, just as importantly, we must protect Medicare and the PBS from bad actors who would, and some do, seek to defraud our health system and take advantage of vulnerable patients. Part of that is continually enhancing and modernising Medicare and protecting it from those bad actors to ensure Australia remains among the healthiest countries in the world. The amendments in this bill will help protect the integrity and the ongoing sustainability of Australia's health benefit scheme, including the MBS, the PBS and the CDBS. This bill strengthens the powers of Medicare to investigate incorrect billing and the fraud in the system. Medicare costs, as we know, billions of dollars annually, and we know that fraudulent behaviours, incorrect billings and overpayments are a drain on public money and reduce the funding available for those patients who need it the most. This bill also introduces tougher penalties for those making fraudulent Medicare claims, which take vital funding away from much-needed primary care in our local communities. Stronger integrity measures like those in this bill create a more level playing field for all users, which make our record funding go around even further. It also ensures that we are focusing on patient care and the right appointment and the right service in the right location for the right patient, not the other way around, having appointments or claims driving care, where patients are having their appointments cut short or required to come back for a new chargeable appointment when they are already there receiving care. This comes at an additional expense for taxpayers and a cost of time for both the patient and the practitioner. The independent review of medical integrity and compliance undertaken by Dr. Prateep Philip, the Philip Review, specifically referred to the need to ensure patient safety in all aspects of health services. This must include a review of billing practices to ensure the ease of visitation for patients, to keep healthcare affordable, to reduce duplication of appointments, and to cut down on wait times for families. But in saying this, I want to be very clear. The measures introduced in this bill today will importantly only directly impact upon a small percentage of practitioners and businesses engaged in non-compliance and fraud. Australians know that the overwhelming majority of our doctors and healthcare professionals are decent, honest, hard-working and comply with the Medicare rules and guidances. And this system protects those practitioners doing the wrong thing and takes action against those doing the wrong thing. This system protects those doing the right thing and takes action against those doing the wrong thing. Overall, patients and practitioners can expect to benefit from better protected health schemes that will provide more secure access to safety, quality services closer to home. This bill focuses on incentivising the good behaviour amongst our hard-working medical practitioners and cracking down on the bad behaviour. Improving patient integrity, deterring misconduct and reducing fraudulent claims is critical to ensuring that Australia can afford Medicare. Strengthening Medicare also means safeguarding the taxpayer funds that underpin it, and this government is committed to that task. I support the important amendments in this bill that outline to detect, respond and investigate instances of misconduct, fraud or non-compliance, because it's Australian families who are paying the price for the misuses and abuses of our system. But as Labor people, we know the job is never done, and we must always fight to protect and secure Medicare's future and to continue to improve it. As a new mum, I have been so proud of the reforms delivered by Labor to deliver incentives to increase bulk billing rates for children. When you are holding a sick child in your arms, the last thing you need to be thinking about is whether you can afford for your child to get the treatment they need. I am so proud of the bulk billing rates have increased for children under Labor. And we know that getting care closer to home with a trusted medical professional leads to better health outcomes for our littlest people. Because we know that Medicare ensures that no matter where you live, how much you earn or what's happening in your wallet, you and your loved ones can get the care you need under Labor. And Labor will always fight to strengthen Medicare. Thank you.
Thank you, Senator Mulholland. Senator De Liga.
Thanks very much, Acting Deputy President. I rise today to speak to the health legislation amendment Improved Medicare Integrity and Other Measures Bill 2020-25. And may I note that this is not my first speech. When I think about Medicare, three names come to mind: Whitlam, Hawke, Albanese, three Labor legends who have championed universal healthcare. It was Labor who established Medicare in Australia over 40 years ago, and only Labor will protect and strengthen it. The outcome of the 2025 election couldn't have been clearer. The Australian people sent a clear message. They will not stand for cuts or degradation of our green and gold national icon. When we came to government in 2022, it had never been more harder or more expensive to find a doctor. Bulk billing was in free fall, and after a decade of cuts and neglect to Medicare, the people were forgoing healthcare to make ends meet. This was not okay, Acting Deputy President. That's why strengthening Medicare was a key focus of Labor's 2025 election campaign. Acting Deputy President, when I was on the doors in Tassie's Northwest during the campaign, I heard time and time again about the importance of Medicare and how access to high quality and bulk bill healthcare changes outcomes for everyone. In Labor's first term of government, we delivered more doctors, more bulk billing, cheaper medicines, and we opened 87 Medicare urgent care clinics across the country. This was just the start of generational investment and improvements to our health system, and we are going further. On this side of the chamber, we stand for more bulk billing, more doctors, and more urgent care clinics. The Prime Minister has told Australians that this is Labor's year of delivery, and we aren't wasting any time. The Albanese Labor government is making the single largest investment in Medicare since its creation. We're investing $8.5 billion to deliver more bulk billed GP visits each year, hundreds of nursing scholarships, and thousands more doctors. This means Australian patients and families will save hundreds of dollars in out-of-pocket expenses. And for the first time, our government is expanding bulk billing incentives to all Australians, and we'll create an additional new incentive payment for practices that bulk bill every patient, meaning that 9 out of 10 GP visits will be fully bulk billed by 2030. Labor's record investment restores every dollar that the Australian Medical Association says was cut from Medicare through the Liberals' funding freeze. I do know myself how important it is to see a GP regularly. It helps to catch issues early before they worsen and before leading to more intensive and more costly care. I've been really lucky to have had the care from amazing doctors at the Glebe Hill Family Practice and Nurture on Hobart's Eastern Shore. And a little bit of a hi to Dr. Tim Jones and Dr. Boris Tan. I can't thank you and your amazing staff enough for your support and care over the years. Our policy lifts up our entire nation and ensures that no one is held back and no one is left behind. We need more doctors. That's why we're investing $662 million in a workforce package that will expand the largest GP training program in Australia's history. And by 2028, we will fund 2,000 new trainees every year. This complements the massive increase in overseas educated doctors joining the Australian health system, with an extra 17,000 doctors registering to practice in the last 2 years, more than any time in the past decade, Acting Deputy President. More GPs means more Australians can get the care that they need closer to home. It means shorter wait times, better better continuity of care, and stronger support for families, especially in rural and regional communities like Tassie. That's why growing our GP workforce isn't just a health investment, it's a commitment to a healthier and fairer Australia. We initially promised 50 Medicare urgent care clinics at the 2022 election. As I said before, we delivered 87. We're building on the historic investment in Medicare to expand the availability of free Medicare urgent care clinics in all states and territories. And as I said, and this means that 4 in 5 Australians will live within a 20-minute drive of a Medicare urgent care clinic. Acting Deputy President, in Tasmania, we currently have 5 urgent care clinics, 2 in Hobart CBD one in Bridgewater, one in Launceston and another in Devonport. During the 2025 federal election campaign, the Albanese Labor government promised another 3 for Tassie, one in Burnie, one in Sorell and one in Kingston. This will make a real impact to Tasmanians. Nationally, more than 1.5 million patients have walked through the door of a Medicare urgent care clinic and received the free urgent care they need instead of waiting hours in a busy hospital emergency department. In Devonport, we have an urgent care clinic close to my electorate office. The community have embraced it with open arms. I drove past this clinic the other day. People were there and they were lined up for over an hour before the clinic even opened, just wanting to see a doctor for free. People are even travelling from the neighbouring city, Burnie, to be able to access the Medicare urgent care clinic. I know the North West Coast community are looking forward to the next clinic and opening up in Burnie. Our Medicare urgent care clinics have filled the gap in our health system, and now patients all around the country, including parents, young children, they don't have to spend hours in the hospital emergency department. I've seen firsthand the benefits of urgent care clinics. On an amazing, sunny Hobart afternoon, my partner and I decided to go for a bike ride along the beautiful Howrah Beach waterfront. Unfortunately, during this bike ride, my partner fell off his bike. As the day progressed, it was clear that something wasn't right and that he needed to see a doctor. Without the Medicare urgent care clinic, we would have needed to go to the Royal Hobart Hospital. When we arrived at the Bathurst Street urgent care clinic, my partner was able to see a nurse, then a doctor, have the appropriate X-ray scans, get into a sling and get a script for pain meds. No credit card was needed, just our Medicare card. It's not just Medicare that we're improving. We're making medicines even cheaper. The Pharmaceutical Benefits Scheme is the envy of the world. Having already slashed the cost of medicines with the largest cut to the cost of medicine in the history of the PBS in 23, we're now going even further. The government will make cheaper medicines even cheaper, with a script to cost Australians no more than $25 under the PBS. This is more than a 20% cut in the maximum cost of medicines, which will save Australians over $200 million each year. It's another key cost of living measure delivered by the Albanese government, which will also put downward pressure on inflation. Australians have saved more than $1 billion on the cost of their scripts thanks to the commitment to make medicines cheaper. Our government is taking strong action to protect the health of our young people. One of the pressing issues that we face today is the rise of vaping among children and teenagers, and I'm sure senators are as concerned as I am. That's why we've introduced world-leading reforms to tackle vaping head-on. These reforms are making a difference. According to the latest figures from the Council Council's Generation Vape study, the number of young people aged 14 to 17 who vape is now in decline. This is a clear sign that our policies are working and that we are moving in the right direction. But our commitments don't stop there. We're cracking down on the black market in tobacco. The illegal trade not only undermines public health, but fuels criminal activity. To combat this, we're investing over $350 million to support law enforcement agencies, and these funds are helping them to take the fight directly to the criminals who profit from illegal tobacco. The Albanese Labor government is leading the charge in protecting young Australians from the dangers of vaping and illegal tobacco. Through groundbreaking reforms and substantial investments in law enforcement, we are seeing real progress. Together, we're building a healthier, safer future for the next generation. We're also delivering a major boost to our public health system, an additional $1.8 billion for public hospitals and health services next year. This one-year agreement is more than just a funding announcement. It's been a commitment to ensuring Australians have access to better funded, more responsive public hospitals. It's a step forward in our long-term vision for the health system reform. Let's not forget, it's a stark contribution to the previous Liberal government, which cut $50 billion from public hospitals. We're not just reversing those cuts, we're building something better. And we're not stopping there. The Albanese government is working closely with states and territories to deliver a new 5-year funding agreement, one that ensures our public hospitals are sustainable and ready to meet the needs of every Australian. Acting Deputy Speaker, the Albanese government is making Medicare even stronger. We're helping with the cost of living pressures and ensuring that every Australian gets the best health care that they absolutely deserve. And I know Tasmanians are behind this. I support the bill and I encourage senators to do the same. Thank you.
Thank you, Senator Delega. Senator Thorpe.
Thank you, Acting Deputy President. I rise today to speak about the health crisis this country continues to impose on First Peoples of this country. The so-called gap in health, in housing, in justice grows with every preventable death, every child removed, every prison sentence, every community left without basic health care or housing. They call it a gap. We call it what it is, a system of racial segregation. Our people are being killed through the destruction of country and culture, systemic neglect, targeted state violence, racist institutions, and mass incarceration at the highest rates in the world. Not by accident, but by a system designed to assimilate or exterminate us. This is racial segregation. It is apartheid, and it is a slow and sophisticated genocide. Healthcare in prisons isn't just a service or a hospital or a policy area. It is a human right that continues to be selectively denied to our people. People who should have been cared for by family in safe, secure housing or in a doctor's waiting room or in a hospital are sent to prison. Here they often die alone in prison cells without proper medical care, and too often their deaths are labelled from natural causes. Let me be very clear. There is nothing natural about dying in a prison cell from a treatable illness. There is nothing natural about a child taking their own life while on remand. There is nothing natural about shackling a woman while she's giving birth, or shackling a palliative care patient. This is outrageous. There is nothing normal or natural about losing your hearing from an untreated infection, or having your fingers amputated because your pain is not taken seriously until it's too late. These are real stories, real people. There is nothing natural about a man hitting his head against a wall to try and get relief from excruciating dental pain caused by an infected tooth left untreated for weeks. These are not natural injuries or deaths. This is systemic neglect at the hands of a state, including police officers and prison guards, who do not see our people as being worthy of being looked after. Those of us who have been around long enough have heard time and time again stories and reports about racism that festers in every police department and in every prison. Healthcare in this country is not equal. It is not safe. If you're black, disabled, criminalised, or all of the above, you're far more likely to be denied the care you need to survive. This is how racism harms and kills. The brutal reality is that this country continues to deny incarcerated people their right to health care. As First Peoples, we are the most incarcerated people on the planet, which means we are the ones dying from this neglect, abuse and torture, all of which is very well documented. Behind closed doors, where international observers are denied entry, adults and children are being physically and sexually abused by the state. They are being shackled and spit-hooded. They are denied food and water as punishment and monitored on screens 24/7 with the lights on. If someone says they are depressed, the response of the prison is solitary confinement and for their so-called safety in cells that still have hanging points. The Royal Commission into Aboriginal Deaths in Custody included a number of recommendations on healthcare. One of these recommendations was to remove all hanging points from prisons. This was 30 years ago, and it still hasn't been acted on. The Guardian Australia recently revealed at least 57 people died by suicide using known hanging points over the past 2 decades, despite numerous warnings from coroners over that time. What message does that send to families? What message does that send to young people who are in the crisis? When someone in custody reaches out for help, they should not be punished for it. They should not be placed in solitary confinement. They should be met with care, support and connection. But instead we are seeing suicide risk treated as a threat, and that only makes things worse. We've had report after report after report from coroners, ombudsmans, royal commissions, all saying the same thing. The prison system is not safe for people in custody. Racism is rife, and proper health care is extremely rare. Mental health support is inadequate. Chronic illnesses go untreated and deteriorate. Medication is delayed or denied. Antipsychotic medications are used as silent handcuffs to sedate and placate people, contributing to a number of side effects and chronic diseases, and people are dying as a result. Our community-controlled organisations are doing their best to reach people inside, but they are underfunded, overstretched, and forced to operate in hostile environments that continue to criminalise and punish our people for being unwell. Ministers and governments are quick to promote our services to cover up their failures and showcase them as evidence of progress, while routinely making community-controlled organisations work harder. The government has acknowledged some of these failures in the National Review of First Nations Healthcare in Prisons. That review was a long time coming. It made one thing very clear. The system needs to be transformed. The review calls for a range of measures, but we have not seen any action on this yet. I commend Minister Butler for showing more interest in this area than other previous health ministers, but the truth is that we have not seen any change. It's all talk, no action. And we can't afford to wait any longer because people are literally dying. They're dying. Children are dying. I want to talk about medications in prisons. People in prison are still being excluded from the Pharmaceutical Benefits Scheme, the PBS, and that means they don't have They don't have access to the medicines they need. That includes basic things like insulin for diabetics. We know blackfellas particularly have high rates of diabetes. We can't access insulin in the prison system. It's like you just want us to die. There's no access to antipsychotic medications, and there's no access to HIV treatment. People inside should have access to the same standard of healthcare as those outside. But we are failing to meet the standard in this country, and we've seen reports of prisons substituting medications with cheaper, less effective options. We've seen delays that have caused seizures, infections, and permanent disabilities. We've seen people denied treatment because it's too expensive or not available on site. And the vast majority of these people are Aboriginal and Torres Strait Islander people. This is not only dangerous, it's a violation of people's rights, and it is one of the strongest and most effective levers the Federal Health Minister has at his disposal. I've spoken to the Health Minister about fixing this on a number of times, and there are a range of solutions available, and I've provided those as well. One of my amendments to this bill also provides solutions. But people are still waiting. And while we wait, people are dying. It is time for the government, if you're genuine, to get on with it. Pull states and territories into line and use the Medicare scheme to implement the recommendations of last year's review that you paid for, establish nationally consistent standards, improve access to essential medicines, disability supports, drug and alcohol support, sexual and reproductive health care and post-release care, remove all hanging points in custodial settings as a matter of urgency, address the widespread neglect of mental health and disability in youth and adult prison populations, ensure First Peoples have access to community-controlled, culturally safe models of care before, during and after incarceration. I foreshadow moving the second reading amendment as circulated, which outlines some of these priorities. This is just a start. I also want to touch on health care for our elders, the ones who carry our stories, our law and our culture. For our elders in custody, yep, they're there too. The situation is terrible. Prisons are not equipped to care for ageing people, supporting complex needs, treating cancers, or for dying with dignity. There must be full and independent oversight and accountability for healthcare services in prisons. This is something that requires national coordination and leadership. And crucially, any work to transform custodial health systems is designed, led and governed by First Peoples, including through adequate resourcing of Aboriginal community-controlled health organisations. Healthcare is also where some of our strongest resistance has come from, where the community-controlled movement come from our old people who fought against a system that saw them as less than human and established our own services on our own terms. To the families that reach out on a daily basis, I hear you, I see you, and I stand with you. To our young people, your lives do matter, your future does matter, and your health does matter. To our elders, thank you for your strength, your knowledge, and your endurance. And let us honour them, not just with words, but with justice. Because until our people are safe in hospitals, in homes, and in prisons, then none of us should be comfortable with the status quo.
Senator Walker.
Thank you, Deputy President. I rise to speak on the Health Legislation Amendment, Improve Medicare Integrity and Other Measures Bill 2024, and I note that this is not my first speech. This bill, whilst primarily technical in nature, is part of this government's pivotal agenda to strengthen Medicare. Almost all Australians have come to see Medicare as very precious. We know how precious they see it by how they react whenever it is threatened by Conservative governments, and also by how overwhelmingly they voted in an Albanese Labor government, with strengthening Medicare as one of our central promises. Labor cares about Medicare and making it work better for all Australians. That little green card we have in our pocket or on our phone is one of the most powerful symbols of how Australians provide for each other in a fair society. Our government is making the single largest investment in Medicare since its creation 40 years ago. $8.5 billion to deliver more bulk billed GP visits each year, hundreds of nursing scholarships and thousands of more doctors. Australian patients and families will save hundreds of dollars a year in out-of-pocket costs, because we will expand bulk billing incentives and create a new incentive payment for practices that bulk bill every patient. There is little doubt that the undermining of bulk billing and Medicare has been an agenda of the former Conservative governments. So when Labor came to government in 2022, bulk billing was bordering on being obliterated. We want 9 out of 10 visits to GPs by 2030 to be bulk billed, and we are investing to make that a reality. We have delivered 87 urgent care clinics around Australia, and already over 1.5 million patients have gone to these clinics for free urgent care that they need. They have got access to free care 7 days a week using that little green card. Labor has also delivered the 2 largest increases to the Medicare rebate in 30 years. This has made a real difference, with bulk billing rising across the country. I come from a single-parent family. Medicare is essential to us, to our friends and our extended family. It underpins the health of our country. So Labor is investing in the workforce to expand access to GPs so that we can continue to expand access to healthcare. By 2028, we will fund 2,000 new GP trainees each year. This expansion of our medical workforce at the community level will make it easier to see a doctor whenever you need. We are also, of course, making medicines cheaper. Labor has already slashed the cost of medicines under the PBS and made over 300 medicines available on 60-day prescriptions. And there is more to come. We will now make medicines even cheaper, with a script to cost Australians no more than $25 under the Pharmaceutical Benefits Scheme. The Health Legislation Amendment Bill that I am speaking on today is part of that large suite of reforms we are making to Medicare. This bill will work to protect Medicare by implementing some important fraud prevention measures and enhancing investigation and administrative seizure powers. It will also streamline the pharmacy approval process so that communities will be able to get quicker access to pharmaceuticals in certain circumstances. To reduce fraud and incorrect claims, this legislation will shorten the timeframes for making bulk billing claims. By reducing the timeframe to submit bulk billing claims to 1 year rather than 2 years, we will reduce the number of incorrect and fraudulent claims. Maintaining the integrity of Medicare is critical to protecting it into the future. So it is important to crack down on potential fraud, and this reduction in timeframes is an administrative pathway to doing this. Importantly, to make sure patients aren't disadvantaged, there will remain a discretion to extend the timeframe to pay bulk billing claims. This bill will also improve investigative powers across Medicare and the Pharmaceutical Benefits Scheme. The bill will improve investigative powers and allow them to be used consistently and effectively across Medicare and the Pharmaceutical Benefits Scheme to deal with potential misuse and fraud. It will also allow investigation of criminal code offences so that the department will not need to involve the AFP to execute warrants for suspected offences. This will strengthen our responses to anyone trying to rip off the system, so we can be assured that every dollar is going where it should be, to supporting Australia's health. This bill also amends the Therapeutic Goods Act to improve the Department of Health and Aged Care's ability to manage and alleviate therapeutic goods shortages. Currently, the department has to wait until there is a critical therapeutic goods are not available before the Secretary can approve the importation of substitutes. This change will allow the Secretary to exercise this power in anticipation of such shortages. And I am very pleased to say that this bill will also support the government's important world-leading vaping reforms. Vaping replaced smoking as a real and present danger to young Australians. Australians of all ages vape, and this is not good for the health of our nation. Unlike the misinformation that has circulated for so long, vaping isn't a harmless replacing for smoking. Vaping causes real harm to the lungs. Tiny particles are inhaled deep into your lungs, so when you vape, and these particles spread through your airways. These chemicals can cause inflammation, cell death, scarring, and DNA damage. Due to the reforms led by the Albanese government, non-pharmacy retailers, such as tobacconists, vape shops and convenience stores, have not been allowed to sell any type of vape for 1 year now. Vapes can now only be imported, manufactured, possessed or supplied in Australia if they are for the genuine purpose of helping people give up smoking. The bill amends the Therapeutic Goods Act to improve the investigations and enforcement action that can be taken by state government after states adopted our important vaping reforms. It also clarifies the legal authority for the Secretary of the Department to make orders to cease the supply of vaping goods and make directions to stop misleading information about vaping being advertised. Vaping is an insidious threat to the health of young Australians, and I'm pleased this bill will help strengthen the powers to stop this threat. Acting Deputy President, I strongly commend this bill to you as part of the package to deliver what Australians demand, a strong, universal and mighty Medicare.
Thank you. Minister McAllister.
Well, Australia has a world-class health system, and that is largely thanks to the various health benefit schemes such as Medicare, which help Australians pay for the health care that they need. And in 2023-24, payments for health benefits, including medical services, pharmaceutical services and private health insurance rebates, totalled at least $65.1 billion. And the government is committed to protecting this investment and strengthening Medicare by improving the compliance framework that ensures its integrity. As other speakers have observed, the government commissioned the independent review of Medicare integrity and compliance, known as the Phillip Review, in November 2022 to respond to concerns about the operation of the Medicare system. The Health Insurance Amendment Professional Services Review Scheme Act 2023 and the Health Insurance Amendment Professional Services Review Scheme No. 2 Act 2023 made amendments in response to the recommendation of the Phillips Review. This bill, too, will support the integrity and sustainability of Medicare by addressing a range of issues to enable the department to conduct more efficient, timely and effective compliance activities. And the government is committed to tackling issues of fraud and integrity and non-compliance wherever we see them. That includes Medicare, but of course it also has implications for me in my role as Minister for the NDIS, because when we see issues of this kind, we know that we also see poorer outcomes for the Australians who rely on our systems of social supports. And so the bill will improve payment integrity by reducing the timeframe for making bulk billed claims. The bill will allow investigative powers to be used consistently and effectively across health schemes, including Medicare and the Pharmaceutical Benefit Scheme, and it will improve the processes associated with pharmacy approvals. The bill also makes several sensible amendments to the Therapeutic Goods Act 1989 to enhance the Department of Health, Disability and Ageing's capacity to manage and alleviate the consequences of therapeutic goods shortages and to support compliance and enforcement activities undertaken in relation to unlawful therapeutic goods and unlawful vaping goods. These amendments are consistent with this government's unwavering commitment to public health and mitigate the public health risks associated with therapeutic goods and vaping goods by supporting strong and effective regulation under the Act. The bill also amends the Public Health, Tobacco and Other Products Act 2023. These amendments are largely clarifying in nature and have been identified as necessary during implementation to ensure the smooth and consistent operation of the Act. I know that a number of senators have either flagged or moved second reading amendments, and I may give an indication about the government's position in relation to each of those. Senator Steele-John has moved an amendment on 3360, and the government won't be supporting this amendment. The amendment is unrelated to the purpose of the bill. The bill, as I've just set out, seeks to improve the enforcement of Medicare integrity measures and support the implementation of world-leading vaping and tobacco reforms. Senator Steele-John's amendment relates to dental services, and I'll make the following general remarks in relation to the issues that you raise in that amendment, Senator Steele-John. I mean, our government has provided $107.8 million in the 2025-26 budget to state and territory governments to support public dental services for adults. We are also working in partnership with states and territories to develop a new national oral health plan for the next 10 years. Now, we recognise, of course, and Minister Butler has said this also, that in the longer term there is a lot of ambition for dental to be covered by Medicare, but our focus right now is on strengthening Medicare and rebuilding general practice after decades of cuts and neglect from the Liberals. I will speak briefly too about the government's approach to the amendment moved by the second reading amendment moved by Senator Thorpe, and I listened very carefully to her contribution when she was in the chamber earlier. I understand that Senator Thorpe has had a number of discussions with the Minister of Health and Ageing on this subject, and that he has agreed to have regular discussions with her to work on this very important issue. And the government supports in principle many elements that are set out in her amendment. We acknowledge, in particular, the disproportionate representation of First Nations people in corrective settings nationwide and the implications that that has for health outcomes. Our government has taken and is taking significant steps to address this issue. At the 6th of December 2024 Health Ministers meeting, all health ministers endorsed the release of the independent national review of First Nations healthcare in prison. Health ministers also released a joint response to the review, and in this they thanked all of the stakeholders who contributed to the review's findings and committed to ensuring healthcare delivered in custodial settings by upholding the fundamental human rights of people in places of detention. And both the review and that statement are publicly available. As an outcome of the review, all health ministers jointly wrote to ministers responsible for adult and youth justice regarding the review of healthcare in prisons and collaborate on this work. And this work is progressing. The Minister for Health and Ageing has also written to states and territories seeking advice on actions taken by them to remove hanging points in custodial facilities and sought their support to further reduce preventable First Nations deaths in custody. The government will continue to progress these reforms through these channels with our state and territory counterparts who do hold the primary responsibility for the justice system, and it would be premature to support this amendment while this work continues. To conclude, Deputy President, Australians are, of course, rightly proud of the systems of social support that we've built. We've built them the Australian way over generations. The PBS and Medicare are so significant. They are a significant part of our national fabric, and I am proud to be part of a government that is strengthening these great Australian institutions. I thank senators very much for their contribution to the debate on this bill.
Thank you, Minister. The question before the chair is Senator Steele-John's second reading amendment. I will put that question. Those in favour say aye.
I think I might need to draw your attention to the state of the chamber if I can do that mid-comment.
Quorum required?
Yes, thank you.
Please ring the bells. Quorum present? Quorum is present. We shall now put the question on Senator Steele-John's second reading amendment. Those in favour say aye. Aye. Against say no. I think the noes have it. Division required. Ring the bells. Lock the doors. The motion is that Senator Steele-John's second reading amendment be agreed to. Ayes will pass to the right of the chair, noes to the left. I appoint Senator McKim, teller for the ayes, and Senator Blythe, teller for the noes. The result of the division is ayes 14, noes 38. The question is resolved in the negative. Now, I'll just note there is another second reading amendment. Senator Thorpe, did you wish to move that amendment?
Thank you. I move the amendment on sheet 3372.
Thank you, Senator Thorpe. The question is that amendment, that second reading amendment, be agreed to. Those of that opinion say aye. Those of that opinion say aye. Did I hear two voices? Oh, sorry, Minister.
I wonder if 3372 is the correct number.
Yes, the number I have is 3375, Senator Thorpe. Second reading amendment.
Beg your pardon, 3374.
I have 3375, so I think we need to just ensure that we are all
Sorry,
on...
3375.
It's good to be on the same page. So the question is that Senator Thorpe's second reading amendment on page 3375 be agreed to. Those of that opinion say aye. Against say no. I believe the noes have it. Division required. Ring the bells for 1 minute. 1 minute. Lock the doors. Question is that the second reading amendment moved by Senator Thorpe be agreed to. Ayes are passed to the right of the chair, noes to the left. I appoint Senator McKim. Senator McKim, is that okay, or Senator Thorpe? Senator McKim, teller for the ayes, and Senator Blythe, teller for the noes. The result of the division is ayes 13, noes 34. The question is resolved in the negative. There being amendments circulated, we now will... sorry, I need to put the second reading. I am rusty. The question is that the second reading now be agreed to. Those of that opinion say aye. Against say no. The ayes have it. Amendment... Clerk.
A bill for an act to amend the law relating to health and for related purposes.
Amendments having been circulated, we will now resolve into committee. I'd encourage senators who aren't planning on participating in the second reading stage to perhaps quietly leave the chamber. Is it the wish of the committee that the bill be taken as a whole? There being no objection, it is so ordered. The question is that the bill stand as printed. With the concurrence of the Senate, the statement of reasons accompanying the request circulated for this bill would be incorporated in Hansard immediately after the request to which they relate. There being no objection, it is so ordered. Senator Roberts.
Can I ask questions now?
You have the call. You're on your feet.
Thank you very much. Minister, the existing wording of section 19, clause 1, already allows the TGA to approve the use of a drug that is not registered or approved in Australia in the event of a shortage. That power has been used for 135 current approvals and for 600 expired and lapsed approvals, for a total of 735 approvals of new drugs or versions of drugs in 2 years. 2 years, 735 approvals. Why do you need new powers when the existing wording is clearly no barrier to approval?
Minister.
Thank you, Chair, and thanks for the question, Senator Roberts. The advice that I've been provided is that the amendment goes to the ability of to be able to act in advance of a shortage arising, knowing that a shortage is coming towards us down the pipeline, rather than being required to wait until the shortage actually arises. It will allow the government and the authorities to get ahead of shortages in relation to pharmaceuticals.
Sorry, Senator Roberts.
Thank you, Minister. Minister, can you provide an example of a situation where this new power would be needed because the old wording did not provide for that situation?
Minister.
I think, Senator Roberts, I've explained the principle, which is that from time to time we know that shortages of pharmaceuticals do arise, and they arise because of interruptions to global supply chains or of sometimes an interruption in a particular facility's manufacturing capability. That disruption doesn't immediately translate into a shortage, but we know logically that it at some moment will. These provisions allow us to get ahead of that situation.
Senator Roberts.
Thank you, Chair. My previous question was theoretical, to understand the process that informed the legislation. This question, Minister, is not theoretical. In what situation, Minister, has the existing wording of 19, clause 1, failed to provide a good outcome for everyday Australians? Could you give me a real example, please?
Minister.
Senator, there are multiple shortages that are managed by the TGA, and we want to be in the best possible position in the future to be able to manage them as they arise.
Senator Roberts.
Just one example, please, Minister. Not a theoretical one, not a hypothetical. Just one concrete example of where this has been needed in the past and was not available.
Minister.
Senator, it's not my intention to trawl over previous decisions and circumstances, but it is the case that from time to time we can see in advance the potential for a shortfall. We want to give the TGA the best possible opportunity to be able to intervene and make sure that the medicines that Australians need are available.
Senator Roberts.
So that seems to be confirmation, Minister, that it has not happened in the past. There's no need for it.
Minister.
That doesn't follow from the advice I've provided to you, Senator Roberts. There are shortfalls from time to time in medications that are important for Australians. The TGA presently acts to manage those and works very actively. We want to make sure that in future they have all of the tools available to them to be able to do that, and we consider this to be an important amendment that will assist the TGA in that task.
Senator Roberts.
You say there, so Minister, thank you. You say that there are examples, but you won't give me any. So let's move on. Under this new low bar for approval, a pharmaceutical company would be tempted to avoid applying for a regular approval, which is expensive and time-consuming, when they could just have their drug waved through under a spurious scarcity rumour. Not fact, pending rumour, pending scarcity. Minister, what safeguards are in this legislation to ensure that Big Pharma does not create a false scarcity story to avoid making a normal authorisation application?
Minister.
Thank you, Deputy President. The TGA relies on intelligence. The TGA does not rely on rumours. The premise of your question is incorrect. It remains my position, as I've explained a number of times now, that it's really important that we are able to act when we are aware of a forthcoming shortage or the possibility of a shortage of critical medicines. Australians rely on the availability of these, and it's an important function that the TGA plays in protecting the supply chain.
Senator Roberts.
Thank you, Chair. Minister, this is getting to be disappointing. You keep telling me there are many examples and it's concrete, but I don't get anything. So let's move on. Minister, under this bill, is there a time limit for the approval? And if so, can the approval be renewed at the end of that period, creating what is in effect a permanent approval? Just keep extending it.
Minister.
Thank you. Sorry, Chair. Senator Roberts, when you're speaking about an approval, which particular approval are you referring to? Obviously, the legislation canvasses quite a range of different approvals.
Senator Roberts.
Thank you, Minister. Any temporary approval?
Minister.
The advice I'm provided, Senator, is that the approval by its nature is temporary and expires as the shortage is resolved.
Senator Roberts.
So if the shortage is not resolved, is there a time limit for that approval to be enforced? And if there is, can it automatically be renewed? In other words, granting a bypassing of the normal full regulatory approval process.
Minister.
Thanks very much, Chair, and I appreciate the Senator waiting while I obtain advice. I want to give accurate information to the Senate. The advice I've been provided is that these are statutory criteria that need to be met for any approval, Senator, and the TGA would need to be satisfied that those statutory conditions were met. It is, however, the case that ordinarily these circumstances resolve themselves. So we do see from time to time shortfalls, and they are generally resolved over time. Our interest is making sure that any short-term shortages or impacts on Australians can be managed, and that the TGA has the tools to do so.
Senator Roberts.
So, Minister, does that mean it's automatically renewed? Is there a time limit, and is it automatically renewed if the shortage continues beyond that time limit?
Minister.
The advice that I have, Senator, is that it would be the approval would be provided with a time limit, and that that doesn't prevent a reconsideration of the same questions, but it would be against the same criteria that I referred to in my earlier answer to your question.
Senator Roberts.
So it's highly likely we just continue. The TGA Minister has already approved certain drugs, including the product Pfizer sells as a COVID vaccine, their word. For full TGA approval, it's already been approved for full TGA approval, based, according to the TGA, on the safety profile data experienced during emergency use authorisation. Minister, will this legislation provide yet another way Big Pharma can make an end run around Australia's long-standing authorisation process?
Minister.
No, Senator, that's a very leading question. I think the purpose of the legislation is set out, and in the explanatory memorandum and in other documentation around the bill, there's been a Senate inquiry into the bill. Our objective is to make sure that Australians have the medicines that they need, even when shortfalls arise globally, and that we are in the best position to manage any consequences when we do see interruptions to global supply chains.
Senator Roberts.
Thank you, Minister. Thank you, Chair. Minister, of the 735 drugs granted authorisation under the existing legislation, how many are now subject to an application for full approval or have been approved based, according to the TGA, on the adverse events profile of the drug during approval under 19 Clause 1 in the same way Pfizer's Community was?
Minister.
Thanks very much, Chair. Senator, I am not in a position to confirm the numbers that you've cited in your question, and nor do I have information about the numbers of applications on foot in various processes administered by the TGA. Perhaps you might like to think about another way of getting to the information that you're interested in.
Senator Roberts.
So I'll say it again and try and break up the sentence. Of the 735 drugs granted authorisation under the existing legislation, how many are now subject to an application for full approval?
Minister.
To you, Senator, I don't have that information with me, and nor would you expect me to. It's a very detailed question.
Senator Roberts.
Okay, I won't continue with the other breakdowns of the sentence. Let's move on to the next question. Does a drug approved under Section 19, Clause 1 also go on the Pharmaceutical Benefit Scheme? And if so, does the normal negotiation on price still occur, or do we just pay whatever the drug company wants us to pay?
Minister.
Thanks very much, and thank you for waiting. Senator Roberts, I was seeking advice again so that I can provide you with accurate information. The advice I have is that the standard process is for a medicine or product to be listed with the ARTG first before being considered by the PBS.
Senator Roberts.
Thank you, Minister. The TGA have been enjoying unrivalled, unquestioned power since the start of COVID, unaccountable power since the start of COVID. Minister, why is the government extending the powers of the TGA again with a bill that provides zero parliamentary oversight on the new powers?
Minister.
Well, I don't agree with many of the propositions that are embedded in your question, Senator Roberts. I think I've been really clear about the purpose of the bill, or at least the elements which you're asking me about now. This is a bill that seeks to give your very first question was, why do we need these additional provisions and abilities for the TGA? And the answer is because from time to time we see shortages arise where interventions are required to protect the interests and the health interests, in particular of Australian consumers. We want to make sure that the TGA has the capacity to manage these kinds of shortfalls.
Senator Roberts.
Thank you, Minister. I appreciate what you just said. I don't agree with it at all, because the TGA has run roughshod over the people of Australia when it comes to health. They are not held accountable. We need to return, in my opinion, Chair, to the days when the Department of Health approves or does not approve a drug, and then it can be held accountable to the Parliament. That's not the case with the TGA. It completely bypasses the Parliament. So I foreshadow my amendment to introduce a provision to the existing legislation that any approval issued under this legislation must be by way of legislative instrument to allow the parliamentary scrutiny. We represent the people, not the TGA. TGA has so many close contacts and close conflicts of interest with the big pharma. Gets 96% of its revenue from big pharma. Minister, why is there so little parliamentary oversight of our health bureaucracy?
Senator Roberts, did you wish to move that amendment at this point?
One more question, then I'll move the amendment.
Minister.
Thanks, Chair. Senator Roberts, I think you and I have a different view about the level of oversight. The TGA is part of the Department of Health. The Department of Health appears regularly at Senate estimates. There are also a range of forums in which the Parliament may ask questions about these issues, including, of course, in this place, in our own question time. Our government is committed to scrutiny. And I simply disagree with the proposition that you have made in your question just now.
Senator Roberts.
You're welcome to disagree, Minister. I'm sure that you welcome my disagreement. We saw the previous head of the TGA, Professor John Skerritt, retire from the TGA and 8 months later get a job on the board of Medicines Australia, the big pharma medical lobby in this country. We also see that the TGA gets 96% of its revenue from big pharma. That is a reason why we need to take the approval of drugs away from the TGA. Big pharma is not trusted. And by association, and during the COVID mismanagement, we don't trust the TGA anymore. So, Chair, I move my amendment as circulated.
So this is amendment number 1 on sheet 3379, just confirming that?
Correct.
Senator Roberts?
Correct, Chair.
Thank you very much. Senator Ruston.
Thank you, Chair. I just would like to make a couple of comments on the contribution that Senator Roberts has just been speaking to in relation to his amendment on this particular bill. And I probably would have a great deal of sympathy with Senator Roberts' position, particularly after the comment by the government that they're committed to scrutiny. I don't think anything could be further from the truth when we've seen the amount of times that transparency has been denied this place. In fact, this morning we had half an hour contribution about the refusal of this government to be transparent when it comes to the NDIS. So I certainly have a great deal of sympathy for the lack of scrutiny that this government is largely prepared to allow this Parliament and the Australian public of their actions over their time in government. But but also, in saying that, understand that one of the most critical issues that's been facing Australia of recent times has been the level of drug shortages, that medicines and treatment shortages coming into Australia for a number of reasons. And one of the things that we must always do as a legislature is to make sure that whilst safety and efficacy are at the forefront of every decision that we make in relation to providing treatments and access to treatments for Australians through the necessary processes that exist within the Department of Health, and that includes through the TGA, we also need to make sure that we have got quick access, because we know that so many Australians rely on treatments, and when there are shortages, the ability for the government to act with some haste in order to put supplementary or substitute treatments and medications in place to ensure Australians that rely often on these life-saving and life-changing treatments are not denied to them. But at no time should safety ever be compromised for Australians, but we do understand that many Australians do rely on the agility of our health department and its agencies to make sure we do that, but acknowledge the lack of scrutiny and the lack of transparency which has become a hallmark of this government.
There being Minister, are you seeking the call? Or I'll put the question.
I thought I'd indicate the government's voting position. As I understand it, Senator Roberts' amendment seeks to essentially require certain decisions to be made by way of a legislative instrument rather than by notice of writing. The government considers that this would be unnecessarily burdensome and would deprive the TGA of the flexibility that is necessary to manage the health interests of Australians, and we won't be voting in favour of Senator Roberts' amendment.
Senator Steele-John, were you seeking the call?
I may have a couple of questions, Chair, but not in relation to the One Nation amendment, so I'm happy for that to be transacted and then go back to questions on the bill.
All right, well, if there are no further contributions, I will put Senator Roberts' amendment on amendment number 1 on sheet 33789. Those in favour of that amendment say aye. Aye. Against say no. I believe the noes have it. Ring the bells. Division required. Ring the bells. That's all right. Lock the doors. Question before the chair is that amendment number 1 on sheet 3379, moved by Senator Roberts, be agreed to. Ayes will pass to the right of the chair, noes to the left. I appoint Senator Roberts, teller for the ayes, and Senator Collins, teller for the noes.
Someone made a good suggestion on time. Instead of having the vision, why don't you just push a button yourself? Yeah.
The result of the division is ayes 5, noes 45. The question is resolved in the negative. I'll just give senators a moment to resume their places. And I'm seeking further contributions in the committee stage. Senator Steele, John, did you?
Yeah, thank
Senator
you.
Thorpe, you seeking the call?
Yes, Chair. Is this where I move my amendments?
Yes.
Could I maybe put them together to save time?
So, Senator Thorpe, one is a request and one is an amendment, so they will need to be moved separately, so we can just deal with them one after the other.
Sure, thank you. Chair, I move the amendment on sheet 3372.
And you wish to put, or do you wish to speak to that, Senator Thorpe?
No, I'm just moving.
Minister.
Thanks very much, Chair, and thank you, Senator Thorpe, for your contribution in the second reading debate. And as I indicated in my response, your engagement with Minister Butler about this set of questions. As I have said in relation to the second reading amendment, like that, where the government doesn't support this amendment, we are working with counterparts in state and territory jurisdictions on our response to the independent national review of First Nations healthcare in prisons, and we consider that those matters are best dealt with in that way, but we thank you for your constructive engagement on these questions.
There being no further contributions, I will put the amendment. Question is that the request for an amendment be agreed to as moved by Senator Thorpe. Request number 1 on sheet 3372. Those of that opinion say aye. Against say no. I think the noes have it. Division required. Ring the bells. lock the doors. The question is that the request for Amendment 1 on sheet 3372, as moved by Senator Thorpe, be agreed to. The ayes will pass to the right of the chair, noes to the left. I appoint Senator McKim. Senator McKim, teller for the ayes, and Senator Collins, teller for the noes.
I'm going to add you as a teller.
Thank you, Rustin. We've got Steele John, Sheldon.
Steele John.
Pocock Barbara. Gosh.
Pocock Barbara.
Hanson Young.
Hanson Young.
Hodgins May.
Hodgins May.
Orman Payne.
Orman Payne.
Thorpe. Hanson.
Thorpe.
Payman. Roberts.
Payman.
Tyrrell. McCarthy.
Tyrrell.
Shoebridge. Cox.
Shoebridge.
Wish-Wilson.
Wish-Wilson.
Waters. Whittaker.
Waters.
Farouk. Walker.
Farouk.
Did I say Hanson too?
You did, Senator.
Outstanding. Holland. 13. Thank you.
13, Senator. Are you happy for me to certify? Thanks, Senator.
The result of the division is ayes 13, noes 35. The question is resolved in the negative. Oh, Senator Hanson.
I wish to foreshadow my amendment on sheet 3372. But before that, I wish to speak to my amendment and what it means. And it's basically asking for photo ID to be shown when you go to the doctors. Now, Medicare at the moment, we're facing about $3 billion debt a year through rorts that are happening. And I have advocated this before, and to get photo ID on the Medicare card. But my amendment was basically to be able to show identification, so it can be through your driver's licence or a passport or other identification that is going to prove that it's actually you that's getting the doctor's appointment. Why I say this, my first time around in Parliament in 96 to 98, I was advised then by the Federal Police the rorting that went on in our Medicare system, where people were actually coming across from overseas using our Medicare system and getting prescriptions, taking it back to their country and selling them on the black market. That was known to the Federal Police, and they informed me about it. Nothing has been done about it. There was another case where a gentleman had a friend visit from Macedonia. He actually then took his friend's card. He got sick. He ended up in hospital and he died in hospital. they had this other fellow who was an Australian. They believed that he died, but he had to come forward and say no. He loaned his card to his friend, and therefore no charges, nothing laid. We have now in Australia 100,000 plus people who are illegally in Australia overstaying their visas. We also have the number of foreign students in Australia, which expanded out to 750,000. These foreign students have friends and family also. So they can actually take their family or friends' Medicare card, go and abuse our system. You also got doctors that are, prescribing medication to these people. It shouldn't be. That's an added cost on our PBS scheme that we, the taxpayers, are funding and should not be funding this at all. Then you have even doctors are falsely claiming funding for appointments they did not have. This is an ongoing problem that we have in Australia. Also, these people are not paying the right price to go and see it. They would go to bulk billing. Of course, the government tells us they are going to raise the bulk billing rates to 90% in just a few years. Well, I'll believe that when I see it, because I don't believe it's going to happen. Also, the rising costs of the doctors and rents and what's happening, they can't afford to give the bulk billing. They're not meeting their costs or overheads of staffing, rates, electricity costs to run their practices. With the Medicare as well, it is also being brought to the figures are that we're going to be 10,000 doctors short within the next 5 to 6 years. How can we keep giving decent health care to Australians? I know that a lot of people are saying it takes them two weeks plus to actually get in to see a doctor, at least. Some are even longer than that. Doctors have closed their books. They're not seeing people. Our hospital system has been overrun with people because they're going to the emergency section because they can't see a doctor. It is an absolute disgrace what is happening here. And all I heard from the Labor Party during the campaign is about this Medicare scare. That's all you've put out there. You said you were going to open up these 24/7 bulk billing. It never happened. You only had a couple that actually opened 24/7 because you can't get the doctors. So what you're also doing is you're taking doctors from general practices to put them in this bulk billing. Medicare, what you're saying, looking after the public. But all they are is the first responders. You see them for the first time, but you don't go back to them. You have to go back to your GP. So what's happening then? All these people have gone out the GP because they're getting paid better in your bulk practices that you're setting up, and yet there's no one to go back to in these communities because they've left it. You're causing more of a problem of what you're supposed to be dealing with and sorting out the Medicare, which is rising in cost, and you've not. I just don't see. You haven't got the answers for it. The hospitals are overrun. You haven't got beds that are provided for the public at all. My proposal here is to actually put forward showing identification. There's nothing wrong with that. Show the public that you are fair dinkum about saving the taxpayers' dollars here and not allowing people to rip off the system. That's the least that the public could expect from this government, is that you are not going to provide services to people. If they want to go and see a doctor, fair enough. If you're not an Australian that's entitled to this service, then pay them the price for it. These people are supposed to come here, they've got their insurance, they should be able to pay for it. But you expect the taxpayer to pay for this. This is something that I've raised for years, time and time again, yet you do nothing about it. You think it's a endless pot of gold out there for the public to pay for. With the same with NDIS, another Aboriginal industry. I'll keep going on and on. The waste of money that we have out there, that you're not reining in the cost of the Australian taxpayer. So this amendment that I am putting up, I'm calling for support on this to prove to the Australian taxpayers that you are fair dinkum about reining in the rotting that is going on, that it needs to be stopped. So I'd like to move my amendment that is on sheet 3373.
So you moved your amendment, Senator
Yes.
Hanson? Minister.
Thanks, Chair. I'll just really quickly indicate that the government doesn't support the amendment. In 1984, we introduced Medicare, and you're right, Senator Hanson, we will continue to defend Medicare and to protect it, because it's based on a really simple promise, which is that if something goes wrong, if you get hurt, if you get sick, if you need help, you won't be on your own. And Medicare will be there for you. Our view is that we will get on with the job of strengthening Medicare, because you really should only need your Medicare card if you need to see a doctor, not your driver's licence, not your credit card, your Medicare card, and it's on that basis we oppose the amendment.
Senator Ruston.
Thank you very much, Chair. Whilst we won't be supporting Senator Hanson's amendment because we would have liked the opportunity to have had more time, we do understand the intent that she's trying to achieve here, and that is making sure that we minimise the amount of fraudulent activity that occurs in Medicare, and that is absolutely to be commended. But Senator Hanson also makes some very, very good points about the fact that under this current government, Australians are being incredibly misled about Medicare. And nothing could have been more egregious than during the election campaign than the Prime Minister waving around his Medicare card, trying to con Australians into believing that that was the only card that they needed when they went to the doctor. Well, Australians know a very different story. They know when they go to the doctor because it hits them in the hip pocket. They don't just need their Medicare card. And under this government, the amount that they are paying on their credit card or out-of-pocket expenses has never been higher. It is the highest amount that has ever been paid by Australians to visit their doctor under Medicare. So I think it's incredibly disingenuous for the Labor Party to come in here and pretend that Australians don't need anything but their Medicare card when they know the truth is it's never been more expensive.
Senator Ruston, it being 1:30, the Senate must move on. As at 1:30 p.m, the committee report to the Senate. The committee reports progress. We'll now move to 2-minute statements. Senator Bragg.
Well, I was shocked to read on the weekend that the CFMEU's new New South Wales boss, Mr Michael Crosby, was saying that we are, quote, looking at large, multiple, complex residential construction sites and, quote, it may push up costs when we appear on site. So this is the same CFMEU which was supposed to have been put into administration by this parliament, which is now rearing its ugly, corrupted, mafia-like head in New South Wales. And just as Victoria is effectively a failed state and Queensland has had the CFMEU disease, now New South Wales will be subjected to that. And the worst part about this is that younger Australians will pay the price for this union cartel mafia behaviour. Younger Australians will not be able to buy, in the main, a standalone brick or weatherboard house. For most young people, their first house will be a small apartment in a highly urbanised population like Australia. And younger people will have to pay this 30% criminal tax, thanks to the CFMEU brought to you by this Labor Party. Now, the other thing that has occurred to me is that maybe this is all part of the grand plan. More evidence that Labor is pursuing a corporate and institutional housing agenda in place of individuals. Now, the Australian people know that the Great Australian Dream is about people, not about institutions. But under Labor, there is a cartel of CBUS, CFMEU and co. Also, at the same time, we see the government supporting foreign asset managers, BlackRock, foreign governments to purchase Australian housing stock. It really is a sick perversion of the Australian dream.
Thank you. Senator Dominion.
Thanks. It's an honour to speak about the incredible work of Emily's List Australia today, our country's only financial, political and personal support network for progressive Labor women in politics. And I want to acknowledge the CEOs in the gallery today. Since its first candidate stood in 1997 to 98, the Emily's List has supported over 600 progressive Labor women. More than 300 of them have gone on to be elected to state and federal parliaments. This is an extraordinary achievement. At the heart of this work, though, is mentoring. Every Emily's List endorsed candidate is matched with a mentor, a former MP, a unionist, a community-based campaigner, someone who knows the road and walks beside them every step of the way. This kind of support, personal, practical and political, creates lifelong bonds between women leaders across generations and geographies. It's been a privilege to be a mentor myself. I want to acknowledge one of those mentors, Leonie Morgan, who is also in the gallery, a long-time friend of mine who I've had the benefit of her mentorship. Her guidance, experience and unwavering commitment have made a difference to countless campaigns and candidates. Today, we are seeing the results of decades of work of women just like Leonie and Pam and others. A record-breaking 49.1% of our federal parliamentarians are women. Women now make up 56% of the Labor Party room, and for the first time in Australian history, there are more women than men in the federal cabinet, 12 women and 11 men. Here in the Senate, 65% of Labor senators are women. We know diverse, equitable leadership doesn't just happen, it takes organising, mentoring and backing each other in. That is the mission of Emily's List, and it is working. Thank you.
Thank you, Senator. Senator Hanson-Young.
Thank you. Well, I rise today to speak about the brutality and suffering that we're seeing, that we are witnessing unfolding in Gaza right now. And I, like many Australians and so many other people around the world, saw those images of starving children splashed across our newspapers and our television screens and in our social media feeds. And the sickening feeling of seeing a child, just skin and bones, an innocent child, using starvation as a weapon of war is illegal, it's immoral, and it's brutal. There is no justification for starving innocent children, for stopping innocent children and their families from receiving food, aid, clean water. The extremist position from the Netanyahu government that continues to use the innocence of these children as their weapon of war must be called out and must be confronted. There is just no justification for this. 1 in 5 children in Gaza are suffering severe malnutrition. Australia must join with countries around the world in not just condemning this, but taking action against the brutal forces that are forcing these children to starve.
Senator O'Sullivan.
Thank you very much, Acting Deputy President. Technology is a beautiful thing, and I say that as someone that genuinely loves it. I'm usually the first in my family to pick up on new apps, tools and trends, and what excites me about technology is its potential to enhance human life, to make things better, smarter, more connected, and that's the beauty of it. Its Greek root techne means craft, something shaped with intention. But craft alone is not enough. It needs telos. It needs purpose. Technology must be guided by a clear sense of why it exists and who it is meant to serve. Artificial intelligence is advancing at a rapid pace. What we once thought of as futuristic is now a daily part of life. Gen Z and Gen Alpha are not Googling anymore, they are ChatGPTing. If you say you Googled something, you've dubbed yourself as maybe a boomer. This shift isn't just cultural, it's generational, and it's accelerating faster than our ability to regulate it. Other nations are acting. The European Union has passed the world's first comprehensive AI law. The United Kingdom has launched a national strategy to ensure AI development is safe, transparent and in the public interest. And the United States Congress is also progressing bipartisan legislation. But Australia is behind. We risk becoming passive recipients, not just of foreign technology, but of foreign values. AI experts predict that with the rapid development of large language models, life as we know it has about 12 months left before it comprehensively changes. Now that might sound dramatic, but it's true. The opportunity is exciting, but the threat is equally as real. We need laws that ensure that AI serves the Australian people, upholding privacy, protecting the vulnerable and putting people before algorithms. The time to act is now.
Thanks, Senator Sullivan. Senator Polly.
This week, we on this side are delivering on the Anthony Albanese Labor government's key election commitment to protect penalty rates for around 2.6 million Australians, award recipients who rely on those to make ends meet. The reform will amend the Fair Work Act 2009 to legislate to protect and ensure that penalty rates and overtime rates in modern awards cannot be reduced or substituted by another term that will reduce an employee's take-home pay. It displays the priorities that this government places on protecting and standing side by side with Australian workers. If only we could say that about those opposite, but we know that there are over 1.3 million retail workers across this country, and we know that they're on the front line. Now, we know hospitality workers will be caught in this legislation as well. But I wanted to talk about retail workers and how important it is that they have such a strong advocacy of the Shop Distributor and Allied Workers Union, better known as the SDA, who have been at the forefront of ensuring that these rights are protected. And I want to particularly acknowledge the Secretary of the Tasmanian branch, Joel Tynan, for his commitment, along with all the other executives and the National Secretary of the SDA, because this work is so important. I can remember during COVID, everyone was singing the praises of those on the front line, which included retail workers. But what we are now doing is we're delivering to make sure those workers get what they deserve so that there is overtime and penalty rates, because that's so important for these workers to be able to make their families' budgets, to be able to afford to buy a home, to be able to afford their rent. So I commend the union for their work, and I condemn those opposite who are still opposed to this. Just like big business, they don't want to do the right thing
Senator
by Australian
Polly,
workers.
your time has expired. Senator Stacey.
Today, Crikey has issued a statement about me. It's titled, "One Nation Senator Warned Against Giving CPR to Dying Man in Belfast while Serving in the British Army." This is taken from a diary that was published by one of my colleagues, and it does refer, in fact, to that very event. A house search was being conducted. An elderly man was very angry at the fact that we were searching his house, and he eventually had a heart attack. He was laid on the floor. His wife, who had been quite agitated during the search, refused to allow us to do any to help him in any way. I was reported as saying, and this is correct, these are my words, telling my colleague not to pump his chest, as I'd been told that to do a good job on that, you had to hear the ribs crack. And I didn't think that would be a good look at any subsequent inquest. Now, needless to say, the media the following day after the search exaggerated, of course, claiming that medical assistance was refused, ambulance was delayed, the man was assaulted, his wife was assaulted, and so on. The Secretary of Defence, later in the House of Parliament, in the Commons, said that the search was properly conducted as part of their security duties by the soldiers concerned. The only point I'll add from a personal point of view is that my reference to hearing ribs crack came from my own experience of performing CPR on my grandmother, who died in front of me from a heart attack when I was 20 years of age, and I, in fact, heard her ribs crack. So I was very aware of the fact that that kind of damage could occur, and I trust you'll appreciate that under the circumstances, to have that kind of thing determined at an inquest would not have been a very positive outcome for me and for my fellow soldiers.
Thank you. Senator Canavan.
Thank you, Madam Acting Deputy President. Well, on the weekend, I was able to travel back home, and there in Rockhampton, I went and inspected the $1 billion water pipeline that is being built from the Fitzroy River to Gladstone this pipeline was to deliver 30,000 megalitres of fresh water from the Fitzroy Basin. We'd burn it, or Fortescue and others would burn it, turn it into hydrogen and export it to North Asia. I always thought that was a crazy idea to export fresh water from the nation, the world's driest continent. But be that as it may, that's what the government pumped millions of dollars into. In the end, thankfully, that project is not going ahead. But I went out there to have a look at how much has been wasted. It is wasted. It is a massive project. A few weeks ago I went and looked at the Gladstone end, which is its own story. But at the Rockhampton end of this project, there are massive sheds, huge amount of equipment on site, as I said, costing $1 billion. From the conversations I've had with people locally, they forgot to put a substation in, so they don't power the pumps, the water pumps from the grid. They're using diesel pumps. Diesel pumps. This was notionally for a green hydrogen project, but they were using diesel pumps. Fortunately, that's not going ahead, as I say, but unfortunately, 90 people lost their job in Gladstone because of the government's missteps here on this. They made promises to us all that they would create these jobs. They've done nothing but waste billions of dollars of government money, taxpayers' money, and they're set to do more. The government is still pushing ahead with more than $10 billion of hydrogen programs as we speak, even though all of this is not working. Even Anastasia Palaszczuk, the former Queensland Government Premier, said hydrogen is not ready. So isn't it about time we stop wasting money and focus on things that actually can create jobs in this country?
Thank you, Senator. Senator Whittaker.
Thank you, Acting Deputy President. Western Australia is critical to the future of advanced manufacturing, clean energy and national economic security, and this Labor government is backing WA to lead that future. My state is home to the critical minerals and resources the world needs for the clean energy transition. And the Albanese Labor government is making sure we don't just dig them up and ship them out. We're building industries that can turn those resources into battery cells, solar panels, wind turbines and green metals at home in WA. The $15 billion National Reconstruction Fund is backing that shift. It's helping WA businesses scale up in everything from processing critical minerals and, Senator Canavan will be pleased to hear, hydrogen and clean energy manufacturing. We're unlocking jobs right across our state, from the Pilbara to the southwest, and helping local industries break into global supply chains. And this is all part of something bigger. Last year, Labor's $22.7 billion Future Made in Australia package marks the most significant investment in nation-building industry policy in a generation. It's what unions have long fought for, and it's what workers in places like my state of Western Australia have long deserved. We've moved beyond the question of if we will make things here, and now it's about how we do it. How we do it with local workers, WA materials and WA skills. It's why this government is investing in $500 million in skills and training for priority industries like manufacturing, construction and clean energy, expanding free TAFE, supporting apprentices. Under this government, we're not exporting opportunity, we're creating it right here. This is what a future made in Australia looks like, and it's in WA.
Senator Faruqi.
Thank you. Today is the Day of Action for Greyhounds, organised by Animal Liberation. Right across the country, people who care about animals are speaking up for greyhounds. These dogs continue to be exploited, overbred, injured and killed by an industry that values gambling profits over the welfare of greyhounds. I've been campaigning with animal advocates and activists for years to shut down the greyhound racing industry because I know it is rotten to the core. It kills and maims dogs, fuels a worsening rehoming crisis, and shamefully is still being propped up by public subsidies. In New South Wales, we are waiting for yet another government report. And we expect the same excuses. Blame a few bad apples, offer one more chance, and pour more public money into cruelty. The New South Wales Labor government is hooked on gambling donations from companies like TAB and Sportsbet, and it is turning a blind eye to the deaths of greyhounds on and off tracks. The gambling and racing industries have a truly corrosive influence on our society and on our democracy. They prey on vulnerable people and are built on the cruelty and death of racing animals. Meanwhile, New Zealand has shown real leadership by recommitting to a ban on greyhound racing. As our friends at the Coalition for the Protection of Greyhounds point out, 15 deaths were enough for their racing minister to recommit to the ban. In the same period, 119 greyhounds were killed on tracks in Australia. And here, nothing. Australia is one of the last countries on earth to still allow greyhound racing. It is time to end this cruelty once and for all and let these beautiful doggos run for fun, not their lives.
Thank you, Senator Babiat.
Everything the government touches turns to you-know-what, but not much suffers more than housing. We are in the middle of the worst housing crisis in our nation's history. And what does the government do? And both sides are guilty of this. More of the same failed interventions. They pump the market with first home buyer grants. They just inflate prices. They guarantee high-risk loans using taxpayer funds. They roll out shared equity schemes, but nothing says freedom. Nothing says freedom like co-owning your house with the government, people who can barely balance a budget. They opened the migration floodgates. Record numbers of people have come here recently, and then they wonder why there's a shortage of homes. It's not complicated, guys and girls. It's basic economic supply and demand. We now have the most unaffordable housing on earth, second only to Hong Kong. In 1990, homes cost about 3 times the average household income. Today, it's roughly about 10. Young Australians, they're losing hope. Families are breaking under the weight of mortgages and rent. Parents are forced to outsource parenting to the state, trading family time for double shifts and longer hours just to keep a roof over their heads. And the government's answer: more government, more demand-side stimulus, a bigger bubble. Just stop meddling, just get out of the way. Australia needs this: more land release, lower taxes, less migration, less red and green tape, and far less taxpayer-funded demand-side stimulus. In short, and this is the answer for almost everything in this place, less government, more freedom. That's it. Thank you.
Senator Sheldon.
Well, let's just have a think about this. Do people deserve fair wages? Do they deserve fair conditions? Should the low-wage workforce in this country get a fair go? Now, you think the answer to that would be yes for everyone. But unfortunately for the Liberals and Nationals, it's always been a no. Now, just take a look at what's happening with the Shop Distributive and Allied Employees Association, or the SDA, and the McDonald's in South Australia. Earlier this month, the Fair Work Commission ruled that 5,000 McDonald's employees in South Australia will now have the right to bargain together for better paying conditions. These are young, casual, low-paid workers, some in their very first jobs. And now they finally have a voice, all because the Albanese Labor government passed supported multi-employer bargaining laws. The SDA is now moving to extend that right across the country to 115,000 McDonald's staff nationwide who have been stuck in award row rates minimums for years. So why does this matter? Because these are the exact same laws the Liberals and Nationals voted against. Whenever it comes to lifting wages or improving people's lives, they oppose it. Just listen to what their frontbenchers have said. On the 24th of March 2024, Barnaby Joyce said on Sunrise that Labor's $110 a week minimum wage rise was window dressing. On the 11th of November 2022, Angus Taylor told Sky News he opposed multi-employer bargaining because it pushes up wages. On the 3rd of December 2024, Michaela Cash called Labor reforms disastrous. On the 24th of September 2024, Susan Lee warned of radical industrial relations changes. Meanwhile, the workforce wants a better deal. Labor is backing Australians who want a fair go.
Thank you. Senator Thorpe.
Thank you. Last month, thousands of people across the country gathered to demand justice for Kumanjay White, a 24-year-old Warlpiri man with a disability who died after being restrained by police in a Coles supermarket in Mwanti, Alice Springs. He was from the same community as Kumanjay Walker, who was killed by Northern Territory police officer Zachary Rolfe in 2019. The recent coroner's report into Walker's death confirms that what we already know. Racist police in this country still treat First People as the enemy. There have been 13 black deaths in custody already this year, at least 599 since the 1991 Royal Commission. And yet, instead of a national plan, all we hear from this government are excuses. Let me be clear, the federal government can act. It must act. And so far, it is choosing not to. Here's some things the federal government can do today. Stop funding states and territories who violate human rights and harm our people. Legislate national minimum standards to end torture-like prison conditions and remove hanging points. Establish national oversight and monitoring of the implementation of Royal Commission recommendations. Fund our community legal, health, housing and family violence services to self-determine what's best for us, and listen to and support the request of the families. This government has the power. The responsibility couldn't be any more clearer. What is missing is the moral compass and the guts to act, Labor. To Yendamu and all families affected by deaths in custody, I hear you, I stand with you, and we won't stop fighting until we get justice.
Thank you, Senator. Senator Smith-Dean.
I want to acknowledge the quiet but life-changing work being done by the Future Bayswater organisation, which in partnership with St Vincent de Paul is helping to fight food insecurity across Perth suburbs. It runs the 6053 Pantry program, providing food and other essential items for those in need. The 6053 Pantry is made possible by a hard-working team of volunteers, some of whom I was fortunate enough to meet when I visited recently. They include 9-year-old Mitchell and 7-year-old Libby, inspiring young locals already giving their time to help stacking shelves at the pantry. Every year, volunteers, including Mitchell and Libby, also put together Christmas hampers for households doing it tough. These hampers, packed with groceries and festive treats, offer a moment of hope and relief and a reminder to people who are struggling that not all are alone. In 2024, the 6053 Pantry delivered more than 300 hampers to households, including 13 households from Gerraween, which is over 16 kilometres away from Bayswater. Many had never reached out for help before. Sadly, this is what food stress looks like in 2025. Families skipping meals so children can eat, elderly people choosing between groceries and medication, and working people turning to charities because their wages no longer cover their basic needs. In the past year alone, demand for food relief across Western Australia has risen by over 20%. It has made food relief charities and programs more vital than ever, including the 6053 Pantry. But we should also be deeply concerned that we rely on them so heavily. While the generosity of 6053 Pantry shines a light in dark times, it also forces us to ask ourselves how better should the Albanese government be supporting...
Senator Smith-Mariel.
Thank you, Acting Deputy President. 5 years ago, I sat with brave young workers from McDonald's in Murray Bridge in South Australia who had been subjected to horrible, unlawful, anti-union behaviour and had their rights at work undermined and abused. And what these workers exposed was shocking and not limited to just one store in Murray Bridge. We've heard these stories from Macca's workers reported in the media since. Stories of break requests being denied, in one instance a break request being denied to take basic medication. Others said they were called annoying for asking for water or bathroom breaks. But with the support of their union and the SA and NT branch of the SDA in particular, these brave workers chose to stand up together and fight back. From Murray Bridge to the courts, they stood up and fought back. And not only did they see their case settled, but their courage has had ripple effects across the entire industry. With just last month, the Fair Work Commission agreeing with the SDA that Macca's workers across SA should have the right to bargain together for better pay and safer conditions. This means that more than 5,000 South Australian Macca's workers at 53 stores owned by 18 franchisees will now be able to negotiate together, a direct result of Labor's multi-employer bargaining legislation. And of course, we are not done yet. And our work has delivered real wage increases for millions of workers across Australia. This week we will introduce legislation to protect penalty rates in awards into this place. As a government, we will continue to stand with workers across the country, like those brave Macca's workers from Murray Bridge, stand with them, fight alongside them and the unions who fight with them every single day.
Thank you. Senator Gallagher.
President, I just want to make some comments about the 48th Parliament being a historic gender-equal parliament. 112 women out of 226 MPs and senators, so 49.56% overall. Women are 46% of the MPs in the House of Representatives. And here in the Senate, female senators, women senators are 56.6% of senators. In the Labor caucus, President, 56% of Labor members and senators are women. 69 out of 123 members. A majority of Labor's cabinet are women members. We have a gender-equal cabinet at 52.2%. A majority of Labor's representatives in the House of Representatives are women. 53% of Labor's MPs are women, 50 out of the 94 members in the other place. And here, 19 of the 29 senators are women. And the reason this is important, President, is because it makes a difference when it comes to delivering for women around the country.
Thank you, Minister. The time for Senator statements has expired. We'll move to question time. Senator Cash. Oh, Senator Wong. I was going to do it next, but I draw to the attention of honourable senators the presence in the gallery of a parliamentary delegation from the Justice, Law and Human Rights Committee of the Parliament of Fiji. On behalf of all senators, I wish you a warm welcome to Australia and in particular to the Senate. Minister Wong.
If I could seek leave just for 1 minute to make a short statement.
Is leave granted?
I think the opposition, I just wanted to say bula to our friends from Fiji. We value deeply our strong relationship with you. It is a bipartisan relationship and we welcome you to the Senate.
Thank you. Let's move to question time. Senator Cash.
Thank you. And my question is to the Minister for Trade and Tourism, Senator Farrell. Minister, yesterday you told Australians twice that President Trump raised the beef import ban directly with the Prime Minister as part of one of their phone calls. The Prime Minister denied this, and you have been forced to backtrack. Did the Prime Minister or his office direct you to change your story?
Thank you, Senator Cash. Minister Farrell.
Thank you, Senator Cash. No, I made a mistake. President Trump referred to the US beef exports in relation to Australia on his so-called Liberation Day speech and not in discussions with the Prime Minister. On realising my mistake, I apologised to the PM and I corrected the record with the journalist involved.
Thank you, Minister. Senator Cash, first supplementary.
In the first instance, how were you informed of this so-called mistake? And given the seriousness of international biosecurity and the potential impact on Australia's beef industry, can you confirm whether you were mistaken, misinformed or misrepresenting the facts when you were forced to retract your claim? And how can Australians have confidence in a minister who cannot keep account of his international trade negotiation consistent?
Thank you, Minister Cash. Order. 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 Minister I'm sorry. Order. There needs to be order. I've called the Minister. Minister Farrell.
Thank you, President. Thank you, Senator Cash, for your first supplementary question. Look, you know, one of the things my mum taught me as a child was if you make a mistake, own up straight away. That's what I did. What do you do when you make a mistake, Senator Cash?
Thank you, Minister Farrell. Senator, order. Senator Cash, second supplementary.
And Minister, are you now prepared to table the full briefing or record of discussions regarding US beef imports between the Prime Minister and the US President and between your own department and US officials so that the Australian people can know who influenced this decision and whether the Prime Minister is telling the truth?
Thank you, Senator Cash. Minister Farrell.
Thank you, President. Thank you, Senator Cash, for your second supplementary question. In my experience, the Prime Minister always tells the truth. Always tells the truth. When I make a mistake, Senator Cash, I own up. I come clean. I realise my mistake. I corrected it as quickly as I could. If other journalists rang me, I corrected it with them. I made a mistake, I've corrected it, and that's, as far as I'm concerned, the end of the matter.
Thank you, Senator Cash. Senator Ananda-Rajah.
President, this is not my first speech. My question is to the Minister representing the Prime Minister, Senator Wong. The Albanese Labor government's #1 priority in its first term was addressing cost of living pressures facing Australians. How does the government plan to build on this approach and deliver more cost of living relief, in particular by making medicines cheaper?
Minister Wong.
Can I thank Senator Ananda-Rajah for that excellent question. I know she knows a lot about the health system and she understands, as all Labor senators do and members, the importance of delivering cost of living relief. In 2023, we made the largest cut to the cost of medicines in the history of the Pharmaceutical Benefits Scheme. We brought the maximum price of PBS-listed medicines down from $42.50 to $30 a script. And we did this for all Australians, And Australians have saved more than $1 billion thanks to our pledge to make medicines cheaper. And now we're doing even more. My colleague, Mr Butler, will introduce legislation this week to cap the cost of a PBS prescription at $25 a script and continue the freeze for pensioners and concession card holders at $7.70 until the end of the decade. So this government, having already made the largest reduction in the price of medicines in the 75-year history of the PBS, is now delivering a further election commitment, delivering more cost of living relief to Australians and in particular to pensioners, because we on this side believe that no Australian should have to skip the medicines their doctor says they need because they can't afford it. Now, President, we all remember how those opposite responded to the Albanese Labor government's implementation of cheaper medicines. Right. We all remember what they did. Can we remember? They opposed it. They've opposed it all. They voted against cheaper medicines for Australians. They voted against more money in the pocket of Australians. They voted over and over again against cost of living relief for Australians. They still haven't listened and they still haven't learned.
Thank you, Minister. Senator Ananda-Rajah, first supplementary.
Thank you, President. During its first term and throughout the recent election campaign, the Albanese Labor government pledged to support Australians with the cost of living by helping them earn more and keep more of what they earn. The government has advocated for 4 increases to the minimum wage since coming to office, and minimum wages increased by a further 3.5% on the 1st of July. Why can Australians only trust Labor to help them earn more and keep more of what they earn?
Thank you, Senator Ananda-Rajah. Minister Wong.
Thank you, Senator. And what I would say, President, that Australia is this, that Australians can trust the Albanese Labor government to help them earn more and keep more of what they earn, because that is what we have done. That is what we have done. We see wages growing and the government has delivered tax cuts for every Australian taxpayer. And we're building on that progress.
Last week, the Minister for Industrial Relations introduced a bill in the House to protect, Senator Cash, you'll like this, the penalty rates. The penalty rates and overtime rates of award-reliant workers. Now, we know these last 3 years have been difficult for many hard-working Australians, and we also know that low wages were a deliberate design feature of the Coalition's economic policy. Unlike them, we have advocated every single year since coming to government for increases to the minimum wage for almost 3 million workers, and as a result, they are better off over $9,000.
Senator Ananda-Rajah, second supplementary.
The Albanese Labor government is committed to continuing to deliver responsible cost of living relief that helps Australians. How is the government building on its first term cost of living relief measures to provide even more relief for Australians?
Thank you, Senator Ananda-Rajah. Minister Wong.
Thank you, Senator Ananda-Rajah. Well, the government introduced legislation, as you know, to cut student debts by 20%, a change that will benefit 3 million Australians and will make HECS repayments fairer, benefiting millions more students in the years to come, people who are not even at university as yet. The government's increased paid parental leave to 24 weeks. We've increased family and income, individual and family income limits so more Australians can benefit, and superannuation will now be paid on all government-paid parental leave. We've also introduced the Commonwealth prac payment for students in crucial fields like nursing, midwifery, teaching and social work to take pressure off when they are flat out doing prac placements while trying to pay the bills. And we're supporting tradies, supporting new tradies who take up apprenticeships in housing construction, who will receive $10,000 incentive payments on top of their wages. What is clear from the last term and from the approach this term? Labor is for cost of living relief.
Thank you, Minister.
The Liberals are for higher taxes.
Has expired. Senator Colbeck.
Thank you, President. My question is to the Minister for Early Childhood Education, Senator Walsh. Addison's family daycare, located in Latrobe, currently supports 50 children from 37 families operating as a multi-educator family daycare service. 2 services operating out of 2 different divided facilities on one site and have done so for over 15 years. An arbitrary review of regulations by your department will mean that these 37 families and 50 children will no longer have access to a multi-educator family daycare if this is no longer permitted. Why is the government, Minister, closing family daycare services for these 50 children and 37 families when access to service in the Latrobe area is so limited and the waiting time for places is over 1 year?
Thank you, Senator Colbeck. Minister Walsh.
Thank you, Senator Colbeck. I'm not familiar with the case that you've raised with me. I think a family daycare provider in, I think you said, the Latrobe Valley, and I think you said Latrobe, Tasmania, and I think you said there may be proceedings underway to close that facility. I'm not aware of that matter, Senator Colbeck. So if there's more information that I can provide you with about that specific matter, I will. What I will say is that the government is committed to providing Australians with more safe and quality early childhood education across the country. We know that there are many places in the country where families just don't have access to quality early childhood education, be that in long day care settings or be that in family day care settings. And that is why we are implementing the findings of the Productivity Commission review, which we commissioned, including to build more quality early learning in places that need it most, including our outer suburbs and our regional areas. We have a $1 billion fund to invest in quality early education and to do that in places that are underserved so that more Australian families can have the benefits of quality early education.
Thank you, Minister. Senator Colbeck, first supplementary.
Thank you, President. Abracadabra Family Daycare Centre in Devonport in Tasmania has been operating as a multi-educator facility for over 20 years. supporting 33 children from 25 families. The waiting time for a childcare place is also over 1 year. Minister, why is a government reinterpretation of the regulations closing services for these 33 children from 25 families in an area of childcare shortage and waiting lists over a year long?
Thank you, Senator Colbeck. Minister Walsh.
Thanks very much, Senator Colbeck. I refer you to my previous answer, which is that I'm not familiar with the case that you've raised with me. I'm happy to try and find further information for you to assist those families. And if you'd like to provide me with the material that you have, I'm happy to find out more for you. Again, we are committed to families having access to quality early childhood education around the country, no matter their postcode and no matter what their parents do. No matter their postcode really means that we are investing in early education in the places that need it most. And no matter what their parents do, means that we are replacing the punitive activity test put in place by the Coalition and guaranteeing 3 days early education for all.
Thank you, Minister. The time for answering has expired. Senator Colbeck's second supplementary.
Thank you, President. Senator Walsh, in her first answer, talked about implementing the recommendations of the Productivity Commission review. Recommendation 5.3 of the Productivity Commission report specifically supports enabling 2 family daycare centres educators to operate from a single venue to improve accessibility and sustainability of these services in these communities. Why are you not supporting that recommendation and impacting on the accessibility of aged care in my local communities?
Thank you, Senator Colbeck. Minister Walsh.
Thank you very much, President. You referred to the Productivity Commission review in your final supplementary, Senator Colbeck, and we are doing more on early childhood education than you did in your 10 years in government, including commissioning that report and including implementing that report. That report called for a workforce investment, and we are investing $3.6 billion.
Minister Walsh. Senator Colbeck.
Point of order on direct reference. My reference was to the operation of multi-service childcare centres and the rules around using that specifically, and particularly in my communities, but also the Productivity Commission recommendation that directly referred to that element. So perhaps the minister might come back to the question instead of having a crack at the opposition.
Thank you, Senator Colbeck. The minister is being relevant to the question, and I'll call the minister again to continue answering the question.
Thank you, President. And you did mention the Productivity Commission report, Senator Colbeck. We are implementing the findings of that report, including investing $3.6 billion in the wages of early childhood educators, which is the most significant measure that could be taken to stabilise the workforce and provide quality early education and provide families with access to care. Unlike those opposite, the only thing you ever did in office is restrict access for children to early
Walsh.
education.
The time for answering has expired. Senator Shoebridge.
Thanks very much, President. My question's to the Foreign Minister, Senator Wong. Senator, given the Prime Minister has stated in relation to Gaza, quite clearly, it is a breach of international law to stop food being delivered, which was a decision that Israel made in March. When will your government move from statements such as this to material action to enforce international law, such as joining South Africa's genocide case in the ICJ, Magnitsky sanctions against the whole Netanyahu Security Cabinet, and an end to all military cooperation with Israel?
Thank you, Senator Shoebridge. Minister Wong.
Thank you, President. Thank you to Senator Shoebridge for the question. And as you would know, President, the catastrophic situation in Gaza has gone beyond the world's worst fears, and we know that Australians and people around the world are distressed and angry about what is occurring, including the ongoing violence and the deaths of so many innocent civilians, and this is unacceptable. As the Prime Minister said, and I think Senator Shoebridge went to this, it is a breach of international law to stop food being delivered, which is the decision that Israel made in March. I would add to that, it is also a breach of decent humanity. It is a breach of decent humanity. Now, it is the case that Australia is not a central player, but we do add our voice to the calls from the international community, and Senator Shoebridge would be aware I joined, as Foreign Minister, a statement from what was then, I think, 27 other countries. Since then, others have added themselves to that statement, and that is a good thing. Together with partners, we have called for all parties to abide by international humanitarian law. Together with partners, we have condemned the denial of aid, the killing of civilians. Together with partners, we have been part of the international call for ceasefire and hostage deal, and we remain unequivocal in our condemnation of Hamas. We have also, as you would be aware, we do not provide weapons to Israel and have not for 5 years since this conflict began. We have sanctioned extremist settler entities and individuals, and we have sanctioned members of the Netanyahu government for the human rights abuses of Palestinians. And we've called on Israel to abide by the decisions and findings of the International Court of Justice.
Thank you, Minister. Senator Shoebridge, first supplementary.
Thank you, Minister. Given you have repeatedly stated that the Australian government has full knowledge of concurrence of what happens at Pine Gap, what steps have you taken to ensure the joint US-Australian spy facility at Pine Gap is not being used to assist the Israeli military in its breaches of international law as identified?
Senator Watt?
Order, President. I don't really see how that's relevant to the primary question that Senator Shoebridge asked.
Thank you. I'll seek some advice on that. I am advised. The question is quite comprehensive in the way it's been drafted, therefore it drifts across some portfolio areas. But as a supplementary question, it does also contain some references to the primary question. So I'm going to invite the Minister to answer the question which relates specifically to her portfolio matters. Minister Wong.
Well, thank you. I understand that the Greens are desperate to try and gain domestic political traction from this conflict, and so desperate that they would make the assertions that are being made, which are not responsible and are inaccurate. Senator Shoebridge, I think we all understand some of the political tactics, including by the opposition in relation to this conflict. I think most Australians are appalled by what they see, but also recognise that they don't want the conflict reproduced here by people making inaccurate statements like the one you just made.
I believe the Minister has concluded her answer, Senator Shoebridge, so I'm going to invite you to ask your second supplementary.
Sure. President, Foreign Minister, noting those answers, recently leaked flight manifests reported in Declassified Australia have shown that the Royal Australian Air Force earlier this month facilitated the transfer of F-35 fighter parts to Israel, fighter jet parts to Israel. Will you, Minister, stop this from happening again?
Minister Wong.
Senator, I again say to you, I have said in this place and so has the Prime Minister in the other place. We are not supplying weapons or ammunition to Israel. We have not done so since the Hamas-Israel conflict began, and for at least the past 5 years. I know that will not stop you from spreading misinformation about the long-standing...
Minister Wong, please resume your seat. Senator Shoebridge.
President, this question is about flight manifests that show the RAAF transfer, and the Minister is not being relevant. Deliberately personal, but not relevant.
Senator Shoebridge, I'm assuming you are raising a point of order. You need to say that when you stand, not just begin reiterating the question. So I understand it's a point. Is it a point of order?
Point of order, President. Relevance. The question is about the
Senator
flight
Shoebridge,
manifests.
you do not need to repeat the question. Thank you. Please resume your seat. Senator Wong, the Minister is being relevant to your question. Senator Wong, please continue.
I think everyone watching this will see that the Australian Greens political party are desperate to try and play domestic politics with this dreadful conflict. And, you know, shame on you. Shame on you. I have explained to you multiple times, and yet despite that you continue to spread misinformation. The F-30, we are part of the long-standing F-35 consortium. It is essential to our sovereign defence capability and manufacture... You're going to keep shouting at me? Is that how you deal with things? Would you like me to sit down?
Order. I've asked you to come to order 3 times, Senator Shoebridge. Minister, please continue.
The F-35, as part of the global F-35 supply chain, we contribute components and parts that are non-lethal in nature.
Thank you, Minister. The time for answering has expired. Senator Grogan.
Thank you, President. My question is to the Minister representing the Minister for Education, Senator Walsh. The Albanese Labor government went to the election promising to cut student debt by 20%. We said it would be the first bill that we introduced this term. Can the Minister explain why it is so important to reduce HECS debt for our young Australians, and more broadly, how will Australians benefit from the government's higher education policies?
Thank you, Senator Grogan. Minister Walsh.
Thank you very much, Senator Grogan. And yes, I can. And I know your deep belief that education can change lives. In our last term, we made HECS indexation fairer. And in so doing, we wiped $3 billion in student debt for the more than 3 million Australians with a HECS debt. But that was just the beginning. Young people rightly told us that their debts were too large. And that's why we went to the election with a promise to cut student debt by 20%. We said the first legislation we would introduce would make that happen. Last week, the first week of this new parliament, that is exactly what we did. And this week we have the chance to make it law, because we understand what this cost of living relief means to people with student debts. It will wipe $16 billion from the HECS debts of Australians. For someone with the average HECS debt of around $27,000, it will mean about $5,500 wiped off their debt. And it won't just benefit uni students. This legislation covers all help loans, including loans to apprentices and to other vet students. But despite the referendum on student debt at the recent election, the newly elected coalition member for Forrest said only hours ago in the other place that this critical relief is, and I quote, grossly unfair. Grossly unfair. I wonder if he'd say that to one of his 11,000 constituents who have a HECS debt. On this side of the chamber, we know that whether you're studying at uni or at TAFE, you're developing the skills that keep Australia moving. That's what you get with the Albanese Labor government, a united team delivering on its promises.
Thank you, Minister Walsh. The time for answering has expired. Senator Grogan. First supplementary.
Thank you, President, and thanks to Senator Walsh for that great response. The Albanese Labor government is making changes to HECS to wipe student debt, which is great to see, and changes to the thresholds of when young Australians start paying off their HECS debt. Could the Minister please outline how are these changes delivering a fairer HECS system for current and for future students?
Thank you, Senator Grogan. Minister Walsh.
Thank you, President. Well, our legislation before the Parliament also makes HECS repayments fairer. We are putting money back in the pockets of people who are just getting started in life. We are a united team focused on delivering these reforms. And if only the same could be said of those opposite. The opposition leader had indicated they were ready to support reforms to HECS. But now it seems that Senator Henderson, hello Senator Henderson, has appointed herself the shadow Minister for Education. Senator Henderson, she couldn't get her policies up before the election and now barely into the second sitting week. And Senator Henderson's doing the numbers from the back bench. And it seems that she's having some success. The member for Forrest also said this morning, and I quote, "I welcome Senator Henderson's proposal today to amend the bill. So while you tear yourselves apart, we will build a fairer Australia."
Has expired. Order. Order. Senator Watt. Senator Grogan, second supplementary.
Thank you, President. The Albanese Labor government is focused on delivering its commitment to reduce HECS debt and make the system fairer. How important is policy consistency and unity, Senator Walsh, to delivering important reforms like HECS debt relief?
Thank you, Senator Grogan. Minister Walsh.
Thank you, President. Well, we are indeed fortunate, Senator Grogan, to be a big, united team. United on the things the Australian people sent us here to do, like delivering for students and young people with a clear plan to make HECS fairer. Now, contrast that with the opposition, who are, in week 2, an absolute rabble. The Shadow Minister and the self-appointed Shadow Minister are leaking against each other in the press.
Minister Walsh, please resume your seat. Order. 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 Senator Henderson.
Thank you very much, President. Point of order on direct relevance. Could you please explain why future students are being denied the discount?
Senator Henderson. Senator Henderson, that is not a point of order. Order. Thank you. Senator Walsh, please continue.
Thank you, Shadow Minister. But this morning, Senator Hume said you'd expect some jostling and readjustment so we get our policy positions straight. What that is code for, Senator Hume, is chaos. Chaos. And it does raise some questions for the Leader of the Opposition in the Senate. Does she agree with Senator Henderson, Senator Hume and the member for Forrest from her home state? Or will she back Senator Duniam over Senator Henderson?
Thank you, Minister Walsh. The time for answering has expired. Order. Order. And Senator Walsh, I remind you to make your comments to the chair. Senator Steele-John.
Thank you very much, President. My question is to the Minister representing the Minister for Disability and the National Disability Insurance Scheme. Wednesday marks 1 year since the Government's response to the Royal Commission into Violence, Abuse, Neglect and Exploitation of people with disability was released. And still there has been no action on key recommendations, meaning disabled people continue to experience violence, abuse, exploitation and neglect at alarming rates. Minister, 1 year on, why have you not legislated for a Disability Rights Act?
Thank you, Senator Steele-John. Minister McAllister.
Thanks very much, President, and thank you, Senator Steele-John, for the question. Senator Steele-John, I think everyone in this place understands the significance of that Royal Commission, and I would hope that across this chamber we would have shared objectives in terms of protecting the rights of people with disability. And I think that the stories and the courage of the people who spoke with the Disability Royal Commission about their own experiences are a continuing reminder of both some of the things that we must address collectively as a parliament, but also the importance of truly listening to the voices of people with disability. And if you may indulge me, this is my first opportunity to answer a question in question time. having taken on these responsibilities with the government, and it is my firm intention to work as closely as I may with people with disability to understand their perspectives as we work through some of the changes that are required. We are working with the disability community to implement reform, and as part of our initial response, we are investing making a range of investments to safeguard people, to uphold rights and to support inclusion. We also it builds on $3 billion of investments in the last term of Parliament to build a more inclusive Australia. And we do...
Minister, please resume your seat. Senator Steele-John.
Thank you, President. On relevance, my question did go to the specific of the Disability Rights Act and why it has not been legislated 1 year on from the release of the government's response.
That was part of your questions, Senator Steele-John, and it went to more broadly the results and the outcomes and the evidence of the Royal Commission. Minister McAllister, I'll remind you of the whole question. Please continue.
Thanks very much, President. And the government is committed to working on these and other questions, Senator Steele-John, to improve community inclusion, mainstream services and disability supports so that people with disability can get the support that they need and participate on an equal basis. I simply wanted to draw your attention, I think, finally, just in the time available, that we are reporting regularly on implementation progress, and the most recent report was published on the 23rd of December last year.
Senator Steele-John, first supplementary.
Thank you, President. The Disability Royal Commission recommended the establishment of a National Disability Commission to be an independent oversight body to take disabled people's complaints of abuse and discrimination. This commission still does not exist. When will the government establish a National Disability Commission?
Thank you, Senator Steele-John. Minister McAllister.
Thanks very much, Senator Steele-John. And the government is, as I've indicated, working with our state and territory counterparts on the many issues that were raised by the Royal Commission. I have also some additional information to provide to you in relation to your primary question, which includes information about options to reform the Disability Discrimination Act 1992, and I can advise you that the Attorney-General's Department has been progressing work on options to reform this Act and will shortly be commencing consultations with people with disability, their carers and families, employers, unions, educational bodies, small business and the broader community to participate and share their views on the best way to update the Act. This review of the Act is one part of the response to the Commission, ensuring that Commonwealth anti-discrimination legislation remains fit for purpose.
Thank you, Minister. Senator Steele-John, second supplementary.
Thank you, President. July is Disability Pride Month, a time for disabled people to celebrate who we are as individuals and as a community. Minister, what community-led engagements have you attended to mark Disability Pride Month?
Minister McAllister.
Thank you, Senator Steele-John. What I can inform the Senate is that since becoming the Minister, I have greatly enjoyed and welcomed my opportunities to meet with disabled people and understand their perspectives and worldviews. And for me, that has meant trying to engage with the most diverse representatives of that community possible. It's meant visiting facilities where people attend to undertake activities. It's meant meeting with representative organisations. It's meant being invited into people's homes and sitting around the kitchen table and understanding their perspectives on disability. This is an immense and rich community with a rich political tradition, in some ways culminating in the campaign to establish the NDIS, but not confined to that by any means. And it is my great hope that I will be able to work closely, respectfully, thoughtfully with that community during my term.
Thank you, Minister. The time for answering has expired. Senator McDonald.
My question is to the Minister representing the Minister for Agriculture, Fisheries and Forestry, Senator McCarthy. Minister, if the decision to allow US processed beef from Canada and Mexico was genuinely based on science, why the urgency that has precluded a transparent and open consultation with the most impacted primary producers, the largest regional employers, and of course the thousands of Australian workers potentially impacted?
Thank you, Senator McDonald. Senator McCarthy.
Thank you, President, and I thank the Senator for her question. And I'm a little surprised by the question, actually, President, given that this was a process that occurred directly under those opposite, and it has been going, for 10 years, President, for 10 years. And I'm not quite sure what it is that the opposition don't understand about this, other than the fact that there is hypocrisy being shown by these questions in regards to science. Yeah, there absolutely is. There absolutely is. This has gone on for nearly a decade, and we know that there has been a process that's been thoroughly done through this. And so, Senator McDonald, you know that as much as anyone does.
Thank you, Senator McCarthy, and I remind you to direct your answers to the chair. Senator McDonald, first supplementary.
Minister, can you then guarantee that there are no biosecurity issues or concerns for human health with this decision?
Thank you, Senator McDonald. Minister McCarthy.
Thank you, President, and I thank the Senator for her question. It's very curious that they're worried about biosecurity, given that they've no interest in net zero with what the other side are trying to do in terms of looking after the care of this country.
Order.
But, President, I will say this, that Minister Farrell has made it very clear, and so has... You see, they laugh opposite. They laugh opposite because they're so divided about what they are doing in relation to this space. They do. They laugh about it, and they don't care, President.
Minister McCarthy. Senator McDonald.
Relevance. This is a rambling, I'm not sure what, but it's certainly not relevant.
The minister is being relevant, and I will continue to listen. Order.
Thank you for that, because I am absolutely being relevant. We do care very much about biosecurity. We do know that we have done everything we can in this space, given the mess that you left in underfunding that whole area.
That's right.
Now, Minister, please resume your seat. Senator Cash.
Again, it's relevance. The question was very direct. Can the Minister guarantee there are no biosecurity issues or concerns with this decision?
Thank you, Senator Cash. Just a moment, Senator McCarthy. Order. I'll make the point to the earlier point of order. If you want your question answered, then don't interject, because the minister is entitled to take those interjections. Secondly, in response to the matter just raised by Senator Cash, the minister is being directly relevant. Minister, please continue.
Thank you, President. Well, we certainly are not compromising on biosecurity, President.
Thank you, Minister. Senator McDonald, second supplementary.
Minister, will you support a transparent and honest inquiry into the decision on US beef processed beef from Mexico and Canada?
Order. Senator McCarthy.
Thank you, President. Well, as the members opposite do know, this has been going on for 10 years.
Thank you, Senator McCarthy. Senator Whitten.
Thank you, President. This is not my first speech. Seems Senator McDonald has put me at the post. My question is the Minister representing the Minister for Agriculture, Fisheries and Forestry, Senator McCarthy. Your government recently opened a new front in its war on Australian farmers by lifting science-based restrictions on United States beef imports without any consultation with our own beef producers. This follows a decimation of our sheep industry with your cruel ban on live exports, most keenly felt in my home state of Western Australia. Minister, why is your government intent on crushing these world-leading livestock industries and the lives of Australian farmers?
Thank you, Senator Whitten. Minister McCarthy.
Thank you, President, and I thank the Senator for his question, which is completely untrue in terms of this government's approach to our agricultural sector. In fact, we have a minister who is very, very adamant about getting out across Australia to work with our farmers, to work with the agricultural industry, and wants to see the support that only we have been able to provide, given the mess the other side had left the industry in.
Thank you, Minister. Senator Whitten, first supplementary.
Thank you, Senator. After this latest attack on beef producers, the harm caused to sheep farmers and the naked theft of more water from irrigators in the Murray-Darling Basin, will the Minister please inform the Senate which other rural industries are in the government's crosshairs?
Minister McCarthy.
Thank you, President. Well, I certainly reject the question outright, President. As I said in my previous response, our government is very much assisting the farmers across Australia, in particular our minister.
Thank you, Minister. Senator Whitten, second supplementary.
Thank you, Senator.
Order. Order.
Food imported into Australia is usually subject to strict labelling requirements, so Australians can choose the better, safer, cleaner food produced locally. What measures will your government take to ensure Australians know the true origins of beef imported from the US but sourced from countries with known biosecurity health risks?
Thank you, Senator Whitten. Minister McCarthy.
Thank you, President. And as I have said in this answer and in previously, we are not compromising on any biosecurity, Senator. No, it's not. It comes in line with an assumption that's absolutely incorrect, that we are not doing our jobs when we are. Australia is a trading nation with 1 in 4 jobs relying on trade, and our cattle industry has significantly benefited from this. And I am referring to the question around beef. Aussie beef has had back-to-back record-breaking exports.
Please resume your seat. Senator Canavan.
On relevance, so the question was clearly aimed at testing requirements for the importation of beef. Speaking about trade does not go to the relevance of that question.
Thank you, Senator Canavan. And as I'm sure you will recall, the question also had a preamble, so the minister is being relevant. Minister McCarthy, please continue.
Thank you, President. They just don't want to hear about beef.
That's right.
So last year, worth $14 billion, supported by reinstated and improved market access, exports have increased 55% since we came to government.
Thank you, Minister. Senator Babet.
Thank you, President. Now, my question is to the Minister, representing the Minister for Climate Change and Energy. Given the member for New England has introduced a bill to repeal Australia's legislated net zero target and the growing public discontent over skyrocketing energy prices, how does your government justify, clinging to a policy that delivers neither environmental certainty nor energy affordability for Australian families and Australian businesses? Thank you.
Thank you, Senator Babet. Senator Ayres.
Well, thank you, Senator Babet, and I do sincerely thank you for this this question, and reflect that it's not necessary for Senator Canavan to ask this question, or Senator Antic to ask this question, or Senator Nampijinpa Price to ask this question, because it's all one team over here. All one team over here on the question of policy certainty around energy policy, the approach that the Australian government takes on climate change, on rebuilding and modernising our electricity system. There's complete unanimity across all of this show over here who never learnt the lesson, in 2022. And certainly didn't learn the lesson. Didn't learn the lesson in 2025.
Senator Ayres, I am going to draw you back to the question. Thank you. Order. Order. Senator Wong.
President, respectfully, if I could submit, the question does go to net zero, and the minister's wind-up, albeit it's quite a lengthy one, actually is about the policy position on net zero.
Thank you, Senator Wong, and I did allow some leniency for Senator Ayres to get to the question, and when he didn't, in what I thought was a timely manner, I drew the question to his attention. Minister Ayres.
You were very lenient, President, very lenient indeed, and I was getting ahead of myself. I was. Net zero, for Senator Babette's information through you, Chair, is really a basic maths concept. We've reached. I just want to set it out, a little bit of clarity for the team over here. We've reached net zero emissions when the amount of greenhouse gas that we emit into the atmosphere is no more than what is removed. Senator Babette, Senator Cash has asked. I should have included you in the list of potential askers. You know, the sort of silly billies over here on energy policy. Now, if you're inclined to interject, Senator Cash, perhaps you could explain how it is that you've been defying your leader, repudiating her authority. Already week 2, first weekend of a sitting fortnight, you're up and about.
The time for answering has expired, and I will remind you as well to direct your comments to the chair. Senator Babette, first supplementary.
That was excellent. Thank you for that. Now, Minister, since the government adopted net zero, it has repeatedly promised to lower our energy bills. Now, since we got net zero, electricity has gone up by 31% and gas has gone up by 40%. Why hasn't net zero lowered our power bills as we were promised? And do you guarantee, Minister, that net zero in the future is going to lower our bills?
Thank you, Senator Babette. Minister Ayres.
Well, one thing that I can guarantee, Senator Babette, is that the cheapest form of energy, the cheapest electricity system for Australia, if you're remotely interested in certainty, affordability, reliability, is renewables backed up by storage and backed up by gas. That's the truth of the matter. That's the truth of the matter.
Order.
And that's why what's left of a sensible position coming from the opposition on the other side, I assume, is out there briefing journalists to say we're desperately unhappy, actually. Desperately unhappy with the position that's been adopted by some of the characters over here. Because the one thing that you can guarantee will drive up electricity prices and drive away investment in Australian manufacturing capability in the energy system is the sort of policy incoherence we're seeing over here.
The time for answering has expired. Senator Babette, second supplementary.
Thank you, President. Look, Minister, will your government rule out introducing additional taxes, carbon levies or price-based mechanisms in the future to enforce this net zero compliance on Australian businesses and consumers?
Thank you, Senator Babette. Minister Ayres.
Look, the government's policy is very straightforward and it's there for everybody to see. And it was endorsed strongly at the last election. And we've got a job to do to get about continuing to make sure that we're building more electricity generation, more transmission capability so that firms like Tomago Aluminium have got access to the low-price electricity that they need. We've got a job to do delivering for Australians, not the kind of complete policy incoherence that is dominating what's gone on over here. And you see what's happened. You see what's happened last week. And for the first hour of House of Representatives this morning really displayed what's on show.
Senator Hanson.
Relevant to the question, will you give your word that there's no increased taxes or to the renewables that you're pushing?
Thank you, Senator Hanson. Thank you, Senator Hanson. The minister is being relevant. Minister.
Well, there certainly won't be increased taxes. What there'll be is certainty. Certainty about what our framework is. Unless the old sort of Joyce and Boyce show over here, all the sort of bulls in the paddock over there, desperately trying to undermine the poor old leader of the opposition.
Expired. Senator Bragg.
Thank you very much, President. Thank you very much. Thank you very much. My question is to the Minister representing the Prime Minister, Senator Wong. On Saturday, the CFMEU announced that it would expand operations in New South Wales. The New South Wales CFMEU boss, Michael Crosby, said, and I quote, "We are looking at large, multiple, complex residential construction and it may push up costs," end quote. Given they are supposed to be in administration and have been shown to increase the cost of construction by up to 30%, will the government now intervene to stop this CFMEU expansion?
Good question. Thank you, Senator Bragg. Minister Wong.
Thank you, President. I thank Senator Bragg for his question, and I note that he is one of those on that side who does, I think, still support net zero, and is not joining in the Senator Cash's, Senator Canavan's, Mr Joyce's campaign to undermine their leader, which is, I have to say, quite an extraordinary sight to watch. But Senator Bragg, I will come to your question. It's a minor detour. It's only a minor detour, to be fair. You wouldn't be. I was not aware, Senator, and I'll get further information of the details of everything you have outlined. Obviously, we had Auckland over the weekend, and I was engaged primarily on other matters. You would be. Because I never know how to answer anything, Senator. That's right. What I would say to you, Senator, and I'll see if I can get some further information specifically on New South Wales. As you would know, we have made our position in relation to the CFMEU clear. You will recall that the government has put in place an administration and administrator in relation to the CFMEU. You would be aware that the government has been very clear about our view in relation to the CFMEU, and we will continue to work to ensure that the sort of corruption and misconduct and alleged corruption and misconduct that has been both found and asserted is stamped out. As I have said on multiple occasions, we are a labour movement. We know the benefit of trade unions for working people, and we also know that organised crime has no place inside the trade union movement.
Thank you, Minister Wong. Senator Bragg, first supplementary.
Thank you very much. Treasury says that the government won't hit the Labor Party's target of 1.2 million new houses by the end of the decade. Perhaps as part of the advice you're seeking, Minister, can the government guarantee that the CFMEU's latest efforts won't push up construction costs around the country and push housing completion figures even lower?
Thank you, Senator Bragg. Minister Wong.
Well, Senator, I think we all know that one of the primary drivers of housing prices going up is a lack of supply, which is why the government has, both in the context of the election but also in our first term, invested in a very large set of housing policies which both deal with the demand and supply. And I would make the point, Senator Bragg, that you and others were amongst those who prevented and held up some of those key supply measures during the last term and now complain about housing supply and prices. I would also make the point about prices that we don't believe that the answer to housing shortages is A, simply cutting wages, or B, implementing the sort of policy that you came to the election with, which was super for housing, which would have driven up housing prices by more than $90,000 in capital cities.
Thank you, Minister. Senator Bragg, second supplementary.
Thank you. The government's efforts to put the CFMEU into administration appear to have failed. Will your government now consider supporting the Coalition's Housing Investment Probity Bill, which will ban CFMEU involvement in all Housing Australia Future Fund projects?
Thank you, Senator Bragg. Minister Wong.
Well, I reject. Thank you, President. I reject the proposition that Senator Bragg puts. He makes an assertion about the government's actions in relation to the CFMEU. And I again say in this case, we have taken the strongest possible action by placing the CFMEU into administration. That is the fact. We've taken the strongest possible action in placing the CFMEU in administration. The Administrator, I understand, has terminated already a number of officials involved in some of the behaviour that was reported, and the reported behaviour was unacceptable. And the Administrator is placing— well, I know you don't want to listen to this, Senator Cash, but we are actually doing the work of putting that union into administration in order to clean it up, because that is the right thing to do for working people and for the economy.
The time for answering has expired. Senator Ghosh.
Thank you, President. My question is to the Minister representing the Minister for Climate Change and Energy, Senator Ayres. In May this year, the Albanese Labor government was re-elected with a mandate to keep acting on climate change and keep delivering an affordable and cleaner energy system. One of the signature measures was Labor's commitment to deliver cheaper home batteries to bring down electricity costs for Australian households. What progress has the government made on this commitment and its broader work in delivering a new and affordable energy system?
Thank you, Senator Ghosh. Senator Ayres.
Thanks, President. Senator Ghosh, thank you very much for that question. We have made quite a bit of progress indeed. The reducing the cost of household batteries policy that was endorsed by the people of Australia in the last election is building on Australia's success with rooftop solar. Now, indeed, from 1st of July, we are implementing cheaper home batteries, and over 15,000 Australian households across the country have taken up those batteries since July 1. 28 days, 15,000 Australian households already. That's 536 households every single day signing up, buying batteries, delivering cheaper prices for them, and doing a lot of work to stabilise our electricity grid. It slashes the price of a battery, Senator McDonald talks about cost, by 30%, and for many of those households will bring down their energy bills by up to 90%. Tens of thousands of people in electorates like Gilmore, where 214 Australian households have taken advantage of the scheme. Macquarie, where 200 Australian households, in the seat of Hunter, 197 Australian households taken up this offer and delivered cheaper power for themselves and cheaper batteries for their households. In Flinders, 109. In the seat of Wright, 238. In Western Australia, where Senator Cash was indulging a sort of right-wing ideological frolic over the weekend, the seats of Mayo, Tangney, all lead their states. Sorry, Tangney.
Thank you.
Well,
Thank you,
Senator,
the time for
the Labor seat
of— Thank you, Senator Ayres. Senator Ayres, resume your seat. Order. 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 I have Senator Ghosh on his feet. Order. Senator Ghosh, I haven't called you yet. I'm still waiting for order. Senator Ghosh, first supplementary.
Investment in energy infrastructure is key to delivering clean and affordable power to households and businesses. Minister, what progress has been made on delivering renewable energy investment and deployment?
Thank you, Senator Ghosh. Minister Ayres.
Well, you're right, Senator Ghosh, that cheaper home batteries doesn't just deliver benefits for those Australian households, 15,000 already, who've taken advantage of the scheme. It also delivers system-wide benefits. And it's not the only Albanese government policy on the electricity system that is breaking records. Our policies across the economy are helping drive down emissions and deliver on our targets with a record renewable uptake. Energy and industrial emissions lower than when we came to government, with policies like the safeguard reforms, capacity investment scheme and the cheaper home batteries program helping turn around a decade of denial and neglect that drove disinvestment, less Australian jobs, more Australian jobs flooding offshore because of the policy incoherence that was on display in the Morrison period and is back on display
Thank you,
here
Minister.
in Canberra
the time
right
for
now.
answering has expired. Senator Ghosh, second supplementary.
Thank you, President. During the election campaign, the Albanese Labor government made meeting our climate goals and delivering investment in cheap and clean energy a key pillar of the pitch to the Australian people. Why is it necessary to provide clear signals to the market about the policy approach to this issue, and what are the risks if clear signals are not sent?
Thank you, Senator Ghosh. Minister Ayres.
Well, I thank Senator Ghosh for that question, because policy certainty actually matters. It actually matters. It gives business the confidence to invest. This government is giving the market the signals that it requires to deliver and move ahead with major energy infrastructure projects that provide clean power and affordable power for Australians. But what signal is being provided by those opposite? Senator Patterson, who knows that the opposition is in chaos, but argues, interestingly for a senator, that they are also irrelevant. He said, "Our position on this issue is academic. We are in opposition." But, President, Australians can see the chaos, and abrogating your responsibility as an alternative party of government to take the policy process seriously and deliver some kind of certainty for Australians and Australian business really shows us how...
Minister Wong.
Thank you, President. I ask that further questions be placed on notice. Thank you. Senator Wong.
Yep. To add to an answer.
Senator Walsh.
Thank you, Deputy President. I wish to add to an answer from question time today. I undertook during question time to provide further information to Senator Colbeck regarding his specific question about family daycare in Latrobe. I can advise Senator Colbeck that the case he referred to was about a decision of the Tasmanian Early Education and Care Regulator, the Education and Care Unit in the Tasmanian Department for Education, Children and Young People. This decision was consistent with the national law and also consistent with the practice of regulators in other states and territories. Thanks, Senator Colbeck.
Are there any motions to take note of answers? Order, Senator Watt. Senator O'Sullivan.
There certainly are, Deputy President. I move to take note of all answers to coalition questions today. And I want to focus in on the questions related to the lifting of the biosecurity restrictions. Now, there are two key points that I want to address in taking note of the answers given to those questions. The first one relates to the answer that Senator Farrell gave in relation to the having to correct the record, and the second is, of course, the significant industry matters that are occurring right now for farmers right across this country, because some farmers we know are distressed. They're very concerned about this government's handling of all things agricultural, and certainly when it comes to the live export and when it comes to key industries like sheep and indeed beef, as I know in Western Australia. But initially, what we've seen with Senator Farrell's answer to the question in relation to the contradicting information that was provided in relation to the Prime Minister. Now, maybe Senator Farrell wishes, like we all do, that the Prime Minister was able to have a conversation with the President of the United States, and he's sort of in giving the answer that he gave earlier in an interview, gave that answer that he gave because he was sort of hoping, like all of us, that the Prime Minister would have a conversation with the direct conversations with the President of the United States, but we know that that's not happening. And we urge the government, and we wish them well in that regard, because it is important to Australia's position to be able to have that direct dialogue with the United States, our most important international partner, relationship that we must foster and develop. But it is concerning when there's this conflicting information for very senior levels of government. It's not just a backbencher getting something wrong here. This is, in fact, the Trade Minister misrepresenting the information and misrepresenting the reality of what was actually occurring. Now, it's good that he's corrected the record, but nonetheless it is concerning that those sort of facts aren't front of mind when we know that there hasn't been the conversations between the Prime Minister and directly with the United States. Now, this issue in relation to lifting of the biosecurity restrictions is very concerning because the quality of our beef is held in internationally high regard, and we've got to make sure that that is maintained. We are the envy of the world when it comes to our biosecurity of our beef here in this country. We're able to export it across the world because of those very high standards, and to see those standards undermined by any sort of watering down of the standards is of course incredibly concerning. And this is why we should have an inquiry into this, that we should understand fully all the information that was provided, that was used to make a determination as to whether or not this is in fact a sensible thing to do. And so I would urge the government to consider getting behind the Coalition's request for an inquiry into this matter, because we need to ensure integrity. We need to ensure that our system holds integrity. And without the government going along with that and opening themselves up and being fully transparent, then we can't be sure. And who's to say that we don't undermine our standards and we don't see a situation where this enviable position that we currently have across the world is undermined, and the impact and the cost that would have. We already have seen in my home state of Western Australia the absolute breaking of the heart of farmers across the state in relation to the live export ban of sheep. We've seen their hearts broken, as I know you know very well, Deputy President, as a fellow West Australian senator, the impact that is having. Well, if we see an undermining of the beef industry in Western Australia, and indeed right across the country, that would be devastating. That would be devastating. We know that this government doesn't have a good track record. When they were last in government, in the previous time they were in government, under Julia Gillard and Kevin Rudd, Prime Ministers, they had a devastating impact on beef with their illegal implementation of those bans.
Senator O'Sullivan, your time has expired. Senator Ciccone.
Thanks very much, Deputy President, and it's good to be back here in this chamber for a new term. But unfortunately, also being back here means that we also need to deal and debate some of the issues that do come up from time to time. And it's a bit brave for the Coalition to come back in this place after the election period and lecture the government on biosecurity, given that it was this government, when we first came into power back in 2022, that actually had to fix our biosecurity system, which was not just broken but also underfunded. And the government's worked backwards in order to make sure that we continue to have one of the world's, if not the world's best biosecurity system, the envy of what is really considered to be the benchmark of biosecurity when it comes to trading nations. But like many in this place, I too am very passionate about Australian agriculture, very passionate about our meat industry, very proud to be chair of the Red Meat Friendship Group with Senator McDonald in this place about promoting our quality beef. But it is worth mentioning some of the facts that are before us when we are dealing with this issue at the moment regarding the United States and the government's decision to deal with the US around the importation of US beef. But I just want to lay out a couple of facts before us, just to be absolutely clear about what we are dealing with. When the Liberals and Nationals were in government, they absolutely did nothing to change the rules around importation. Absolutely nothing. Beef from the United States has been able to be imported into this country since 2019, when those opposite were in government. The US beef imports review has been ongoing for some time now, and as the Minister had explained, I think close to a decade. And it's undergone a very rigorous science and risk-based assessment for almost 10 years. The decision by the Federal Department of Agriculture, the Australian Department of Agriculture, has been undertaken in the same way that we deal with any other matters when it relates to market access here in Australia. And it's important to understand that Australia as an island nation, 1 in 4 jobs are reliant on trade, and our cattle industry has significantly benefited from this. Aussie beef has had back-to-back record-breaking exports every single year, and it's worth around $14 billion. It's also worth noting too that on the back of all that, that the reason why we're in this situation today is because of the free trade deal that we have with our great friends over in the US. The Australia-US free trade arrangement that was signed by the former Howard government, Mark Vaile, when he was minister and a member of the National Party, going to the US and signing this agreement back in 2004. So this is not a new set of circumstances that we are dealing with. You know, it's fair to say that the government, and I'm assuming most on those sides, are very open to free trade, particularly the Liberal Party. But when the National Party come in here and talk about these issues in the very first week or very first fortnight of a new sitting week, you do have to question what is going on internally in their party rather than externally. Because the only way that I can see what is happening right now is that the government has done everything that we should be doing. If those were in power, they would have done the absolute same process, adopted the very same risk assessment processes that are in place that we are going through right now. So there is nothing new about what the government has concluded with its review. It's also worth noting too that a number of key bodies in the industry, like Meat and Livestock Australia and others like Cattle Australia, have also been very supportive about this process, acknowledging that Australians, to be frank, are more likely to still buy Australian beef because we have such a strong supply of the quality produce here in Australia, that whatever may be imported from the US may actually not be able to penetrate such a very strong market. So the concerns that are being articulated and vented by members of the National Party, quite frankly, will not fly very far. And that is why the government is backing the scientists and backing the department when it comes to the review that is being conducted by the Department of Agriculture and all the officials that have been working on this process
Senator
for the last 10 years.
Your time has expired. Senator Kovacic.
Thank you. I also rise to take note of all answers to coalition questions. I actually had to pause for a moment when I was listening to the questions from Senator Bragg in relation to the HAF and the CFMEU. We are in a housing crisis in this country. We have been for a number of years. One of the most significant inquiries that I sat on in the Senate in my committee work was our housing and rental crisis inquiry, when I heard the stories of people unable to afford somewhere to live, just to have a roof over their heads. That's the Australian dream, to own your own home. And I don't think it's an unreasonable dream either. I think it's fair to suggest that if you work hard and if you do all the right things, that if you choose to buy your own home, you're able to do that. And what really bothered me was the information around the fact that the CFMEU announced the other day that they're going to be expanding into New South Wales. I was sitting here thinking about it and wondering, is there any other organisation or entity in this country that has actually expanded whilst it's in administration? I couldn't think of anybody. I could be wrong, but I just thought it was extraordinary that just before the end of the last term, the CFMEU went into administration because of all the things that were wrong and significantly egregious behaviour, particularly in Victoria, and we've heard some stories recently in Queensland. And we go into administration, but guess what? We'll expand into New South Wales now so that we can broaden the damage, so we can harm more people. so we can ensure that the reasons that we put them into administration for in Victoria, so we can spread more of that around the country. And the madness of what I'm saying and what I'm suggesting is that it's real. This has actually happened. So what did the New South Wales CFMEU boss, Michael Crosby, say? He said, "We are looking at large, multiple, complex residential construction, and that it may, and I quote, push up costs." So they are coming into residential construction, large-scale construction in New South Wales with the knowledge that it may increase the cost, not may, but will likely increase the costs of those dwellings. When we have a housing crisis, when people can't already afford the cost of dwellings, we're going to make them even more expensive. And we know from the information that my colleague Senator Bragg has shared with us many times that those costs are around 30% more. So let's have a think about that. $800,000 for a unit in Sydney. That's probably entry level in many places. Add 30% to that. That's an extra $240,000. That takes that unit cost from $800,000 to $1,040,000. Let's go one step up, a $900,000 unit. Extra $270,000, which takes us to about $1.170 million. Just under $1.2 million. So that's the cost of having the CFMEU participate in what they call large, multiple complex residential construction. And we're going to sit here and say that that is okay. I don't understand. This threatens to kill off home ownership for millennials completely. If young people weren't already so disheartened by the fact that they may never own their own home, this is a further nail in the coffin of that dream. And that is under the watch of this Albanese Labor government because they cannot hold the CFMEU to account. They cannot stop them from spreading their damage across our country. And we should not stand by and allow that. When the union was placed in administration in August of last year, the Prime Minister said, "There is no place for corruption or intimidation in the building industry." And yet it is there, plainly, for all of us to see. And yet it continues. And it continues with the rollout of further infiltration of the CFMEU into New South Wales, despite the damage that they have caused in Victoria and Queensland. This Labor government has no interest in probity, it has no interest in transparency, and it has no interest in stopping the CFMEU.
Senator Kavasic, your time has expired. Senator De Liga.
Thanks very much, Deputy President. And may I note that this is not my first speech. When I stand today, and I hear those opposite talk about the CFMEU. Let's be really clear. This is just another attack on working people. It's an attack on working people, their conditions, their wages, and their well-being. Working people, the union members build this country. There's no doubt about it. Union members are not. They are not embroiled in corruption like some of the things we've seen in the media. And I think Senator Wong today addressed it. Really, really great is that the way that we couldn't have taken any stronger action to place the CFMEU into administration, and the corruption has no place in unions or in workplaces. But most union members, most employees or workers in a workplace, they're decent, good people, and this is just another attack on union members. When it comes to building homes, helping Australians get into homes is one of this government's absolutely highest priorities. Those opposite, and Senator Bragg, have no credibility on housing, having cut housing investment while they were in government, and they opposed every housing investment made by Labor. Those opposite delayed houses being built by up to 2 years, which is an absolute disgrace.
The only answer that the Coalition has to housing shortages is, again, just to go back to cutting wages. Having workers working for cents in the dollar, which is not the Australian way. The fact that wages have not been driving up the cost of housing, wages have been growing more slowly than other costs in construction. For 10 years, the LNP complained about the CFMEU, but did nothing to clean it up. And it's been this government who put the CFMEU into administration and has been supporting the union to clean itself up and to be able to represent its members. And just more broadly, when it comes to unions, let's not forget that unions have created some of the safest workplaces in Australia. Trade unions are there to support their members and other workers in their workplaces, which is something that's often forgotten, or some people might even take for granted. Health and safety is absolutely paramount in workplaces, and it's core union business. And I stand, and this side of the chamber stands with working people to have safer workplaces, and we won't stand for attacks on that. When it comes to housing as well, might I add, is this government has an ambitious housing agenda. We took to the last election plans to have further shared equity schemes, 5% deposits for first home buyers, which is a game changer. We talk about the Great Australian Dream. Well, the Great Australian Dream is to, yes, own your own house, but it's also to go to work, to earn a fair wage for a fair day's pay, to participate in collective organising when you want to. We want to have workers having their fair share of power in their workplaces, and their trade unions will help them do that. So it's really hard to sit over here and hear those opposite attack working people and union members, and it's something that we don't stand for. First home buyers have absolutely been struggling to get into the market. There's no secret about that. We absolutely want to see more people get into more homes. We want to see the supply shortage filled, and we want to see more homes built as quickly as absolutely possible. And the Labor's policies absolutely support homes to be built. If I might just talk quickly about the beef imports. I come from a family that we have a small farm. My brother is a beef cattle farmer, and Australian beef is the best beef in the world. I absolutely love a good steak, and a good Australian steak, and a good Tasmanian steak. Absolutely, this government absolutely, as Senator Ciccone said before, when we come into government, we took steps to repair the public service after a decade of cuts and degradation, and our biosecurity laws will not be compromised. Thank you.
Senator Hume.
Thank you, Deputy President. I too rise to take note, specifically on the answers given by Senators to questions asked by Senator Cash and McDonald around this decision by the Labor government to allow US beef imports into Australia when those beef imports have been raised and imported into the US from Canada and Mexico. Now, look, to be honest, I don't really give two hoots what the Trade Minister said and whether he was misquoting the Prime Minister or the Prime Minister made a mistake and did have a conversation with Donald Trump. I mean, well, look, let's face it, we know that it's been 266 days now since President Trump was elected, and the Prime Minister has yet to have a meeting with the President, our most important strategic partner, and the Prime Minister hasn't even managed to get a meeting with him. So let's put that aside of who said what and when. I'm actually more concerned about the decision itself. Now, this is not a small deal because, let's face it, we can take the word of the Trade Minister, we take the word of the Prime Minister that the decision to allow US beef into Australia, even if it's been born and bred in Canada and Mexico, it has nothing to do with the trade sanctions that have been placed on Australia by the US. Nothing to do with Trump's tariffs. We can take everybody's word for it. But if that is the case, and if we take everybody's word for it, well, that's fine. Why not just have an independent review of the decision? Because it's not a small deal. Everybody around the chamber has spoken about the quality of Australian beef and why it is so important. Everybody around the chamber has spoken about what an important export it is for Australia, and that comes at a risk when biosecurity laws change. Now, it wasn't that long ago that the Prime Minister was up there saying, in response to President Trump's tariffs, that we would have no changes to our biosecurity laws, and then all of a sudden we do. Now, yes, it may be a result of a 10-year review, but that's fine. Let's just have an independent review of the decision so that we can rest assured and sleep easy at night that there is no risk to our beef industry. So if, though, yes, this was a decision that was prompted by the trade tariffs that were put on Australia's goods and services, well, then just be straight with us. Because that's not the worst thing in the world either. We just want to know what the motive is. I mean, these trade sanctions, these tariffs, have massive implications for so many of our exporters. We just want to know. We just want to be clear that that was the motive. And if it was the motive, as I said, I don't mind, but what did you get in return? Did you actually get a commitment from the US to lift the tariffs? And if you didn't, well then why are we changing the biosecurity laws? Now, I heard Senator Cody say because we've got a free trade agreement with the US, and absolutely we do, and we are good global citizens and we abide by our free trade agreements. But the US hasn't abided by its part of the bargain on the free trade agreement, has it? So what is it that we have given up here? For what? And what is it that we will give up next? Because if we haven't secured an exemption from those tariffs, if we haven't secured it, well, what is it that we need to do next? Do we need to make changes to the PBS? Are we going to make changes to our news bargaining code and have our tummies tickled by the tech sector? Is this what the Labor government is prepared to give up to get an exemption from those tariffs? Because we know that there's a 50% tariff on steel and aluminium. We know that there's a 10% baseline tariff on all goods and services. We know that pharmaceuticals are next in the firing line. And we know that copper exporters are also facing sanctions. So if this is the first step, okay, but just be straight about it, because let's be clear. There are no second chances with Australia's biosecurity. If we have created a brand new threat, we should be very clear about that. If, as we are told, that our biosecurity is not under threat, if there is a 99.9% chance that we're all okay, that still translates to a 1 in 1,000 chance that we're not okay. And that's something that has to be acknowledged. So if you're going to sell us upstream with this decision, Labor, that is absolutely fine, but let's be clear about it. Let's have an independent review. That's not too much to ask. That's not too much to ask. Because even if it's made with a pure heart, this decision, the timing smells
Your
off.
time has expired. I'll just put the motion from Senator O'Sullivan that the Senate take note. Those of that opinion say aye. Against say no. The ayes have it. Senator Steele-John.
Thank you, Deputy President. I move to take note of answers given by Senators McAllister and Wong to Green's questions. July is Disability Pride Month, a time to celebrate who we are as a community, both as individuals and collectively. It's about tackling head-on the stereotypes that seek to limit us. It's a call on the broader community to unlearn ableism, and it is a time to join together as a community and demand not just recognition but justice. Disability Pride Month isn't about pretending it's easy. It's a statement saying we are here, we deserve respect and equity, and it's a call for action for our allies to fight alongside us. Disability Pride Month is a time when disabled people across the globe, including right here in Australia, are facing cuts, erosion of rights, exclusion at the hands of politicians. Disability Pride Month marks the anniversary of the Americans with Disabilities Act. Australia needs its own Disability Rights Act. The Royal Commission into Disability Abuse called for one, yet years on, this government has failed to introduce one. We need a Disability Rights Act to enshrine our rights in law, our right to be at the centre of the decisions that affect our lives. Because when disabled people are not at the table, the consequences are severe. Cuts to the NDIS, reducing access to income support in the United Kingdom, decisions being made by governments, agencies and bureaucrats that have never lived our reality. That is systemic discrimination. Disabled people will not be shut out, locked up or hidden away for the convenience of others. We continue to be excluded in our workspaces and our workplaces, including in this Parliament. But we will persevere and we will win through to justice for all disabled people in Australia.
Senator Steele-John, your time has expired. Senator Shoebridge, are you taking note of the same question?
I think my colleague took note of both answers, but I will, for clarity, take note of the answer from. Shoebridge. I seek to take note of the answer from Foreign Minister Senator Wong. Extraordinary responses from the Foreign Minister. First, of course, we saw the Labor Party finally acknowledge that they are sending F-35 fighter parts into Israel. Of course, they deny that F-35 fighter parts have anything to do with weapons. I think the term used was the non-lethal parts of a fighter jet is what Australia supplies into Israel. If it wasn't about a genocide, and if it wasn't about Australia arming a military to conduct a genocide, those kinds of answers would be mocked. Those kinds of answers would be pilloried. And they would be seen as something close to comic relief, but this is not a comedy. This is about the Albanese government sending weapons parts into a genocide, and it's obscene that they continue to deny the reality of what they're doing. We also saw the truth about where Labor has moved to in terms of taking action to stop the appalling breaches of international law by the Israeli government. We had the Prime Minister finally acknowledge, people would say 18 months too late, the gross breaches of international law, using mass starvation as a weapon of war by Israel. Finally admit that. But then when they're asked the following day in Parliament, what will you do to stop Israel breaching international law? The answer we got was nada. Nothing, zero, zilch. Maybe another stern tweet, maybe another stern letter, maybe they'll escalate the language. Well, we know that the extremist Netanyahu security cabinet will not care about cranky words or rising rhetoric from the likes of the Prime Minister or the Foreign Minister of Australia. What will matter is ending all defence cooperation with Israel, cancelling almost $2 billion of weapons contracts that Australia has with Israeli weapons manufacturers. And can I finally finish on this? When it comes to questions on Pine Gap, the embarrassment, the avoidance was clear for all to see.
Senator Shoebridge, your time has expired. I'll put the question that the Senate take note, as moved by Senator Steele-John. Those that opinion say aye, against say no. The ayes have it. Are there any notices of motion to be given for another day? No? It is with deep regret that I inform the Senate of the death. Bring the attention to the state of the chamber. Quorum required. Ring the bells. Quorum is present. I will just remind all senators that you cannot depart the chamber when a quorum call is made. It is with deep regret that I inform the Senate of the death on the 17th of July 2025 of John Owen Stone AO, a Senator for Queensland from 1987 to 1990. I call Senator Ayres.
I seek leave to move a motion relating to the death of former Senator John Stone.
There being no objection, leave is granted.
I move that the Senate records its sadness at the death on the 17th of July 2025 of John Owen Stone AO, former Senator for Queensland and Secretary to the Treasury, places on record its gratitude for his service to the Parliament and the nation, and tenders its sympathy to his family in their bereavement. Senator John Stone was a towering figure in Australian public life, an economist, a public servant, a parliamentarian, and a fearless advocate whose contributions to national debate have left an enduring imprint on our national institutions. Born in Perth in 1929, John Stone was the eldest child of Horace Stone, a wheat farmer, and Eva Mai, a primary school teacher. Stone attended Perth Modern School, just a few years above Bob Hawke, and his academic brilliance was evident early. He graduated from the University of Western Australia and, like Hawke, went on to study at Oxford as a Rhodes Scholar. A leading disciple of what became known as economic rationalism in the 1980s, Stone began initially as a student of mathematical physics before switching to economics at Oxford. His intellectual rigour and analytical precision led him to the Commonwealth Treasury, where he served with distinction for over 2 decades. He was appointed Secretary of the Treasury in 1979, but as is said of him in the Biographical Dictionary of the Australian Senate, he had already established himself as the principal policy maker and spokesman of the department. In that role, he became one of the most influential economic voices in the country. He was a staunch advocate for fiscal discipline, transparency in public finance, and the independence of Australia's economic institutions. His tenure coincided with a period of significant global economic upheaval, and he navigated those challenges with clarity and conviction. Stone was considered one of Australia's leading fiscal hawks and economic reformers, but he could be quite a contrarian too. He was a free marketeer who opposed the Whitlam government's bold tariff cut in 1973, as well as the timing of the floating of the Australian dollar in 1983. But to dwell on that would be to miss his pragmatism and his willingness to change his opinion as circumstance demanded. The fact that John Stone could serve treasurers as different as Jim Cairns and John Howard is a testament to his belief in an independent public service. When Paul Keating was appointed Treasurer in March 1983, some urged him to replace Stone with a more amenable secretary. Keating refused, signalling that he and Stone both placed a premium on the contest of big ideas. In 1987, he entered the Australian Senate as a National Party Senator for Queensland. Though his time in this chamber was brief, his contribution was substantial. He brought to the Senate a rare depth of economic understanding and a fierce independence of thought. Senator Stone believed deeply in the importance of sound economic policy as the foundation of national prosperity. He was sceptical of excessive government intervention and wary of inflationary pressures. His views often placed him at odds with prevailing political winds, but he never wavered in his commitment to what he believed was economically prudent and nationally responsible. I acknowledge that Senator Stone's views and this is possibly the understatement of this week, that his views on questions of economic management often diverged from my own. He was a critic of Keynesian stimulus and wary of redistributive policies. Yet in a democracy, particularly a democracy like Australia's democracy, it's the contest of ideas that strengthens our institutions. Senator Stone's contributions to that contest were formidable, and his presence here and his role in Australian public life elevated the quality of debate in this place. His speeches were marked by clarity, conviction and a deep concern for Australia's long-term economic well-being. His clashes with Labor's then Finance Minister Peter Walsh were a regular highlight for senators to watch in those years, I'm told. It seems misleading to speak of John Stone's retirement. He retained an intellectual leadership role in Australian conservative politics. In the H.R. Nichols Society, the Samuel Griffith Society, in the Australian newspaper and in Quadrant, his voice remained a big deal. He wrote prolifically, offering commentary on economic, cultural and political issues. Whether one agreed with him or not, and I rarely did, his arguments were always grounded in principle and presented with intellectual honesty. In recognition of that service, he was appointed an Officer of the Order of Australia, a fitting tribute to a man who gave so much to Australia. Today we honour Senator Stone not only for his achievements, but for his unwavering commitment to public service. He was a man of ideas, of principle and of deep conviction. His legacy will endure in the institutions that he helped shape and the debates that he enriched. On behalf of the Senate and of the government, I extend our condolences to his family, his friends and all of those who mourn his passing. May he rest in peace.
Senator Cash.
Thank you, Deputy President. And on behalf of the opposition, today we mark the passing of John Owen Stone AO. He was someone who, without a doubt, it is recognised, I think, on both sides of politics, was a man of formidable intellect. He was an unflinching public servant and, without a doubt, one of the most remarkable Australians to ever enter the Parliament. He was also a humble man. He was never a man to chase popularity. He is often said, though, to have chased principle. He pursued policy, he followed reason, and in doing so, he helped shape the economic foundations of modern Australia. Born in my home state of Perth in 1929, he was the eldest of two sons to a wheat farmer and a school teacher. John's early years were spent in the harsh but formative country of my home state's wheat belt. His parents divorced when he was 12, and alongside his mother and younger brother, he moved to Perth, where he won a scholarship to Perth Modern School. He later earned first-class honours in mathematical physics at the University of Western Australia. He could have stopped there. That was a huge achievement within itself. But throughout his life, and certainly his life of public service, he became known as someone who was never content to stand still. In fact, in 1951, he won a Rhodes Scholarship to Oxford, and he switched from physics to economics, but again, still graduated with first-class honours. It was the beginning of public life, marked by clarity, by conviction, and in no small measure, and we've already heard about some of it, controversy. He actually joined Treasury in 1954, and over the next 30 years, he rose through its ranks, serving overseas in London and Washington, shaping economic doctrine, defying prime ministers, and eventually leading the department as secretary from 1979 to 1984. To say that John Stone transformed Treasury is no overstatement. In fact, his colleagues referred to it as, and I quote, the Stone Age, a term meant both critically but also admiringly. He believed Treasury should be the gatekeeper of prudence, the check against what he called the barbarian hordes of unchecked spending and policy expediency. And whether he was advising Whitlam, Hayden, Howard or Keating, the one thing that you can say about John Stone was that he never hesitated to speak truth to power. John Howard, who worked with Stone as Treasurer, described him as a man never to be taken for granted, a superb intellect, a talented wordsmith, and a relentless champion of sound public policy. Even his written minutes, acerbic and precise, carried the sharp clarity of a mind intolerant of muddled thinking. He stood firmly for small government, low taxes and individual responsibility. He was a fierce critic of protectionism, centralised wage fixing and government overreach. He warned early of Australia's growing foreign debt, low productivity and economic drift. Not every prediction proved right, but few, as has been said, were ever ill-considered. He was, in Paul Kelly's words, one of the two men who ran the nation during the Fraser years. In 1987, and this is actually quite remarkable, and in particular for those who in this place who understand the public service, he did something few public servants have ever done, and he entered Parliament. As a senator for Queensland and leader of the National Party in this chamber, he quickly made his mark. In his first speech, he proclaimed, "Small is beautiful," a credo he carried into his vigorous opposition to Labor's Australia Card legislation. It was John Stone who exposed the regulatory flaw that ultimately sank the scheme. He was not easily managed, but he was valued. Even after being dismissed from the front bench, he was soon reinstated. That was the kind of colleague Stone was. Challenging, yes, but at the same time, indispensable. Outside of Parliament, Stone's influence never waned. He co-founded the H.R. Nichols Society and the Sir Samuel Griffith Society. He wrote prolifically. He spoke regularly. He championed federalism, individual liberty, and a sceptical view of government power. He opposed multiculturalism, judicial activism, and the Republic. Now, whether you agreed with him or not, the one thing that you could say about him, you never mistook where he actually stood. But John Stone, with so many of us, was not just a public figure. He was a husband, a father, a thinker, and a man of deep personal conviction. He was actually married to his beloved wife Nancy for nearly 70 years. They raised 5 children, including Andrew Stone, who followed, as we know, in his father's footsteps into public policy, serving as an advisor to prime ministers and opposition leaders alike. Those who knew John Stone personally speak of his charm, his wit, but more than anything, his deep love for our great country of Australia. He ran 32 kilometres to Lake George in response to a challenge. He represented his state in hockey. He was intensely competitive, unflinchingly honest, but never, ever dull. In every role he played, scholar, bureaucrat, senator, commentator, he insisted on the highest standards, and he was someone who did not tolerate laziness. John Stone stood for ideas. He stood for integrity, but more than that, he stood for Australia. His legacy endures in our institutions, our economic framework, and the generations of policymakers he influenced. For those of us in public life, his career is both a challenge, but it's also a reminder that conviction does matter and that a single mind, rigorously applied, can actually shape a nation. On behalf of the opposition, I extend our sincere condolences to John Stone's family, to all, in particular the children, to Nancy, and to all who mourn John Stone's passing. May he rest in peace, but may his example also continue to inspire.
Senator McDonald.
Thank you, Deputy President. Now I rise on behalf of National Party senators and the National Party of Australia to extend our condolences upon the death of former Senator John Owen Stone AO, and to his children, his grandchildren, and all those who knew, loved and admired him. John Stone was elected to the Senate from the National Party in Queensland in 1987. In fact, I think that was the first election that I handed out in and would have handed out for the then Senator Stone. He was immediately appointed to the position of Shadow Minister for Finance and was leader of the National Party in the Senate for the duration of his term until 1990. John Stone had led a life of distinguished service long before entering Parliament. Indeed, prominent obituaries such as that in the Australian Financial Review on Saturday, the 19th of July, headlined "Ex-Treasury Secretary Stone Dies," extensively honoured his legacy as a public servant, an intellectual, a think tank leader and author, and focused upon the exceptionally high esteem in which he was held. Former Prime Minister John Howard said that Australia had enjoyed the professionalism and advice of many talented public servants, but in his experience none surpassed John Stone, who served in Treasury for 12 years prior to his role as Executive Director for Australia, New Zealand and South Africa at the International Monetary Fund and World Bank in Washington, D.C., and returned to the Treasury Department in 1971, where he was Secretary from 1979 to 1984. He is renowned for tutoring Prime Minister Paul Keating in economics when Keating unexpectedly became Treasurer rather than Minister for Minerals and Energy in the new Labor government in 1983. Stone did, however, oppose Treasurer Keating's decision to float the Australian dollar, as he fervently espoused economic conservatism, small government, lower taxes and less government spending. In his maiden speech to this chamber, he said, "In matters of government, I have come increasingly to the view that small is beautiful." Over his Treasury career, John Stone worked with 8 Treasurers: Billy Snedden, Gough Whitlam, Frank Crean, Jim Cairns, Bill Hayden, Philip Lynch, John Howard and Paul Keating, which gave former South Australian Premier Don Dunstan the foundation, as you said, Senator Cash, to describe his influence as the Stone Age. He became the only Commonwealth Departmental Secretary to become a member of the Australian Parliament, and well before becoming the head of Treasury, he was its principal policymaker and spokesman, exerting a major influence on several federal governments. He most often voted Liberal at federal elections, but at least twice voted for the Labor Party before joining the Queensland National Party in 1987. Born in Perth in 1929, with his childhood spent in the Western Australian wheat belt, John Stone graduated with the Bachelor of Science from the University of Western Australia in 1950, with this extraordinary first-class honours in mathematical physics, before reading philosophy, politics and economics as a Rhodes Scholar at Oxford University. And returning to Australia from the United Kingdom, Stone joined the Commonwealth Treasury in 1954, the same year he married Nancy Hardwick, who was his beloved companion and intellectual equal for almost 70 years until her passing in 2023. Now, following his short term in the Senate and ill-fated tilt as the National Party candidate for the House of Representatives seat in Fairfax in 1990, which, as an aside, I should tell you, in the McDonald household was treated as one of the great disasters of the century, John Stone maintained a high profile as he transitioned to the role of Conservative public commentator. John and Nancy lived in Melbourne from 1990 until 2000, before finally settling in Sydney. He co-founded the Samuel Griffith Society, dedicated to promoting discussions of the Constitution, decentralisation and federalism. He continued to participate in the H.R. Nichols Society, of which he was a founding father, and whose tie he wore on the day of his maiden speech in this chamber. He became a Senior Fellow of the Institute of Public Affairs and wrote frequently for the Australian Quadrant, National Observer, Sydney Morning Herald, the Australian Financial Review, the Spectator Australia, and delivered numerous lectures throughout Australia. He continued his role as an uncompromising right-wing commentator on public affairs and was appointed an Officer of the Order of Australia in the 2022 Queen's Birthday Honours for distinguished service to the people and Parliament of Australia and to public administration. We acknowledge the loss of a man who was revered, praised for his brilliance and challenged for his obstinacy, but always recognised as one of the most influential Australians to serve in the public service and in public office. John Stone died on the 17th of July, aged 96, and is survived by his 5 children. And on his stint in politics, he said, "I wouldn't have missed it for the world. It was enormously interesting and it was fun." May we all leave this place with a similar sentiment. Thank you for your service, and Vale to John Stone AO.
Senator Smith.
Thank you, Mr Deputy President. I rise to add my voice to those of colleagues in honouring the life and legacy of the late Senator John Owen Stone. John Stone was one of the great conservative thinkers of his generation. He served our country at the highest of public administration, brought deep economic insight to the Treasury, and in this chamber made a contribution that will never be forgotten. Although he was a senator for Queensland, John Stone was born in 1929 in Perth, in my home state of Western Australia. So I feel both a personal and state pride in his life and achievements. He was educated at Perth Modern School and later at the University of Western Australia, before winning a Rhodes Scholarship to study at Oxford University, where he read philosophy, politics and economics, and where he stood out for his formidable intellect and clarity of thought. The parallels with John Stone's later political opponent, Bob Hawke, are uncanny. Both were born in 1929, both attended Perth Modern School and UWA, and both won a Rhodes Scholarship. Each was president of the undergraduate guild at UWA, with John Stone having defeated Bob Hawke for the presidency in 1951. It probably explains why there was never any love lost between the two in the many decades that followed. Returning to Australia, he joined the Commonwealth Treasury in 1954 and over the next 3 decades became one of the most influential public servants of his time. His rise was swift but deserved, and in 1979 he was appointed Secretary to the Treasury, serving under Prime Ministers Fraser and Hawke. It was not an easy time to carry out such a significant role. The Australian economy was experiencing significant upheaval with inflation, stagflation and structural weaknesses that would later demand sweeping reform. Through it all, John Stone brought a disciplined, conservative perspective to economic management. He believed in sound money, restrained government and policies that promoted self-reliance, productivity and national resilience. He was never afraid to speak truth to power. Indeed, that was one of his hallmarks. As Treasury Secretary, he saw his role as the custodian of economic integrity, and while his forthrightness at times unsettled ministers, no one ever doubted the quality of his judgment. But it did lead him to openly clash with several of the treasurers he would serve, including a young John Howard. He was the driving force behind the Fraser government's fight inflation first strategy, and his conservative economics, coupled with his influence on the government, led South Australian Premier Don Dunstan to describe the period as the New Stone Age. So great an asset was John Stone that following Labor's 1983 election win, he was kept on at the Treasury by Paul Keating, despite the reservations of Bob Hawke and the rest of his cabinet. Nevertheless, John Stone resigned in August 1984. Shortly after, John Stone delivered the Edward Shan Memorial Lecture in Economics at UWA, titled 1929 and All That. This lecture drew parallels between the state of the Australian economy in the 1980s and the state of the Australian economy on the eve of the Great Depression, pointing to three key problems: financial mismanagement, protectionism, and ossified labour markets. Along with Gerard Henderson's essay, The Industrial Relations Club, John Stone's speech provided the intellectual foundations for the formation of the H.R. Nichols Society in 1986, where he initially served as president and remained involved for decades. I shouldn't say this, but on this occasion I will. Many years ago I was gifted a tie of the H.R. Nichols Society, a gift that I took great pride in, and it sits in my Senate suite to this day, but I know that we can keep a secret. In 1987, John Stone made the rare transition from Mandarin to parliamentarian, elected as a National Party senator for Queensland. One could ask how a West Australian-born classical liberal economist living in Sydney arrived in this chamber as a Queensland National Party senator. He was offered the spot on the party's Queensland Senate ticket after developing the Joe for Canberra campaign's single-rate tax policy. When delivering his maiden speech, he wore his H.R. Nichols Society tie. I'm not. Though he reassured other senators that, when I put on this tie this morning, I had no intention of being provocative. Whilst many, including John Howard, blamed the Joe for Canberra campaign for the Coalition's 1987 election loss, John Stone was appointed Shadow Minister for Finance. Though his time in this chamber was brief, it was impactful. John Stone brought with him an unparalleled grasp of economic and constitutional matters, and he used that expertise to sharpen our debates and challenge assumptions. It is no surprise that a politician with John Stone's keen economic insight, vision, held ambitions to be the Treasurer, and in 1990 he resigned from the Senate to unsuccessfully contest a seat in the House of Representatives. John Stone, though, remained a prolific writer, speaker and contributor to conservative publications, particularly Quadrant. He was particularly concerned with the creeping centralisation of power in Canberra and was a staunch defender of states' rights, something he attributed in part to his West Australian upbringing. This led John Stone to his next political project, which was inspired by what he perceived as a growing disregard by the Hawke government for the federal principles of the Australian Constitution in the Tasmanian Dams matter, including attempts to amend the Constitution with 4 simultaneous referenda in 1988. In 1992, he co-founded the Samuel Griffith Society, of which I'm a proud member. The Society is dedicated to defending the Constitution against all who would attempt to undermine it, particularly in support of decentralisation, federalism and the restoration of the authority of Parliament. With the support from his wife Nancy, John Stone led the organisation until his retirement in 2009. How fitting it is then that he will be especially remembered this month when the National Conference of the Samuel Griffith Society is held in Perth. His views were never for the faint-hearted. He was a man of strong convictions and a robust defender of traditional liberal conservative values. He spoke with clarity, sometimes sharply, reflecting a frustration with what he saw as drift or compromise. John Stone himself would not have shied away from the fact that some of his contributions were controversial. He believed public life demanded honesty, even perhaps especially when it was uncomfortable. In an era increasingly wary of strong views and unfashionable opinions, John Stone reminded us that a healthy democracy requires diversity of thought, intellectual courage, and the space to disagree. Despite this, those who knew him personally remember a man of courtesy, loyalty, and great personal discipline. He was, of course, deeply devoted to his wife Nancy and to their entire family. As a West Australian, I'm proud that our state produced such a formidable national servant. As a Liberal Senator, I pay tribute to a man who embodied so many of our enduring values. And it was a privilege on a number of occasions to have met and spoken with both John and Nancy, most frequently, but not exclusively, at meetings of the Samuel Griffiths Society. As economic debates again circle around inflation, spending and debt, we would do well to revisit the insights of John Stone. His warnings about fiscal excess, short-termism and bureaucratic bloat remain as relevant today as when he first raised them. John Stone's legacy will live in our laws, our debates, and in the integrity he brought to every role. Like others, I extend my condolences to his families and to all that knew him.
Senator Cadell.
Thank you, Mr Deputy President. I also rise to pay tribute to a legendary figure. I use that word legendary, as did Paul Kelly in Australian public life. John Owen Stone, AO, on behalf of the National Party, New South Wales Nationals, I offer our severe condolences to his family and our profound respect for a life spent in public service to the Australian nation. He's a man of remarkable intellect. We've heard so many things that he's done here today: unwavering conviction and fearless independence. Over a career that spanned public service, politics, journalism and civic commentary, he shaped many of the great debates this nation has had. We've heard he was born in Western Australia. We've heard the trail he went right across Australia, living in so many of our cities, so many of our towns, which gave him a great sense of federalism and gave him a great sense of what this nation was. It was also that time he spent over in Oxford being a Rhodes Scholar and serving 8 treasurers, Liberal and Labor, without fear. And that was what led Paul Kelly once again to say he called a mastery of economic reasoning and a gift for the principled dissent. Stone once said himself, "The first duty of a public servant is to the public, not to ministers, not to ideology, and certainly not to fashion." He was fiercely independent. That line captures him well. He never allowed his role to become politicised. He stood firm against the inflationary policy, reckless spending at times, even his own ministers, when he believed that the national interest was at stake. When he entered in 1987 this very chamber, the other chamber down the road it was, didn't come up here, National Party, as he spoke plainly and with purpose. He believed in strong borders, a sovereign parliament and cohesive national identity. He once told this chamber, "A parliament that shrinks from its responsibilities, whether through political cowardice or cultural confusion, is a parliament unworthy of the Australian people." Think of where we are today and the arguments we're having and the things that are being said, and apply that. Some of his views were controversial, but none doubted the sincerity of which he held them. In the time when political figures often followed their lead, John Stone was resolutely his own man. He believed above all that Australia must remain the master of its own destiny. In the 1990s and beyond, his essays in The Quadrant, The Australian and other publications, a deep concern for Australia's economic direction and cultural confidence. In one of his most cited pieces, he wrote, "We've become a nation adept at the language of surrender. Surrender of culture, of sovereignty, of pride in our civilisation, and that must end, or the nation we know will cease to exist." Once again, words that we must think of. But that, Mr Deputy President, was the spirit of John Stone, a man who saw warning signs and spoke them loud and clear while others stayed silent. He was deeply committed to the principle of federalism and worried about the overreach of Commonwealth power into the lives of citizens and the responsibilities of states. His words on this subject were also strong. The drift towards centralisation is not inevitable, it is merely being left unchecked. To the very end, he wrote with sharpness and clarity, urging Australians to think more deeply about what binds us together as a people. He was always for unity. Mr President, Deputy President, John Stone was not only a public servant or senator, he was a national sentinel. He guarded our institutions, our finances and our civic cohesion with fierce determination. His legacy is one of courage, intellect and an unshakable belief in the Australian nation. To his wife Nancy and their children, we extend our deepest sympathies. Australia has lost a statesman, but his words and the example of his service will remain with us. May he rest in peace.
Senator Canavan.
Thank you, Mr Deputy President. I too would like to provide my condolences to former Senator John Stone's family and recognise the incredible service he gave to our nation, both in this place and in other roles. Indeed, normally, I suppose in these condolence motions we would look to the example of the former senator in their political life and seek to remind ourselves of how we could do better as parliamentarians following reflection of their service. However, I think when I look back at Senator John Stone's career, there perhaps are more lessons to the broader public service and those that support us in this role. And I do want to say we have incredible public servants in this country, but it's hard to read John's biography and his contributions without feeling a little bit of regret that they don't really make them like John Stone anymore. And it seems to me that we could have people like John, but and I'm not trying to blame individuals here, but for whatever reason, now the advice we receive, the commentary that occurs in our broader public debate, always seems to be a little filtered and diluted. You couldn't call John Stone someone who diluted his opinions and contributions, and the nation, the Parliament, our country was better for it. So I will come to John's career as a politician, but I hope that those in the wider public service also take the opportunity of his passing to reflect on his career. And they may not agree with everything John said and did, but I think his example is one that should be looked to more and taken as a template. Another thing that struck me when I read through John's incredible biography is that just reading his biography gives you a very good grounding in post-war economic policy in this country. He was involved in almost every major economic debate and decision that occurred in the post-war period. It was an incredibly important and crucial period for Australia's development. I hope it doesn't get forgotten in our history, because things have moved on somewhat from that period, but there are a lot of lessons in it. Just to mention a few things, John was integral perhaps in pushing back in some of the recommendations in the Vernon report in the mid-1960s. That's something that's perhaps a bit lost to our history. I do have copies in my office if anyone would like to read them. They're very big. They don't really write reports like that either anymore. But John, those reports effectively are called for more planning and control, government control of the Australian economy, and John, along with some others in the Treasury Department, pushed back against some of the worst abuses of that, or what would have been the worst abuses. John was also integral in opposing the then panic that occurred around the Club of Rome in the early 1970s. He argued strongly within Treasury, successfully I believe, that we did not need to panic because prices would change, and that would encourage additional resource development, technology developments, and we wouldn't run out of food or other resources, as the then Club of Rome were warning. He was proven absolutely right about that, and continues to be proven right about that against the current crop of neo-Malthusians. He was also integral through the 70s and early 80s of developing a fight inflation first approach to a terrible problem that was afflicting Australia at the time, at stagflation in the 1970s, and there were, I suppose, a preference to always rest back, or since the days of the Great Depression, rest back on the Keynesian policies of the Phillips curve and extra stimulus, but John was part of a broader movement across the world to say no, those relationships, those economic models had broken down, and there was a need for strict restraint on government spending, a tighter monetary policy that perhaps some wanted, to finally get rid of that scourge of inflation. Again, probably some lessons for us today as well. In saying all of that, I think when I read a bit of John's biography, and even with respect to contributions today, there's perhaps a tendency to think that John was quite strident and ideological and dogmatic even in his so-called right-wing positions, but his career also showed a practical approach to policy. It wasn't all one-sided. He did oppose, despite being generally a supporter of free trade, he opposed Gough Whitlam's 25% overnight tariff cut, for good reason, I think. He also opposed the flooding of the dollar again as he explained later, he opposed the urgent and sudden adoption of that policy rather than necessarily the direction itself. And again, so this is he's considered opinions, but strident ones were ones that definitely help shape policy in this country and are very instructive, I think, for those involved in public policy today. Now, he did, as has been described, decide to become a Nationals Party senator, despite, I think, never having voted for the Nationals Party, or as Senator Smith mentioned, I don't think he'd even lived there before. Perhaps he'd visited Queensland before he became a senator. I probably had. But he was welcomed with open arms into the Nationals Party. He contributed significantly to the development of a flat tax policy. So I'm going to go back and read now that I've read that. It's time, Senator Smith. I'm not sure yet, but it should stay on in people's minds at least. And very early on in his parliamentary career, he stood for deputy leader of the Nationals Party and almost won. So he was very highly regarded. He became, in a very short career in this place, the leader of the Nationals Party in the Senate, and then decided to run for a lower house seat. And he apparently had been very scornful of politicians throughout his public servant career, but that didn't stop him becoming one. Perhaps he started to, by running for the lower house, started to push up against the limitations of frank and fearless advice and the hitting in then to the tough grassroots politics that goes with being potentially a lower house member. I know a former colleague of ours, Ron Boswell, was very good friends with John Stone, and Ron recalls in his recent autobiography campaigning with John for the seat of Fairfax in the Sunshine Coast, and in Ron's view, it was just tough to get a strident free market economist who believed in lower free trade to get the pineapple and ginger growers of the Sunshine Coast to support. So ideological purity has its benefits, but it doesn't always translate to votes, as John realised, and he was beaten ultimately by Alex Sommelier. Mr. Alex Sommelier had a long career in the other place. There's lots of stories about that campaign, but it was none of that reduced the contribution John made to this country, and indeed, as Gerard Henderson once wrote, there could be questions about John's political judgment, but there could never be a question about John's courage in putting himself forward to these positions and seeking to do what he thought was best for the nation. Even that was a long time ago that he ran for the seat of Fairfax, but he continued to contribute to our nation. I will miss his contributions in The Spectator magazine. They were quite fun. I was reading a few of them before this, and I've ultimately decided I probably won't quote them in the chamber. They may not reflect. It's probably too soon. Maybe in another 10 years we can recount his reflections, but they were always very acerbic. He was always worth reading. And I'll finish there that, again, I just hope that the people that want to put opinions forward to us as decision makers, I just want to know what you think. I just want to know where you stand. I particularly, I suppose, I think it's best, and John's career shows this, we don't actually need the public servants to be politicians. We don't need them to double guess what's going to work, what's going to get the most votes. I find that's happened a bit too much lately, that they perhaps read a little bit too much sepsology and not enough public policy. We need the public service to provide advice on what's best for Australia. Obviously, then we need to navigate through a democratic environment how that gets popular support, but we need that frank and fearless advice, now more than ever, that John Stone provided. And all my condolences go to his family, his son, Andrew Stone, who himself has been a major contributor to public policy in this country, is here with us this evening. Thank you for being here, Andrew, and please, on behalf of all of us and through you, pass our condolences on to your family and Vale, Senator John Stone.
Just briefly, I didn't have the pleasure of meeting John Stone. I would have loved to. I suspect we would have agreed on a great many things. I did have the pleasure in a previous role of working, however, with Andrew, so on behalf of myself, Andrew, please pass on the condolences of the Senate to your entire family. I ask senators to join in a moment's silence to signify their assent to the motion. The motion is carried. I shall now proceed. Excuse me. I shall now proceed to the placing of business. Is it desired to postpone or rearrange the business? Clerk?
Permit notifications have been lodged as follows. Business of the Senate notice number 3 for today to the 30th of July, and general business notice of motion number 34 for today to the 29th of July.
There being no objection, the business is postponed. I shall now proceed to the discovery of formal business. Are there any formal motions? Senator Canavan.
Thank you, Mr Deputy President. I ask that business for the Senate notice of motion number 1 be taken as a formal motion.
Is there any objection to this motion being taken as formal? If there is no objection, I call Senator Canavan.
I move the motion.
Question is that motion be agreed to. Those of that opinion say aye. Aye. Against say no. No. The ayes have it. No. Division required. Yep. Ring the bells. lock the doors. Question is that business of the Senate motion number 1, moved by Senators Canavan and McDonald, be agreed to. Ayes will pass to the right of the chair, noes to the left. I appoint Senator Askew teller for the ayes and Senator Sheldon teller for the noes. The result of the division is ayes 25, noes 31. The question is resolved in the negative. Senator Roberts.
I was under understanding, Deputy President, that this is going to be debated this afternoon.
Absolutely. Senator number 3 is postponed. Senator David Pocock.
President, I seek leave to amend business of the Senate motion number 4 relating to reference to the Community Affairs Reference Committee before asking that it be taken as a formal motion.
Well, there's no objection. Leave is granted.
President, I amend the motion in the terms circulated in the chamber and ask that it be taken as formal.
There's no objection. This motion is taken as formal. I call Senator Pocock.
Thank you. I move the motion as amended.
Question is the motion as amended be agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. Senator Thorpe. We'll go to 31. Senator Payman.
One be taken as a formal motion.
There being no objection, this motion is taken as formal. Senator Payman.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Against no. The ayes have it. Senator Whish-Wilson.
Deputy President, I ask that general business notice of motion number 32 be taken as a formal motion.
There being no objection, the motion is taken as formal. Senator Whish-Wilson.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. The ayes have it. Senator Babet.
Thank you. I ask that general business notice of motion number 33 be taken as a formal motion.
There being no objection, the motion is taken as formal. Senator Babet.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. Senator Shoebridge's motion number 34 has been postponed. Senator Payman.
I ask that general business notice of motion number 36 be taken as a formal motion.
Question is whether this be taken as formal. There being no objection, the motion is so taken. Senator Payman.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Against say no. The ayes have it. The ayes have it. Senator Payman.
I ask that general business notice of motion number 37 be taken as a formal motion.
Is there any objection to this motion being taken as formal? There being no objection, I call Senator Payman.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Against say no. The ayes have it. Senator Payman.
I ask that general business notice of motion number 38 be taken as a formal motion.
There being no objection to this motion being taken as formal, I call Senator Payman.
I move the motion.
Sorry, hold on. Senator Scarr.
Thank you, Deputy President. I seek leave to make a very short statement, if I could.
Is leave granted for a statement? 1 minute. Leave is granted.
Thank you. The Coalition believes that the long-standing conventions relating to the provision of staff to non-government MPs and senators is an important one, which Prime Minister Albanese has disrespected, and noting this breach of convention, it is important to obtain as much transparency as possible on this matter, and therefore the Coalition will support Senator Payman's motion.
Senator Gallagher.
Leave to make a short statement.
Leave is granted.
Thank you. The government will oppose the motion. The allocation of personal staff under the MOPS Act is reported and publicly accessible in the normal way through established processes, including during estimates. At no point would the government agree to release the personal or specific details of parliamentarian staff or party groups.
I will now, Senator Payman.
Move the motion.
The question is this motion be agreed to. Those of that opinion say aye. Against say no. I believe the ayes have it. Division required. Ring the bells for 4 minutes. Lock the doors. Question is, the motion moved by Senator Payman, agreed to. Ayes passed to the right of the chair, noes to the left. I appoint Senator Askew, teller for the ayes, and Senator Grogan, teller for the noes. The result of the division is ayes 28, noes 32. The question is resolved in the negative. Senator Payman. Just give Senator Payman a moment to return to her chair.
Thank you. I ask that general business notice of motion number 39 be taken as a formal motion.
There being no objection, this motion is taken as formal. Senator Payman.
I move the motion.
I will put the motion. The question is, this motion is agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. The ayes have it. Senator Payman.
I ask that general business notice of motion number 40 be taken as a formal motion.
There being no objection, this motion is taken as formal. Senator Payman.
I move the motion.
Question is, this motion be agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. The ayes have it. Now, Senator Thorpe, we're going to return to number 30.
I ask that general business notice of motion number 30 be taken as a formal motion.
Is there any objection to this motion being taken as formal? There being no objection, Senator Thorpe.
I move the motion.
Question is this motion be agreed to. Those of that opinion say aye. Aye. Against say no. The ayes have it. And that completes formal business. Now, Senator Hanson has submitted a proposal under Standing Order 75 today, as shown on item 14 of today's order of business. Is consideration of this proposal supported? I'll just give senators a chance to return to their seats. But the proposal is supported. With the concurrence of the Senate, the clerks will set the clock in line with informal arrangements made by the whips, and I call Senator Hanson to move the motion.
I move the motion in my name. Net zero. Well, we have school children in the gallery, and I think that this is a great debate for them to hear moving forward. What we found is this net zero has not been explained, debated, and we have no indication of what's being taught to the children in school. A lot of the school children these days are crying, they're upset because they feel the world's coming to an end. Well, I'll tell you something, it's not. It's not coming to an end. The world's not coming to an end, okay, over climate change. It's being pushed by those who are going to make a lot of money out of it. Climate has always changed. If you go back over the centuries, if you look at the sun now, they predict the sun is actually 6 degrees hotter than what it was 3 million years ago. Do you think that's because of carbon emissions? Our emissions now for Australia, they say global emissions. Ours is only 1% of global emissions. China and India and the United States are putting out 50% global emissions. Guess what? China doesn't have to sign up to any global emissions to rein in their emissions till 2060, India 2070. America is not even signed up to it. So why are we destroying our economy, our way of life, our standard of living, for what? This has become a political football for those people just to use this to gain votes. The scaremongering that goes on with the younger generation. We cannot even refer to temperatures before 1910. Oh, we can't discuss that. Australia is a land of flood and drought. It's in our history books. Years ago, if you go back, we used to have an ocean inland Australia. What did we have? Industrialisation? Did we see petroleum products being used then? No, we didn't. Look at the ice age that the world has had. The Thames froze over in the 1400s. All this? No, wasn't human emissions. Human emissions are only responsible for 3%. 3% out of 97% comes from actually natural resources, whether it's from the soil or volcanoes or the oceans, which emit and absorb carbon dioxide. But we're going to blame the humans for this. So therefore we can move forward and we can pose restrictions on people. So what's going to happen for the future? I tell you, this has all been set up under Agenda 21. Started with Marie Strong in the 1970s. So it's basically about Agenda 21 controlling the plebs. That's what it is. We're going to have class distinction here. We're going to have the lower class of people and we're going to have those, the rich, who can pay for it. So what I'll tell the future of what's happening is that people will actually be controlled on what you eat, where you move. That's why, what cars you drive and how far you're going to go. So you won't have the freedom to travel because it's all about climate change. We can't allow that to happen. You're going to destroy the earth. Industrialisation, carbon emissions were lower after industrialisation happened. And actually, scientists actually debate this issue. Does carbon follow temperature or does temperature follow carbon? And that's a lot to be debated. Does anyone talk about the volcano eruptions? What about all the emissions? There's supposed to be geologists and scientists that said there's about 1 million active volcanoes in our oceans around the world. Has anyone, stated the damage they may be doing? You can't turn it around by taxing people to the hilt, which is driving up the cost of living, and you're putting people in such a position they cannot afford their bills, their houses, their rent, nothing. And this is all driven up because of the high cost of electricity. Don't think that just because you put in wind turbines, you put in solar panels, that is the answer to it. It's not the answer to it. You're charging people to the cost of $50 billion plus by all these renewable scams that you've got and the scaremongering that goes in. It's not producing reliable, affordable energy. We've lost our industries, manufacturing, the cost of living to everyone. And the lights are still going to go out. You're heading down a path, you're destroying this economy, you're destroying our way of life in Australia. It's a scam that you're pushing onto the Australian people, and it's a real shame on Labor that you continue down this. You never allow the real debate in this parliament and put up the real scientists. Let's go take it out to the public. Let's have a debate in public so the people can be a part of it. You're affecting their lives. I think they should be a part of it.
Thank you, Senator Hanson. I call Senator Canavan.
Thank you, Madam Acting Deputy President. I do rise to support this motion because net zero is not working. It's very simple. When Australia signed up to net zero emissions just over 3 years ago, the people that pushed net zero emissions said that it would deliver cheaper power. They said that it would create heaps of new jobs. They said that we'd be joining the rest of the world, who are apparently going to act on these things. But on all of those fronts, those that push net zero have been wrong. Completely and utterly wrong. Not just by a little bit, totally and utterly wrong. On power prices, since we signed up to net zero, we were promised cheaper power. Is anyone paying less for their power? I don't think so. Electricity prices have actually gone up 31% in the last 3 years, and for gas they've gone up 40%. And now the government doesn't even promise lower power prices. They've just given it up. They just wave the white flag. On more jobs, we were promised all these jobs in hydrogen and critical minerals. Well, we've lost our nickel industry. Totally lost it. 10,000 jobs lost in a critical mineral in Western Australia since we signed up to net zero. We lost it because Indonesia has no shyness from building coal-fired power stations, and we were trying to make green nickel. We lost them. Now we're on the cusp of losing copper and aluminium jobs. The government's having to bail billions of dollars out for them as well. And then other countries aren't acting either. We were told other countries are acting. Well, the United States has pulled out. China, India, Indonesia and Mongolia have increased their annual coal mining by 1.2 billion tonnes a year since they so-called signed up to net zero. It is just not working. So it's time to recognise that. When something's not working, you stop it. You stop it and you do something else. And that's why we need to stop net zero. And look, Madam Acting Deputy President, while I do support this motion, I do want to note that One Nation is playing catch-up here today. My colleague and good friend Barnaby Joyce, the member for New England, has in the other place moved a law to repeal net zero. And while I accuse One Nation of playing catch-up, I too must say, when Barnaby a few weeks ago told me that he was going to do this, the first thing I thought was, why didn't I think of that? Why didn't I think of that? So I've got to give him credit. I've got to give him credit for doing this. He's put it on the agenda. He's dominating the media and discussions. It's about time we have a debate on this. So I'm happy to have this debate too. But we are in here to make laws, not just statements. So we've got to repeal this rubbish so that finally we act in the interests of Australians again.
Thank you, Senator Canavan. Senator Ghosh.
Well, it's not surprising to see this motion moved by One Nation, but the real suspense it provokes is in relation to what the Liberal Party and the National Party are going to do. Less than a week ago, Mr Joyce and Mr McCormick were on the front page of The Australian in a unity ticket to ditch net zero. And the question is whether the Liberal Party of Australia is going to learn the lessons of the election, but also learn the lessons of what's happening in our climate and our economy, and actually take a step back to the reasonable part of Australian politics, or lurch right once again and double down on the policies of the Dutton opposition and their head-in-the-sand approach to climate change. A net zero emissions target is not something to be feared. It's an opportunity for Australia to capitalise on a changing global economy while addressing an important issue that requires addressing not just from an economic perspective, but for our survival on the planet. To ignore the need to tackle climate change and to reach net zero emissions is to put our people, our farmers, our businesses, our livelihoods and our industries at risk. It's no secret that this transition is going to be challenging, but doing nothing will be much more costly. Deloitte estimates that over the next 50 years, unchecked climate change would, in average annual terms, reduce Australia's economic growth by 3% per year. That's why the government's committed to tackling this problem in a certain way and in a responsible way. Dr Ken Henry, the former Secretary of the Treasury, addressed the National Press Club last week, and he said the biggest threat to future productivity growth comes from nature itself, more particularly its destruction. It is now well accepted that a degraded natural world poses myriad threats to food systems, provision of clean air and water, and the continuing supply of other ecosystem services critical to production. And so while those opposite are always happy to use the word productivity, they very rarely go beyond that and look at the benefits that this transition will have for our productivity and our economy. Longer droughts, bigger floods and more intense bushfires threaten the future of our agricultural sector, a reduction in productivity. In Australia, researchers predict that wheat yield loss may be as high as 27% in parts of northern Victoria in the next 40 years, impacting on food security and food affordability, things that are very important to the people on this side of the House. It is a failure to address climate change and to reach net zero that will hurt our country and its people. But if we go back to 2020 and a document that was prepared by the then Minister Angus Taylor, the Technology Investment Roadmap. At that stage, perhaps a more sensible Liberal Party, certainly not as extreme as it is today, told us in that roadmap that low emissions technologies could position Australia for over $30 billion a year in new export revenue from energy-intensive, low-emissions products by 2040. And that's why, in its 2021 report on this, the Business Council of Australia announced its support for reaching net zero. And what it said, what that council, that radical organisation, said was the pace and scale of change is accelerating globally. Australia is at a crossroads. We can either embrace decarbonisation and seize a competitive advantage in developing new technologies and export industries, or we can be left behind and pay the price. The transition must run in tandem with the nation realising greater economy-wide productivity gains, lifting international competitiveness and improving the ability to attract investment in order to accelerate economic growth and secure Australia's long-term prosperity. That's the Business Council of Australia, and it speaks to the political extremism and it speaks to the wander to the right that's occurred by those opposite, that they don't get on board with these changes. What has the government done, though? We've seen record levels of renewable energy generation, reaching 46% on the national market at the end of 2024, and we've seen a significant increase in generational capacity. It's not a simple task, but doing this transition positions Australia to be part of a global economic change. It allows us to generate revenue for export industries, and most importantly, it allows us to play our role in tackling a significant global challenge, which is not only affecting our economy, but also our ecosystems and our livability on the planet itself. So while the motion from One Nation is not surprising, what is surprising is the speed and the cynical nature in which it has been approached or adopted by those opposite, and what remains to be seen is whether the Liberal Party can find some sense and find its way back, or whether it remains on the right fringe and denies the existence of this problem.
Thank you, Senator Ghosh. We'll be in continuation on this matter. Pursuant to order, I now call Senator Ananda-Rajah to make her first speech and ask senators that usual courtesies be extended to her. I call Senator Ananda-Rajah.
Thank you, President. President, I'd like to acknowledge the First Peoples of Victoria and their enduring connection to science, to nature and to learning. Colleagues, imagine it is 2065, 40 years from now. My time as a parliamentarian is long gone, and my world is confined to my home, my family, and my memories. This is my vision of the future. I am 92 years old. As I tend to my veggies, my gaze lifts to the smoke on the horizon. When once I felt fear, I know that that fire will be extinguished by fire retardant drones lifting off from stations all around the bush, triggered by satellites. Despite Australia hitting net zero well before 2050, our fire seasons remain intense due to the baked-in impacts of climate change. Earth's fever has not broken, but on our current trajectory, it will, as vast machines made by gods suck carbon from the air and kelp forests teeming with life trap carbon in our oceans. The tech oligarchs of my working life have been replaced by blue carbon billionaires. Some 40 years earlier, a Labor government I served in laid the foundations for our renewable energy transformation. Australia has now become an energy darling fettered by global businesses that make products like green steel, which have reduced the world's emissions by 8 to 10%, as predicted by eminent economist Ross Garnaut decades earlier. We now feed the world's appetite for guilt-free energy, especially in Asia, while creating that holy grail, a high-wage economy delivering sustained prosperity immune from the boom and bust of mining. Regional communities like mine have benefited most, with streets abuzz with young families, a good indicator of a thriving community. I am reminded to get dinner on because my granddaughter will be home soon. She works in our booming biotech sector, making nanoparticles that deliver chemotherapy directly to cancer cells, leaving healthy tissue intact. The scorched earth side effects of chemo I witnessed as a doctor have been relegated to the history books. Working in the city, she will be home soon, thanks to high-speed trains that practically fly in tunnels at speeds rivaling a jet. I never liked the Melbourne to Canberra flight. Now I never need to take it. I turned to squeals of delight from my great-grandson, who has spotted a wombat under the deck. I lift him up. The pain of knee osteoarthritis that marred my 60s has eased, thanks to weight loss drugs made affordable decades earlier. These drugs have crushed diabetes, heart disease, arthritis, cancer, and sleep apnea. When I was a doctor, hepatitis C had no cure until antivirals came along. The same has happened with obesity, by far the toughest nut to crack. By blocking the reward centres in the brain, these drugs have also curbed drug and alcohol addiction, saving billions in knock-on social and economic effects. As evening falls, my tradie granddaughter bounds down the stairs. She found me last week after my AI assistant alerted her to my fall. My patients used to spend upwards of 14 hours on the floor after falls. Now, no more. A quick hug and she heads off to fit out a 3D printed home built in 3 days. She won't be alone, joined by farmers, construction workers and council workers who work under floodlights. Heat stress has reset the working patterns of thousands of Australians who, like I once did as a doctor, now work the night shift. An alert from our Prime Minister pops up. A new respiratory virus has been detected with pandemic potential. Rest assured, she says, a universal vaccine is available to buy us time before a more specific vaccine is approved. Made domestically, the delays will be minimal. With the ranks of our elderly and immunocompromised growing, clean indoor air powered by abundant energy is another layer of protection around vulnerable Australians who do not respond to vaccination. Dinner is a communal affair with 4 generations around the table. After a meal of lab-grown meat, my great-grandson and I snuggle up together with his favourite book, Diary of a Wombat. Some things never change. President, every single concept in this vignette is grounded in science rather than fiction. It is a future where advances in science and tech lift up our living standards, making us more resilient, prosperous, and able to withstand whatever the world throws at us. It means delivering investment and policy anchors that give our innovators and startups certainty for the patient, difficult work of R&D. When Pulitzer Prize-winning writer Siddhartha Mukherjee said that technology dissolves its own past, he meant a leap from analog to smartphone, from prayer to life-saving drugs, from coal-fired power to cities powered by cars and home batteries. As a doctor, scientist, and now senator, I'd like to see Aussie fingerprints all over that future tech. Labor understands that critical mineral processing, agriculture, and clean energy are areas where we have a competitive edge. But there is another which is a sleeping giant. Biotech, like clean energy, is an area where we are primed for success. In research excellence, Australia is ranked 8th globally. Our health system, underpinned by that great Labor legacy, Medicare, tops the world rankings. And we are one of 10 countries with science and tech clusters in our major cities. Melbourne, Sydney, and Brisbane are places where high flyers cluster with high flyers, sparking ideas that turn into dollars. But here's the paradox. Despite punching above our weight, with good healthcare, research excellence, and great talent, we have not turned ideas into companies. With 1,200 biotech companies, a handful of giants like Cochlear and CSL, we have the mystery of the missing middle. At a time when Australia urgently needs new revenue streams to pay for the things that matter, we must crack the code in biotech that bridges the middle between minnow and whale. Almost overnight, we could become a knowledge economy, turning Melbourne, Sydney, and Brisbane into Oxford, Cambridge, and Boston, in arguably a shorter time than making batteries. Consider the clinical trials industry, which pressure tests our drugs before Australians get them. At $450 billion, approaching $700 billion in 7 years, I'd like a bigger slice of that pie. And here's the thing, our multiculturalism puts us in the box seat. This is one of the reasons why attacks on diversity are so misguided, because it blinds us to its economic value. If a drug works in a culturally diverse population, it is likely to work in millions, if not on billions of people. Australia should be the clinical trials destination of the world. A thriving biotech sector means jobs for knowledge workers who, like me, struggled in academia for too long. Knowledge workers are far more diverse than we think. They are scientists, nurses who run clinical trials, doctors, engineers who design artificial hearts, bioinformaticians who crunch genetic data, geneticists, AI scientists, software engineers, statisticians, roboticists, and health economists. These workers cluster in cities, but importantly, aspirants to these jobs are everywhere. They are everywhere, all over this country. They are championed by great institutions like the Australian Academy of Science, who are here today. But even the nobility of science has a dark underbelly. Scientists have all the job security of gig workers. Bullying is underreported. Rent seekers demand authorship for little to no work. The publish or perish mentality has driven perverse outcomes, privileging piles of papers over innovating those ideas into marketable products and services. Our young scientists, who are the engines of innovation and patents, have no chance when judged by seniors who have usually never started companies themselves. If the system feels stacked against our young scientists, it's because it is. And we, as the funder of around $6 to $7 billion on behalf of all Australians, are obligated to fix this. These systemic problems are part of the reason I would like us to bridge the gap to mid-sized companies in biotech. The 8,500 PhDs we make every year need jobs outside academia, and I am not alone. A 2024 report by Research Australia revealed that only 1 in 6 postdocs would recommend an academic career. 1 in 6. India's first Prime Minister, Jawaharlal Nehru, said, "The future belongs to science and those who make friends with science." I say yes, but it's our young scientists we really need to be friends with. President, as a doctor, I observed the sins of society wash up in two places: the justice system and public hospitals. For 26 years as a generalist, I saw patients at the bottom of the pile. I watched the tsunami of chronic disease, severe mental illness, drug and alcohol addiction and homelessness. Every week, I made a cancer diagnosis and alleviated the last moments of a person's life. Some 30 to 55% of health outcomes are due to drivers beyond health. These social determinants like housing, access to healthcare, education, employment and discrimination are core business for Labor governments. Core business. Wearing my other hat in infectious diseases meant fighting small print infections that nobody has ever heard of in patients with profoundly weak immune systems. I saw patients with blood cancers, autoimmune conditions and transplantation, heart, lung, kidney, bone marrow. The Alfred Hospital in Melbourne did cutting-edge medicine and I loved it. Seeing the carnage of infections in leukemia patients prompted my PhD, spanning health economics, better antibiotic management, and artificial intelligence. More challenge, less time with my then small kids, burning the candle at both ends. It sharpened me up and fostered a love for science, which has stood as a protective factor against the shadow that stalks all doctors: burnout. But research was not easy. As a Research Australia finalist and founder of an AI startup, I encountered too many barriers to commercialisation, too many. Turns out I'm not alone. In 2024, Australian startups founded by women attracted a pitiful 2% of investment capital. 2%. Determined to get funding, I even went to the UK. I thought it was because of my gender, my colour, or not enough titles. It was probably a combination of all three. Enabling women, including those with funny names, to sit rather than serve at the founder table means confronting the uncomfortable truth of unconscious bias. It is structural as the steel beams that hold up this place, but it weakens the whole. It starves the enterprise, including our workplaces, schools, sporting teams, creative arts, indeed this parliament, of talent. And that is an act of self-harm. However, it wasn't my patients that led me into politics, but rather the people who cared for them. During the pandemic, healthcare workers who held up the sky were treated as if we were disposable. Gaslit and silenced, I spoke up even against my own profession when I saw the science changing around how the virus was spread. Wiping down surfaces would have been fine had we been facing a pandemic of gastro, but that wasn't the case. I had junior and senior doctors coming to me with their fears, heard nurses weeping behind closed doors, and I went to work. I fought for our safety at work with a coalition of healthcare workers I pulled together. It was the most testing period of my life, hands down, juggling on-calls, kids, late nights, media, publishing, giving lectures. Without knowing it, I had become a campaigner. Taking on the Morrison government as a private citizen over work safety and vaccine rollout was wrath of God stuff. The day before my first appearance on Q&A in 2021, I was asked to go easy on the government by a colleague who had been pressured by a then government minister. It left me shaking and nauseated. It was my husband, a man of steel, who told me to say what I thought. I've never disclosed this. It was too raw back in 22. I even quit my other job as a director of a medtech institute, fearing repercussions on the university. President, today I'd like to thank that politician, because those standover tactics, along with the policy drift of the then government, drove me into the arms of the Labor Party. And the rest, as they say, is history. As the first Labor member for Higgins in the seat's 75-year history, I respected its gravitas as a seat of leaders, including 4 former Liberal Prime Ministers, Holt, Gorton, Menzies and Fraser, who lived there. and of course Australia's longest serving Treasurer. I showed up and advocated as best I could during an inflationary crisis, cost of living squeeze, and highly volatile period for my large Jewish community. I brought the same care and intensity I had for my patients to my constituents. But this community gave me so much more. People with skills, expertise, and a moral ambition for this nation down every street I door-knocked. The abolition of Higgins in 2024 then was as cold as a surgeon's knife. It was devastating. I grieved for what I had left behind in medicine and for what I had wanted to achieve. However, not one to ruminate, I crisscrossed Victoria as a member of the Health Committee, determined to stay present. At 6.5 million and counting, Victoria needs infrastructure and services. The regions need doctors like oxygen. The long-acting contraception we funded will stop women in border communities near South Australia from travelling long distances to Warrnambool for surgical abortions. Quality aged care in Leongatha and Ararat make hospital a place of last resort for confused elderly. Violet Town's aged care workforce is overwhelmingly of South Asian ancestry, like me, underscoring the vital importance migrants play, especially in the regions. Stoic farmers submit to health checks in the sale yards run by Yea Hospital. Drug addiction is dragged out of the shadows by a rehab centre in Molyula amidst rolling hills and birdsong. The outstanding Southwest TAFE in Warrnambool would like a bus so that mums need not drive their kids in pre-dawn darkness on country roads to get to class. Sandy Creek will get new netball courts thanks to our sports funding. In Victoria's burgeoning South Asian community of nearly 500,000, I was welcomed as the first Tamil Member of Parliament, even though I'm pretty watered down. Growing up, I was unsure whether I belonged or whether I was pretending. At some point, I laid down roots, but the nation changed around me. Suddenly, fitting in did not mean shedding your culture like a coat. To paraphrase the Foreign Minister, our cultural diversity is an element of our national power, which, in combination with our stable democracy, natural resources, and skilled capability, is this middle power's superpower. But, President, who says lightning can't strike twice? To be here now as a senator for Victoria, a position that Labor has not held in nearly 20 years, is testament to the trust Victorians put in Labor, the Prime Minister's extraordinary work ethic, this Labor government which did the work, our living treasures, the Labor rank and file, and Vic Labor, who backed my Senate run. Only 56 parliamentarians, including myself, have served in both houses since Federation. Only one senator has gone on to become Prime Minister. John Gorton in 1968, following the death of Prime Minister Harold Holt. Both were my predecessors as members for Higgins. I can assure you that history will not repeat, but it does rhyme. There are a few people to thank. I will be forever indebted to Paul Erickson, Jet Fogarty and Josh Pollack. As mentors, you guided me to Higgins and then here. These were unwinnable seats until they weren't, thanks to your cool heads. You are Labor's rainmakers. The Deputy Prime Minister and Member for Hawke are my mentors and therapists on speed dial, who have been there every step of the way, even when Higgins was a mere twinkle in our eyes. Toughest for me was that prolonged period of uncertainty, and you, along with the Chief Government Whip, steadied the ship. I could not be here without my trusted staff and my backers in Higgins who believed in Project Michelle. Thank you. My family are relieved that I am back to work. It's true. As a FIFO worker, my husband and daughter keep the home fires burning. Annika was absent during my first speech in 22 due to Year 12. This time it's Ash's turn. It's a Gen Z house filled with laughter, K-pop, piercing bagpipe practice, cooking safaris, and too much dog hair. Clean it up, guys. Clean it up. I am proud of the capable, resilient, and good-humoured people you have become. My parents, Robert and Vimala, are my biggest fans. They trod the familiar migrant path of self-determination when Labor luminaries Hawke and Keating were terraforming a modern Australia. As Tamils, they left Sri Lanka in the 60s for the UK, where I was born. They then forged a life in Zambia for 10 years before choosing Australia over Canada. Good call. Good call. They instilled in me a steely determination not to succeed, but rather to get up, dust yourself off, and keep going. And I can assure you there was no tiara in our house. My sister, Romaine, is my closest confidant, and like my brother, Steve keeps the wheels on and turning. President, my vision of the future 40 years from now is not rose-coloured, but neither is it dystopian. In fact, far from it. It is a legacy that will be written on the faces of Australians as either the furrowed brow of worry, the set jaw of resolve, or the squeals of delight in our grandkids. Which face greets us in our old age depends on whether we find middle ground in this place. That middle ground, it turns out, is where most Australians are, and likely to remain. It also means making tough decisions and explaining rather than weaponising the trade-offs. Or else, what is our problem today will be an even bigger one for our counterparts tomorrow. If politics is the art of what's possible, then as a hardcore pragmatist, I will take the possible over the perfect any day. I thank the House.
Thank you, Senators. We will now go back to the urgency motion from Senator Hanson. And I believe, Senator Waters, you're next. You have the call.
Yes, thanks, Acting Deputy President. Well, naturally I rise to oppose this motion. The Nationals and One Nation are now competing to see who gets to drive the clown car of climate denial. And they're railing against net zero by 2050, 25 years away, when the actual scientists are saying we need to get to net zero in 10 years' time, not in 25 years' time, in order to have a safe climate future. Ordinary people who are experiencing the droughts, the fires, the floods, their house insurance skyrocketing, those people see the link between climate action and the natural disasters that are driving up the cost of living and wrecking nature. And every day that we don't act to reduce climate pollution, the more it will cost us and the harder it will be to make that transition that we need for a safe climate future. The cheapest and the most effective time to act is now. And most farmers know that. Farmers are on the front line of the climate crisis. They're already the first and the hardest hit, along with the fishing industry and the insurance industry and anyone who works outside in the punishing heat. Government agency ABARES has already calculated that farmers have lost a ton of money from climate. ABARES says that in the last 25 years, average broadacre farm profits are down 22%. Now, those losses have been worst in the cropping sector, reducing average profits by 35% or $71,000 for a typical cropping farm. But the Nationals and One Nation's climate denial would see farmers lose even more money, while coal and gas companies will laugh all the way to the bank. The Liberals are having a policy review. They don't even know what they think, but you can be damn sure that they'll back coal and gas. And Labor keeps on approving new coal and gas, which undermines their important investment in renewables. Emissions are not coming down in Australia. 10 years of denial from a coalition government and 3 years of Labor approving or extending new coal and gas, including approving Woodside's dirty gas project all the way out to 2070 as their first action after their re-election. They can't even bring themselves to admit that the marine heatwave and the upstream inundation is driving the algal bloom in South Australia is climate-driven. It's going to be households, nature, farmers and industry that pay the price for continued climate inaction. And soon we'll have to set our 2035 targets. The science says to keep below 2 degrees, to have that safe climate future, we need net zero emissions by 2035. Australia still is the world's second biggest fossil fuel exporter. We've got to do our fair share to limit global warming to under 2 degrees.
Senator Stacey.
Australia is beginning to recognise the folly of net zero. Pauline Hanson, One Nation, continues to provide leadership on this issue. We have championed this cause and we continue to be a voice for working Australians. The government has given us weasel words and hides behind opaque language. An example of this was made by the Treasurer at the National Press Club recently when he said, "The global net zero transition will also reshape our revenue from resources." While he declined to say so, we can only assume that the global net zero transition means the elimination of fossil fuels. And we can only assume that by resources he means Australian coal and liquefied natural gas. In terms of his reference to revenue, the Treasurer means $160 billion of income generated by Australian coal and liquid natural gas exports. Coal and LNG royalties for both state and federal governments amounted to about $28 billion in the financial year to 30 June 2024. This revenue is fundamental to the health of our economy and fundamental to Australian wealth. It represents jobs and a huge source of tax revenue for the government. This revenue would stop dead should we transition to a future without fossil fuels. This would wreck our economy, cost jobs and increase the cost of living for Australians. While the Treasurer has suggested this is a mere reshaping, this is a deliberate effort to disguise what would amount to a wrecking ball being taken to the Australian economy. If the Treasurer had wanted to be honest and straightforward with his true intentions, instead of saying the global net zero transition will also reshape our revenue from resources, he would instead have said something along the lines of, Australia will eliminate fossil fuels and will no longer export coal and gas. This will wreak complete havoc on our economy, add to the queues of the unemployed, and increase the cost of living for all Australians. This kind of plain speak would have exposed the net zero agenda for what it is, an economic catastrophe for Australia for ideological reasons. The continued pursuit of net zero will inevitably mean that taxes will be raised and services will be cut. Energy is the essential resource, as everything else in our economy depends on it. Its price and availability impact the price and availability of literally everything else. There is also an uncontroversial link between productivity and cheap, abundant power that the government appears unwilling to acknowledge. The demand for affordable energy has never been higher. In 2024, the world burned more coal, oil and gas than in any previous year, surpassing all previous records. 82% of the world's total primary energy demand is met by fossil fuels. Wind and solar are not feasible replacements for this demand and merely work as an add-on to fossil fuel-generated baseload power. These numbers demonstrate that there is no true global net zero transition and no evolution away from fossil fuel. Trillions of dollars have been wasted in the quest for net zero, and this policy is a complete failure. One Nation has been the thought leader on this issue and maintains that it will not be long before people in this place must stop pretending that net zero is achievable. Net zero represents a deliberate act of self-harm. Its only reality is a net zero benefit to the planet.
Senator Walker.
Thank you, Chair, and I note that this is not my first speech. Well, all I can say is, are you kidding? I speak not only for myself, but as an advocate for younger Australians who are facing an uncertain future. The motion put forward by Senator Hanson to scrap net zero indicates a severe lack of knowledge and a complete disregard for the future of our generation, the future of our country. Without a net zero target, there will be no Australian farmers, businesses or industries to support us. Net zero is waking up to a reality that Senator Hanson has not been able to grasp. In fact, Senator Hanson seems to be hell-bent on exacerbating all of the consequences of climate change we have been warned about, all of the consequences that we are already seeing. Climate change is impacting our environment now. I come from a farming community. I studied agriculture in high school. No sector should be more concerned about climate change than our agricultural industries. And no communities should be more concerned than our regional communities. Climate change is affecting our farmers and their livelihoods now. In my home state of South Australia, we are seeing a once virtually pristine beach being ravaged by an algal bloom, with over 400 different types of species dying and being washed up on our beaches. And we are holding our breath, hoping that the current cooler weather will help cool the ocean and break up the bloom, which is threatening our thriving aquaculture. And this bloom is the product of sea temperatures that have been about 2.5 degrees warmer than usual. This is one of the many unprecedented and extreme weather events that are directly attributable to global warming, and it is happening on land too. Just last week, Need for Feed Australia sent truckloads of bales of hay to South Australian farmers who are experiencing severe drought conditions, whilst in the eastern states we are seeing farmlands ravaged by extreme floods. Again, extreme weather events that are a direct consequence of global warming. And net zero is agreed by scientists over the world as essential to combat this threat. But our net zero target is also an economic driver. We aren't trading off, as Senator Hanson seems to believe. Renewables are the path to cheaper and more reliable power generation. We are absolutely committed to reach 82% renewable energy by 2030. We are investing in renewables in ways that also provide real economic benefits and cost of living relief. And Senator Hanson is clearly out of touch with Australians who are taking up renewables with gusto because they want to both cut emissions and cut their power bills. 1 in 3 Australian households now have solar panels on their property. And due to our cheaper home battery scheme, we expect to have 1 million new batteries in Australian homes by 2030. Clean energy is undeniably an economic driver too, with global investment of $2.2 trillion just this year in clean energy worldwide, double the amount going to fossil fuels. In China, clean energy now drives 20% of GDP growth. Clean energy is about economic competitiveness. However, our future without renewables is much more economically precarious. Australians are currently paying the price for an energy system built on unreliable, ageing energy infrastructure. These old power sources are way too financially exposed to the forever unpredictable global fossil fuel market, meaning Australian consumers are way too exposed to power cost hikes. And I'm deeply disappointed that the Coalition has decided to be led by one nation on an issue as important as this one. Imagine not being able to grasp that our target for net zero emissions will positively impact Australian families, farmers and businesses. Net zero is about ensuring future agricultural viability. It's about economic competitiveness. It's about social justice. It's a social justice issue, and it's about intergenerational climate justice. I don't apologise for caring about these things, and that's the position of the vast majority of my generation. We are not fooled by the talk of expensive nuclear energy plants being built on a never-never time frame, with technology that isn't even fully developed yet.
Order. Senator Walker, your time has expired. Senator Scarr.
Thank you, Acting Deputy President. And I should note, just in relation to nuclear power, that we're the only OECD country in the world that doesn't have nuclear power for energy production. The Coalition, Mr Acting Deputy President, is following its own processes. It's following its own processes with respect to the review of its policies relating to energy and emissions reduction policy. And the Coalition will not be diverted from that process by Senator Ayres or anyone else in this chamber or outside of the Coalition. It is absolutely crucial that the Coalition following the last election engage in a considered and thoughtful review of all of the policies which it took to the last election, including policies relating to energy and emissions reduction. And the Coalition has been absolutely transparent with the Australian people that we are going through that policy review process, and that also is fit and proper. Can I say, Mr Acting Deputy President, with respect to that review process, that the Coalition has set up a working group reporting directly to the Leader of the Opposition and the Leader of the Nationals. And I'm very, very pleased that my colleague in the other place, Dan Tehan MP, has the carriage of that process, assisting Mr Tehan in relation to that process is a combination, a committee comprising a combination of members of the Coalition, including the Shadow Treasurer Ted O'Brien, Senator Susan McDonald in relation to resources, Alex Hawke MP in relation to industry, Angie Bell in relation to environmental matters, and Shadow Assistant Ministers Senator Dean Smith and my good friend and colleague Andrew Wilcox MP from Queensland. So the Coalition will not be diverted or distracted from that policy review process. That policy review process provides an opportunity for every single Coalition senator and every single Coalition MP to have their say and for their say to be considered as part of that policy review process as the Coalition settles its suite of policies to take to the next election.
Order. Every senator through this debate has been listened to in silence, and I expect that will continue as we listen to you, Senator Roberts.
Thank you. To get to what matters most in this debate over net zero, we just have to ask Australians some simple questions. Is your life more affordable or more expensive over the last 5 years? Are you paying more or less for groceries? Is your power bill cheaper? How about the cost of a new car? How about your insurance premiums? Has your salary increased more than inflation? The answers are almost the same. It hasn't gotten better, it's far worse. All of these problems Australia is suffering from can be traced back directly to net zero policies. So this isn't just a culture war, as some people try to write it off as. This is a fight for the survival and prosperity of all Australians. This is a fight to restore our country's position as the envy of the world. Australia is the richest country in the world for resources. We have abundant energy resources. Australia is awash with vast amounts of proven coal, oil, natural gas, uranium, rare earths and critical minerals. We should have the cheapest power prices in the world. Yet we pay more for electricity than the countries to which we sell our resources to. Back in 2004, the Energy White Paper proudly boasted Australia's average price for electricity at just a touch over 4 cents a kilowatt hour, amongst the cheapest in the world. Now the average is 33 cents a kilowatt hour in just 20 years. Japan imports most of its energy resources from Australia. Japan's electricity used to be 4 times more expensive than Australia. Now we're 20% more expensive than Japan. All because of net zero. Thank you so much. We don't make Fords or Holdens or Toyotas or Mitsubishis in this country anymore because of net zero. Our steel mills like Whyalla are going broke because of net zero. The copper smelters like Mount Isa are shutting down because of net zero. Chocolate maker Cadbury has said they may have to pull out of Australia because it has become undeniably expensive to manufacture in Australia. In the words of Matt Barry, Australia is about to be a country that cannot make a chocolate bar because of net zero. Wind and solar pushers have been promising Australia it's the cheapest way to go. They've been saying it for 25 years, since the Renewable Energy Electricity Act implemented in the year 2000 under John Howard. Yet here we are today, facing desolation, with the largest amount of wind, solar, batteries, pumped hydro on the grid than ever in recorded history. Life has only gotten more expensive. As the solar and wind and batteries and pumped hydro increase, electricity costs increase. This is the experience of every country that has gone down the path of net zero. Every country that has gone down the path of net zero. As electricity gets more expensive, good jobs in making things in manufacturing are getting shipped overseas, and life gets worse for that country.
Thank you. The question is that the motion, urgency motion moved by Senator Hanson be agreed to. All those of that opinion say aye. Aye. Those against say no. No. I believe the noes have it. Division required. Ring the bells for 4 minutes. Lock the doors. The question is, order. The question is that the urgency motion moved by Senator Hanson be agreed to. Those of that opinion will move to the right of the chair and those against to the left of the chair. And I appoint Senator Roberts as teller for the ayes and Senator Sheldon as teller for the noes. Order. The result of the division is ayes 7, noes 39. The question is therefore resolved in the negative. All right, Senators, we will move on to the next item of business. Order. Senators, we need to move on. I'll ask, if you're not participating in this debate, to please leave the chamber quietly. Quietly. Senator Watt, please. Senators, I have asked you to leave quietly. Please do so I can continue with the order of business. The Senate will now consider the proposal from Senator Canavan, which is also shown at item 14 on today's order of business. Is consideration of the proposal supported? Indeed it is. With the concurrence of the Senate, the clerks will set the clock in line with the informal arrangements made by the whips, and I call Senator Canavan.
Well, thank you very much, Mr Acting Deputy President. While there is not much more important topic for Australia's agricultural industry, and indeed all Australians, than the biosecurity settings of our country. We are very lucky to have the cleanest, greenest, safest food supply system in the world. Not only is that, of course, important for Australians, who of course get to eat that beautiful food, it underpins the economic strength of our agricultural industry, because we do export something like 60% of our farm produce overseas. And so it's absolutely integral that we maintain that safe system, those strong biosecurity settings, to keep those markets open in overseas countries. And so it has been a bit of a shock over the past week to hear the government announce that it would be changing those biosecurity settings, and some are concerned potentially weakening those biosecurity settings when it announced that it would allow US beef to have greater access into the market. The fundamental problem here is that the government hasn't been able to answer basic questions about on what basis this decision has been made, and on exactly what terms US beef will be allowed in. I do and will recognise that since 2019 we have allowed American beef into Australia. It has been permitted. I don't believe there's been much, or if any, beef imported from America, but it's been done so. It was approved under the former government under the strictest conditions. In particular, there had to be traceability on US beef to ensure that in the box that may have had an American flag on it, there was no beef coming from Mexico or other parts of the Americas where there is and may be diseases like mad cow disease, which would be devastating if it ever came to these shores. The Americans generally struggle to provide that level of traceability. They don't have the same systems, the same supply chain assurance systems we have in this country. In this country, every calf that's marked gets a little tag in its ear. It's called the NDIS tag, and it will make sure that every time that cow is moved or bull is moved through its life, it's recorded where it's come from, where it goes, and therefore we can tell the customer, the final customer, wherever they may be, exactly where the beef in that box has been raised, has come from, and ensure them that there's no disease in those areas. That system does not apply to anything like that extent in the United States. Not unusual it doesn't, because the US beef industry largely serves its own domestic market. It doesn't seek to have these supply chain assurance systems in place like we do to open up our overseas markets. Now the key thing is here, it would seem like the government is not insisting that the same traceability requirements we have and impose on our beef sector should apply to the US beef sector. As I say, the details still remain somewhat murky about this, but I do have concerns if we don't impose, or we are going to impose, more stringent and strict requirements on our own beef sector than would be applied to a competitor in another country. I mean, surely we should be able to say and tell the Australian people that we will seek to apply the same standards to our businesses as imported products have to apply with in terms of safety requirements on others, because otherwise they'd have a natural advantage, and the American producers would have a natural economic advantage because of our policy settings, and that would be very inequitable to Australian beef producers. This issue has not been helped, though, by the government's confused messaging here. There's obviously a very political element to this, because it is wrapped up with demands from President Trump to open our access to beef, demands from President Trump to do other things in our policy settings, and so it was always going to be viewed with a degree of cynicism, this change, and the government has been left completely flat-footed and unprepared for basic questions. In fact, we've seen the spectacle on the weekend of the Trade Minister saying one thing about a phone call in 1 hour and the next hour saying something else completely different. And so it's absolutely legitimate for the Australian agricultural sector to want answers to questions on this issue. That's why we have moved this motion today. That's why we're pursuing this through other means, through the Senate, because the Australian farm industry deserve to know exactly on what basis this decision has been made. They deserve to know the protections are in place for their industry. And even more importantly, Australians as a whole deserve to know those protections are in, because some of these diseases can affect human health as well. It is a very serious matter, and the government should take it much more seriously than they have.
Senator Sterle, you have the call.
Thank you, Madam Acting Deputy President, and thank you for covering for me so I can make my contribution. And I rise to speak on the matter of public importance moved by Senator Canavan relating to beef imports, and I take everything on board that Senator Canavan has shared with the Senate, and I'll probably touch on a couple as well as we go through. But I wish to make this abundantly clear, and I say this as someone who has been on the Rural Regional Affairs and Transport Committee for 20 years, who has chaired the Rural Regional Affairs and Transport Committee for 18. The Albanese government, as has every previous government in history, made a massive effort in our biosecurity region. So, you know, we've got to get this right. No government is going to do anything that could undermine our biosecurity. Now, I do note that, you know, with Senator Canavan talking about what's happened before and previously about biosecurity, but let's not forget we were left with a biosecurity system in an unfunded mess in the last 2 years, a few terms of your government. Let's not forget that. Yet the Liberals and the Nationals did absolutely nothing to make importers pay their fair share for over a decade. And the facts are, while Senator Canavan's motion will stir up a fair bit of conversation, I have no doubt about that, I'd like to inform those listening and just remind them, and which Senator Canavan did say, that we have imported beef from the United States. And we've been doing it since 2019. And yes, we have been doing it with those strict protocols. There is absolutely no doubt about that. But the same departmental officials that assessed that way back then, when the coalition was in charge of it, are the same ones now. And the US Beef Imports Review has undergone a rigorous science and risk-based assessment over the past decade. The decision by the Department of Agriculture, Fisheries and Forestry was taken by the department's independent scientists in the same way as all other technical market access requests. Now, Australia is a trading nation with 1 in 4 jobs relying on trade, and our cattle industry has significantly benefited from this. Aussie beef has had back-to-back record-breaking export years, last year worth $14 billion. Supported by reinstated and improved market access, exports have increased 55% since we came to government, including to our largest market in the US and the second largest in China. Now, as the Agriculture Minister and other senior members of the government, including the Prime Minister, have continued to say, and as I'd said earlier, we will not compromise on biosecurity, and our enviable biosecurity status is not up for negotiation. Any suggestion from those opposite to the contrary are incorrect, given the severely underfunded biosecurity system we inherited, as I said before. The US was granted beef access in 2019 and requested expanded access in 2020, well before the current US administration. So 5 years ago, these conversations started. Australia has been engaging with them on this matter since then, including, as I'm well informed, the previous coalition government to progress the issue. Under international rules, Australia responds to market access requests from our trading partners in line with our World Trade Organisation obligations, just as our trading partners respond to Australia's market access requests. And while the opposition certainly stirring up a bit of a scare campaign around biosecurity, risk to Australia, I say again, and I don't know how many times I have to say it, Australia does not trade off our strong biosecurity system, science-based risk assessments, import policies or biosecurity requirements. The US Beef Imports Review has undergone a rigorous science and risk-based assessment over that past decade. I'm ably informed by the Minister we have also been engaged with industry and have made sure that they are consulted all the way along. Officials regularly and extensively engaged key industry stakeholders such as Cattle Australia, the Australian Meat Industry Council and the Red Meat Advisory Council over many years. In fact, Mr Will Evans, CEO of Cattle Australia, told ABC Radio National recently that the department had undertaken a technical scientific assessment. And to quote Mr Evans, he said, "We have to put faith in them." He also said, "We are a global advocate for rules and science-based trading." And he also said, "We have to recognise that science has been used here to make this decision." Mr Evans also said that the US was an important trading partner and Australia needed to maintain the relationship with them. Engagement with industry started in 2017 with an initial review for beef and beef products from Japan and the Netherlands, New Zealand, the United States and Vanuatu.
Senator Whish-Wilson.
I agree with Senator Canavan on one thing, and that is biosecurity is important. In fact, at the beginning of the last parliament, we were at almost a Groundhog Day situation as we are today, with the Nats putting up an inquiry into biosecurity, which the Greens were cooperated with the crossbench and with the government. We looked into foot and mouth disease, and then we had a very constructive inquiry into imported red fire ant program and incursion, as well as into varroa mite. So this is something that the Parliament does take very seriously and the Greens take very seriously. On this particular issue, last week when this broke, I did speak to the Labor Party and I spoke to the Minister and suggested that we immediately organise a briefing for the Rural and Regional Affairs Committee and any senators who'd like to attend that, and have a private session with the department, a question and answer session, and then see how we felt after that. And I understand that that issue is in train now. Now, where Senator Canavan and I don't agree is that I think there's a very important issue facing farmers that the National Party and the Liberal Party don't want to talk about, and that's climate change. There is no bigger threat to the farming community, to our agricultural communities, than climate change and the risks from climate change. Prolonged, more frequent, much more destructive droughts, as we're seeing, heat waves, floods, pestilence. I could go on. Our entire food system is at risk from climate change if we don't take climate action. So if you want to talk about the risks to farmers, yes, biosecurity is a risk, but take climate change seriously. And this nonsense around trying to get rid of net zero, I mean, what could be more important for our farming community than all of us reducing our emissions and trying to keep global warming to 1.5 to 2 degrees, where we know following that we're going to be facing an increasingly dangerous situation with climate change. So while we're talking about biosecurity, on one hand, it's a good distraction from Mr Barnaby Joyce's Nationals push to get rid of net zero in this country, which I can just tell from the vote in the chamber is certainly supported by Senator Canavan and some in the Liberal Party. I mean, seriously, you talk about representing farmers, you talk about steers, you talk about bulls. Well, let's talk about the bullshit in this argument that the National Party have been executing for the last 15 years since I've been in this place, undermining climate action, undermining what we need to do to face the great challenges of our time, and putting farming communities and agricultural communities at risk. That's what they're doing, and they need to be called out. And I'd like to see the farming and peak agricultural bodies come out and call out this bullshit as well, because I've had enough of it, and a lot of other Australians have had enough of it.
Senator Whish-Wilson, thank you. Senator Whish-Wilson, and I know you're passionate about that. Senator Whish-Wilson, I've worked with you closely many, many years, so you really are fired up, but I would ask that you retract that one word that was mentioned twice, please.
Acting Deputy President, that one word that farmers love to use, but I retract it. Yeah.
Thank you, Senator Whish-Wilson. Senator O'Sullivan.
Thank you very much, Acting Deputy President. Firstly, I want to thank my colleague, Senator Canavan, for raising this important topic for debate. As we all know, maintaining strong biosecurity is absolutely critical for protecting our Australian farmers and agricultural sector. Biosecurity cannot be taken too seriously. Some of us here would remember the first few weeks of this Labor government and the major concerns with foot and mouth disease outbreak we had to manage quickly in the last term of Parliament. The Australian beef industry also had to respond quickly because it's not us here in this place that suffer. Indeed, it's the cattle stations and farmers across Australia that suffer when outbreaks occur. Yet with this latest decision, the Australian beef industry was blinded by its own government when the announcement made by the announcement last week. There was no consultation, but that's of course common theme with this government, as we saw in the last term, and unfortunately we're already seeing it happen here, and we're only a week into it. In fact, the government themselves cannot even get their story right with this deal. It's been well reported that the Trade Minister publicly stated this issue had been directly raised with the US President in a phone call to our Prime Minister. If only there was a phone call that occurred between the Prime Minister of this country and the President of the United States, but it wasn't true, and an hour later he had to retract it. This only creates confusion and requires us to ask important questions to ensure the PM isn't throwing the beef industry overboard in order to finally secure that phone call or a meeting with the President. Now let me be clear, the United States is one of our most important allies, if not the most important ally. They are our strategic partner in AUKUS, a vital trade partner and a friend in an increasingly uncertain world. But even in a strong partnership, we must stand up for our own national interests. We must protect our beef industry, our world-class biosecurity standards and indeed the livelihood of our precious farmers. Being a reliable ally doesn't mean being a pushover in the hopes of a handshake in Washington. Now, once again, Labor is making decisions that will hurt Australian agriculture, exactly like their reckless live sheep export ban, which is impacting my home state, the farmers in my home state of Western Australia. And they're abandoning hard-working farmers and regional communities without a credible plan for the future. Labor's contradictions are mixed messages, and they risk undermining not just our beef industry but also our credibility with international partners. We cannot afford to look this disorganised on the world stage, especially when our own farmers are asking why we'd import something they never asked for. Now listen to this. I think on these debates you should always listen to those that are at the very front line. And Black Angus Australian beef producer Robert McKenzie said on ABC Radio National, all it is just playing into the hand of the US and bending over and giving up and not looking after our biosecurity. Our appetite for US beef isn't there. We exported last year 1.3 million tonne of beef back to the US, so why would we want to import US beef that potentially is still, well, we don't know whether it's going to be US beef. We don't know whether it's going to be Canadian beef. We don't know whether it's going to be Mexican beef. Why would we take that risk, bring it into Australia when clearly we don't want it? Well, these concerns are the concerns of Australian farmers, and we need to listen to and understand exactly why this is happening, and this is why we're pushing for a review into this decision. It may be sound, but let's get to the bottom of it. The government must give the Australian beef industry and our farmers the confidence that there is a plan in place to manage any emerging biosecurity risks with this new deal. We simply cannot rely on US biosecurity measures. We must be proactive and protect our industry and our farmers as a priority. The greatest risk is rushing this deal and not ensuring that we have the appropriate biosecurity protections in place. So we're calling for an independent review into this decision to ensure that we're getting it right by the Australian beef farmers. It's not a big ask. Irrespective of country of origin, it will end up being the Australian consumer who will dictate what they purchase. Australian beef or beef from the United States. Well, we all know that it's important to get this right. simple inquiry into this would be absolutely a sensible and essential thing to do.
Thank you, Senator O'Sullivan. Senator Whitten.
Thank you, Acting Deputy. President, this is not my first speech. In response to the Minister representing the Minister for Agriculture, Fisheries and Forestry's lack of response, I've got nothing. Zero. The inside of a donut. I asked why the government is targeting the beef and sheep industries. No response. I asked which agricultural industry would be targeted next. Nothing. I asked will the imported beef from somewhere be labelled correctly. Still nothing. So when a farmer asks me about this, my response will have to be, no one knows. What a sad state of affairs. It is of the utmost importance to understand the reason for the ban on the import of beef from the USA was put in place, because they cannot trace back to the farm any beef originating in Canada, which has mad cow disease, or Mexico, which has foot and mouth disease. The ban is absolutely essential for our biosecurity. Here's what we do know. Foot and mouth disease could be an $80 billion hit to our agricultural industry. BSE, or mad cow disease, could harm Australians. And here's the quiet part out loud. It seems the Prime Minister is happy to sacrifice Australia's biosecurity to get a meeting with the President of the United States.
Senator Mahon.
Thank you, Acting Deputy President. I rise to speak on this matter of public importance moved by Senator Canavan. As a senator from Queensland, I am proud to speak about our mighty beef industry. My home state of Queensland has the largest beef sector of any state by some distance, accounting for about half of the national cattle herd. Biosecurity matters to all of us. The whole world knows just how good Australian beef is. The beef sector supports businesses and good jobs right across our region and throughout the entire supply chain, like JBS, located near Rockhampton, which Senator Chisholm and I recently visited. That's why it is so important that the government makes decisions on this sector based on facts. Allow me to share some of those facts with the Chamber this evening. Fact number 1. Beef from the United States has been able to be imported into Australia since 2019, when the Coalition was last in government, and might I add, when the mover of this MPI was a Cabinet Minister. Fact number 2, the US Beef Imports Review has undergone a rigorous, decade-long science and risk-based assessment, including when those opposite were in government. When those opposite were in government. Let that sink in a bit. Fact number 3, the decision by the Department of Agriculture, Fisheries and Forestries was taken by the department's independent scientists in the same way that all other technical assessments, market requests are made. There's nothing new here. And fact number 4, the Coalition left Australia's biosecurity system in an unfunded mess when they were last in government. Under this government, Aussie beef has had back-to-back record-breaking export years. Last year, our beef exports were worth $14 billion. Supported by reinstated and improved market access, exports have increased by 55% since we came to government, backed in by our work to reinstate and improve market access, including in the US and China. And as the Agriculture Minister and the Prime Minister have both said, we will never, ever compromise on biosecurity. Those are the facts. But does anyone think those opposite have bothered to learn them? Well, Shadow Minister for Trade, Investment and Tourism was asked on ABC's afternoon briefing whether he had read the department's report on the US beef review. Patricia Karvelas asked the Shadow Minister, they've published their report, have you read it? The Shadow Minister said, there was a draft report they released a little while ago. Patricia Karvelas said, so today we have access to that, referring to the final report. I've looked through it, have you? To which the Shadow Minister responded, I haven't read it. No. The Coalition have been calling for a review into a report that they have not even bothered to read. Let that one sink in for a bit. Perhaps they would listen to some prominent voices in the beef sector, which this government has been engaged with throughout this process. Take that of Will Evans, the Chief Executive from Cattle Australia. He said, "The reality is that science has been used to make a technical assessment, and that's where we are today." Or Michael Crowley, from Managing Director at Meat and Livestock Australia. He said, "Australia maintains one of the strictest biosecurity regimes in the world to protect our livestock industries, environment and food safety. The finalised federal government health certification and import permit conditions reflect stringent safeguards to prevent the introduction of exotic diseases and uphold the integrity of Australia's biosecurity system." End quote. So this really says it all about those opposite. They are all about the politics and not about the facts. This government will continue to listen to the science, invest in biosecurity and back our Aussie farmers.
Thank you, Senator Mulholland. Senator McDonald.
Thank you very much, Acting Deputy President. I'm disappointed that the tone of the debate on this important matter of public importance has descended to political talking points provided by the Minister's office that really don't reflect the reality of what has happened in the last week. We all, of course, agree that biosecurity is very important. We agree that the beef industry is very important. But what we can't obviously agree on is the importance of transparency. I was absolutely shocked last week to see that a long-held decision to protect Australia's beef industry and biosecurity measures in that regard were being upended. It is true that the US has been able to send meat to the Australian shores, to the Australian market, since 2019, based on their change to be able to provide traceability of their animals from birth through grazing and processing through to Australia. This is an important point. This is the point that Australian farmers, Australian livestock agents, Australian feedlots and finally Australian processors have to comply with. What has changed is that we are now looking at a break in that transparency of traceability for stock. So it could be coming from Canada, it could be coming from Mexico, it could be coming from another further South American country. Until we have satisfaction that that supply chain is clear and transparent, we owe it to the Australian beef industry to be able to demonstrate that. All that we are asking is that last week the beef industry was told on a Wednesday afternoon that they would receive a briefing. On Thursday morning, they received the review report at the same time as the statement went out. Now, the initial statement from the department said that applicants could still apply for an import permit. Not what the government then said, which was that the borders were open, that we could import beef that had come through the US processing system. So it is extraordinary. What the department is saying and what the government is saying is two quite different things. That is all that we're asking, is that we should respect the people who would be most impacted by this decision. One, of course, is the Australian beef producers, the graziers across Australia. But what about the beef processors? Beef processing is the largest employer in regional Australia. It's the last great manufacturing industry that we have in agriculture. Those men and women work right across the country. They deserve an answer to this question. And of course, Australian consumers deserve an answer. I mean, at the same time as this announcement was made, there was an outbreak of flesh-eating disease in Mexico. I'm just asking that we have an ability to stop, to pause, to not trade off our industry's agreements based on trying to get a meeting with the American president, and just say, are we all truly satisfied that we do maintain the same sort of protections that the Australian sector has to maintain? Are we going to truly protect our borders? mean, we heard a lot of rhetoric from the Labor members about, what they were left with and what's happened. Well, in the 3 years that they have been the government, we have seen no pull-up on the movement of fire ants. We have seen the further expansion of varroa mites, which will mean the very real risk of lack of pollination for crops this year, as well as native flora. These are very serious issues. I don't have confidence that once we have disease in this country, that we do have the capacity to stop it. In the 1970s, I lived through the great shooting of stock to manage tuberculosis and brucellosis in the far north of this country. But we no longer have the frontline resources of the Lands Department and those people on the ground. So I think that this deserves transparency, and I think this is an important matter.
Time has expired. The time for discussion has now expired, and I shall now proceed to the consideration of documents. The documents are listed on page 4 of today's order of business. Are there any speakers? Oh, this is going to go flying through. Right, okay. If there are none, I shall move to item 17. Are there any ministerial statements, Minister?
I table documents relating to orders for the production of documents concerning online gambling, the draft 2025 Electricity Network Options Report, First Home Buyers and the Housing Australia Future Fund.
Are there any speakers? No speakers? Right, beauty. Committee memberships. Thank you. Minister.
The President has received letters requesting... I seek leave to move... the President's got to do his part first.
No, I'm asking committee membership. Oh, sorry, yes. Oh, we are rusty, aren't we? The President has received letters requesting changes in the membership of committees. Minister.
I seek leave to move a motion to vary the membership of committees.
Leave granted. Leave's granted. Minister.
I move that senators be appointed to committees as set out in the document available in the chamber and listed on the dynamic reg.
Thank you very much. Okay, I'll put that question then. Those of that opinion say aye. Against no. The ayes have it. This is getting even better. Thanks, Rachel. Clerk.
Business of the Senate. Notices of motion number 2, standing in the name of Senator Roberts, for the disallowance of the Industry, Research and Development, Dealership and Repairer Initiative for Vehicle Electrification Nationally Program, Instrument 2024.
Senator Roberts.
Thank you, Mr Acting Deputy President. What's the time on the clock? 15, thank you.
15 minutes.
Thank you. I move to disallow the Industry, Research and Development, Dealership and Repairer Initiative for Vehicle Electrification Nationally Driven Program. What a mouthful. It's an instrument, I forgot to say, 2024, made under the Industry, Research and Development Act 1986. This is where the fun bit starts. This regulation One Nation seeks to revoke is a $60 million slush fund that Climate Change and Energy Minister Chris Bowen, there he is again, will have to splash around on pet projects. Specifically, this is $60 million for the installation and repair of electric vehicle chargers. These are electric vehicle chargers from which only some of the most well-off of Australians who can afford an EV will benefit. While rents are skyrocketing, houses are more unaffordable than ever, groceries keep getting more expensive and beer is heading towards $15 a pint, taxpayers should not be slugged with more taxes to pay for this government's slush fund. Why is the government obsessed with putting everyone into electric vehicles? Some of them have decent speed, admittedly, when you put your foot down. Yet the range on purely electric vehicles, battery electric vehicles, is mostly terrible. It gets even worse when trying to tow something. Forums for the F-150 Lightning Ford, a battery-powered ute, are full of horror stories that unfold as soon as the trailer is attached. This is worldwide. Australians already know all of this and are voting with their wallet. The rejection of battery EVs shows up in new car sales figures. Battery electric vehicles were just 6.5% of new car sales. And how long have they been offered? Years. Even here in capital Wokistan, Canberra, home of the country's loudest virtue signallers, battery electric vehicles are just 3.6% of all vehicles on the road. This is despite every effort of government and multinational corporations trying to pull Australians away from the trusty petrol and diesel engine. There's been a near decade of propaganda and lies trying to convince Australians to make the switch, not buying it. Never mind the hugely expensive tax breaks that give an EV buyer tens of thousands of dollars. These tax breaks include exemptions from the lower luxury car tax threshold, exemptions from the penalties under the new vehicle efficiency standard, or the ute tax as it's become known. No fuel excise at 50.8 cents a litre. Exemptions from fringe benefits tax, representing a $12,000 saving on a $60,000 EV, but costing taxpayers $550 million a year. Taxpayers pay for this. This is Robin Hood in reverse, robbing the poor to pay for the wealthy, plus an array of rebates from state governments across the country. They've thrown just about every tax break in the book at EVs, and still Australians aren't fussed over the inferior electric vehicle products. More than 95% of vehicles on the road still contain internal combustion engines, the trusty petrol and diesel, the reliable petrol and diesel, the safe petrol and diesel. Naturally aspirated, turbocharged, supercharged, or in a hybrid setup. Australians have rightly shunned battery EVs for engines that make a noise when turned on. Tradies cried out in horror when the legendary V8 from the Toyota Land Cruiser 200 series and utes was removed from market in anticipation of the coming government regulations and crackdowns. Now, are EVs cheaper to run? Well, a car expert road trip test throws real doubt on that. They drove 2 BMWs on a road trip from Melbourne to Sydney. The same exact car, same year of make, same start, same finish point. The only difference, one was battery electric version, the other hydrocarbon fueled. When they arrived in Sydney, the electric vehicle charging had cost more for the road trip than filling up with the most expensive 98 petrol. Of course, electricity isn't free, and neither are these charges. The Minister's slush fund we are seeking to disallow here is paying for the installation of charges that are businesses in themselves, so we're paying for a business. Taxpayers will foot the bill for installing a charger, and the EV business will reap all the profits from the charge they sell through it forever, for eternity. We would never do this with service stations because it's bloody ridiculous. Taxpayers should not be paying for the profits of these often foreign multinational companies who run charging services. And then the fire risk. Everyone knows about this. Then there's the electric vehicle industry's dirty little secret. The batteries and these chargers present an extreme fire risk. Car ferries carrying thousands of new car deliveries have been left to burn and potentially sink after battery fires have broken out in mid-ocean. Just last month, news.com reported, quote, "There are concerns an abandoned EV carrier floating aimlessly in the Pacific Ocean could continue to burn for weeks. Salvage operators have finally reached the Morning Midas, around 350 kilometres south of Adak, Alaska, a week after a first caught fire, and 22 crew were rescued by the US Coast Guard after being forced to abandon ship. The floating inferno is said to have been caused by the lithium-ion batteries in the 70 electric vehicles on board, batteries that can cause fires that can burn for weeks. Some apartment complexes, towers, have banned battery electric vehicles in their car parks. Our fire departments are sounding the alarm on the increased risk battery fires present. These battery fires often simply can't be put out and must be left for days to burn themselves out. Burn themselves out, left for days. One suggestion to deal with an electric vehicle fire is to have the burning wreck forklifted, imagine the forklift driver, into a waiting shipping container of water to try and keep it contained. That's a suggestion. Seriously, that's the best firefighting strategy we have when one of these EVs goes up. Insurance. Insurance companies have confirmed the risk in electric vehicles is real with their increased premiums. Insurance comparison site Compare the Market conducted a study of 12 insurers and has shown the top 5 best-selling EVs are 43% more expensive to insure than similar internal combustion models. So EVs are more expensive to buy, more expensive to drive, more expensive to charge, and more expensive to insure. We're running out of categories to find out where EVs are actually cheaper. What about environmentally friendly? Let's ask that question. As for being environmentally friendly, the process for making batteries is one of the most environmentally destructive in the world, killing the environment to save the planet. The hundreds of kilograms of minerals that go into the battery include aluminium, copper, steel, iron, graphite, nickel, lithium, manganese, cobalt. And these require extremely intensive mining and refinement and huge amounts of energy. Both resources and energy consumed in electric vehicle manufacturing is way above that consumed in making a petrol or diesel engine car. Many of these raw minerals are sourced from conflict-torn places like the Democratic Republic of Congo, using child labourers and slaves. The overall environmental impact of building an EV is devastating, as is the social impact. The raw materials are sourced from ethically questionable countries and processed almost exclusively by Chinese, communist China-controlled companies. That's where the focus on EVs leaves Australians, completely reliant on China. And then there's Minister Burke, Tony Burke, whose Chinese EV won't plug in the phone, says don't plug in the phone. Worries about being reliant on China aren't overblown. Government departments are warning Labor politicians of the same thing. The Strategist Journal reported in November that, quote, Senate estimates heard the remarkable revelation that Home Affairs Minister Tony Burke had to take precautions based on warnings from his own department to protect himself and the nation's sensitive information from Mr Burke's own Chinese-made electric car. He's got to protect himself and protect the security of the country from Chinese electric car. The risk with such cars, according to Home Affairs officials, might include having data collected from the owner's phone if it were connected to the car, voice calls eavesdropped on, image collection from the car's external cameras and geolocation tracking, meaning that if Mr Burke drove to a sensitive government location, the car's manufacturer in China would be able to see. That's the end of the quote. If these are risks to the ministers, those same risks are inherent for all Australians. Bloody ridiculous. What's even more confusing about the government EV push is that petrol and diesel engines are only getting better and more efficient in their newest versions. And did anyone mention weight? Electric vehicles are humongous in weight. Small, turbocharged, extremely efficient diesel engines were becoming the powertrain of choice, especially in small cars. Fuel efficiency numbers we couldn't have dreamt of 20 years ago were being beaten. Then all the car makers of the world suddenly, and many stupid governments around the world, seemingly overnight, had to imagine that petrol vehicles and diesel engines were dead. Imagine that. Everyone would be driving an EV, and imagine that apparently blind or not caring for the downsides in range, resources and longevity. So just as we were getting to some of the cleanest, most efficient diesel and petrol vehicles ever made, why did the government decide no one would ever want to drive them again? They decided for the taxpayers. They decided for the citizens of Australia. And why does the government want to splash billions of dollars in technologies Australians clearly don't want and are environmentally reprehensible? The answer may lie in the plans for Australia's energy grid. The government needs electric vehicles hooked up to the grid under their plans for consumer energy resources like EV batteries to be connected to virtual power plants. They want to use your car as a battery. The government can't afford to build all the batteries needed under their net zero plan. They don't even know how much. There's no plan. So the government wants Australians to buy an EV with a battery that can be taken over and discharged to the grid. They don't tell you that, do they? But that's what they're wanting. The Australian Renewable Energy Agency says this, quote, can help stabilise the power grid, batteries that is, from EVs, can help stabilise the power grid by supplying power back during times of high demand. End of quote. There it is. Do you hear that in their advertisements? No. Like many things, this will start off as a voluntary scheme currently called bi-directional charging or vehicle to grid. Sounds good, but think about what it means. It means stealing your electricity when you want it. Then the inevitable threat of blackouts and instability of the electricity grid under net zero will become an emergency, and everyone with an EV will be forced to participate. And then, so what we've got now is power shortages in some states as they destroy perfectly good coal, gas generation and try to replace it with solar and wind and fail to replace it. So we've got a shortage of electricity, a shortage of reliable electricity. And now they want to convert the car fleet, the transport fleet, to EVs, to add more demand to the electricity sector. Then they want to promote artificial intelligence, which is an electricity hub. And then they want to support Bitcoin mining. Where is all this going to lead? Massive sky prices, shortages, unreliability, and instability and insecurity. The government's plan, or what it claims is a plan, is all very complicated, but they don't know what they're doing. That is fact. One Nation's solution is much simpler. Australians should be allowed to drive whatever car they want, whatever car they can afford, whether it's a four-wheel drive, a ute, or a smart car. Only One Nation has a policy to cancel all policies which lead to the death of the V8 engine being provided as an option to Australian car buyers. Porsche, Mercedes-Benz said that EVs would take over, and they stopped making V8s. Now they're bringing back V8s and they're scaling back their EV plans. President, I ask the Senate to revoke this electric vehicle slush fund and join One Nation in bringing back the V8.
Thanks, Senator Roberts. Senator Grogan. Oh, I'm sorry. Senator.
Thank you. I rise in response to Senator Roberts' disallowance motion pertaining to the Dealership and Repair Initiative for Vehicle Electrification nationally program. Transport pollution is rising fast, and by 2030 it will be Australia's biggest source of emissions. We need all shoulders to the wheel to drive emissions down, because right now, under current policy settings, we are on track for a catastrophic 3 degrees of warming. Let's be clear, the government's current set of policies isn't going to bring down transport emissions anytime soon. This $60 million program to install EV chargers at dealerships won't shift the dial on emissions, but it will support uptake at the margins, and that's something. EVs can and should be part of the solution. They're cheap to run, especially if you have solar panels, and they're easy to drive. But price and charging access remain real barriers to widespread uptake. The global cost of EVs and battery technology is taking care of the upfront costs of EVs. Soon they'll be cheaper than internal combustion vehicles at dealerships. And of course, filling up on electrons only costs a fraction of the cost of petrol. But removing the other major barrier of range anxiety requires an abundance of charging stations. This, of course, means we need good government policy, and Australia's is not yet up to scratch. Globally, there are 11 electric vehicles for every public charging station. But in Australia, there are 68 EVs for every public charger. In that context, this disallowance makes zero sense. One Nation's attempt to block modest investment in Australian businesses, helping dealerships become part of the clean transport transition, isn't just petty, it's counterproductive. This program is supporting dealerships to be part of the transition, to use their existing relationships with their communities to encourage EV uptake. On that level, this policy makes sense. No, it won't transform the sector, but it can help normalise EVs, especially in regional areas where local dealers are trusted and embedded in their communities. That's soft power that we shouldn't be ignoring. So while this won't turn the tide on transport emissions, it shouldn't be blocked or opposed. But let's be clear, EVs alone won't solve Australia's transport emissions problem. To truly cut emissions, we need serious investment in regular, reliable and well-connected public transport. That's what will get people out of cars and off short-haul flights. We can't afford more delay. If we're serious about meeting our climate commitments, we need to overhaul our transport system, not just tinker around the edges.
Thank you, Senator Hodgins-May. Senator Grogan.
Thank you, Acting Deputy President. The government will not be supporting this motion, funnily enough. The Albanese Labor government is backing Australia's automotive industry to thrive with the auto sector's EV shift. That's why we've launched the $60 million Dealership and Repair Initiative for Vehicle Electrification nationally, the DRIVE program. The program provides practical assistance to Australian automotive dealers and repairs to install EV chargers, helping Australian small business to gear up for the EV shift. The first stream under the program gives dealerships and repairers a rebate of $2,500 for eligible smart EV chargers. The next stream of the program will support dealerships to install fast chargers. The DRIVEN program is part of the Albanese government's Driving the Nation Fund. It complements the launch this year of the new Vehicle Efficiency Standard, which is designed to ensure car companies prioritise Australia for more EV choices for Australian consumers. Australia's dealerships and repairers play a big role in our communities, educating customers about electrification and as significant employers and trainers of new energy apprenticeships, which is the way of the future. It is a practical step to help dealers keep on top of industry electrification trends and the rapidly evolving expectations of OEMs and customers. By investing in EV infrastructure, we're making it easier for them to showcase the benefits of electric mobility, meet the needs of customers and of workers, and be ready for selling more EVs as part of the automotive industry transformation. This program provides practical assistance to Australian automotive dealers and repairers to install electric vehicle chargers, helping Australian small business gear up for the EV shift. To disallow this program while the program is underway would undermine the work that these dealers are already undertaking right now. So the coalition opposite need to tell us whether they stand with our dealers, with Australian small business, with the mobility shift of the future, or whether they're going to follow Pauline Hanson's One Nation down the deluded and ideological pathway of taking the country backwards. Thank you.
Thank you, Senator Grogan. The question is that the motion, the disallowance motion moved by Senator Roberts be agreed to. Those of that opinion say aye. Against, no. No. I think the ayes have it. The noes have it. All right. It being after 6:30, we shall deal with that tomorrow. Thank you. Now we'll go to, are there any other notices of motion? If there's not, we'll now go to government business orders of the day. Health legislation, Clerk.
Government Business Order of the Day number 1, Health Legislation Amendment Improve Medicare Integrity and Other Measures Bill 2025 in committee.
Thank you. Okay. The committee is considering the the Health Legislation Amendment Improved Medicare Integrity and Other Measures Bill 2025 and Amendment 1 on sheet 3373 moved by Senator Hanson. The question is that that amendment be agreed to. Those are that opinion. Again. I'm waiting for them to jump. I'll just do that again. Okay, I'm going to put the question, but before I put the question, does anyone wish to speak to it? We're still at the same place. Okay, so I'll put the question that the motion moved by Senator Hanson, the amendment on sheet 3373, be agreed to. Those opinions say aye. Against, no. The noes have it. Ayes have it. Division required tomorrow. Thank you. Hello, Tony. We got any more? Thank you. Now, there is another motion, but the mover is not here. So if no one else wishes to speak, Senator Hanson.
Thank you. I wish to ask a question of the Minister, please. Minister, can you explain to the people of Australia how you intend to rein in the $3 billion that has been rorted out of the Medicare on a yearly basis?
Minister.
Thanks for the question, Senator Hanson. And indeed, the purpose of the bill that we're presently debating is one of a number of things that the government is doing to deal with integrity issues in the Medicare scheme. And you're right, I think everyone in this place would appreciate that it's a really important it is a really important objective, and it's for this reason that we have brought this legislation before the chamber. This legislation gives does a range of things to enable some of the existing powers that are available to authorised officers within the government to take enforcement action where they believe that fraud may be occurring. It also regularises some of these acts have been in place for a long time, since 1994, and over time various amendments have created inconsistencies between the kinds of things that may be investigated and the powers that may be used. The legislation seeks to remedy those and give additional powers to investigate fraud. And I think it is worth saying that this bill directly responds to the recommendations from the Phillip Review, and I believe, Senator, that this will be the place where you obtained your assessment about the scale of fraud, and the government indeed is concerned about that, and that's why the bill is before the chamber.
Senator Hanson.
Sorry, I was totally confused. Maybe it seems to have gone right over the top of my head. Are you acknowledging that there is fraud, but you couldn't really specify to me how are you addressing the fraud? How are you addressing those people that are not entitled to Medicare funded by the taxpayer to stop them from accessing this? How are you going to stop them from accessing the PBS scheme that they get the scripts from the doctor, from accessing that which is also paid for by the taxpayer? So I want to know, what are you doing to address it, the fraud that is actually happening?
Minister.
Thanks, Senator. Thank you, Chair, and thank you, Senator. Look, I think, Senator Hanson, I think you would agree with this, that Australians know that the overwhelming majority of our doctors and our health professionals are honest, they're hardworking, they comply with Medicare rules. Senator Hanson, I'm attempting to answer your question. If you wish to interject, perhaps you would like to make another contribution. Shall I sit down?
Senator Hanson.
Sorry. Minister, what you're saying, you're trying to address it. You're trying to just, make it appear as if it's not much money. $3 billion. That's what we are talking about a year. And that is what I want to know. How do you intend to address this? Australians are taxed to the hilt. They can't, make it stretch anymore. You cannot meet your means. This government is putting us into $1.2 trillion debt. The only way you can do it is increase productivity, which we've seen the decline. There's no investment in Australia whatsoever. So the only other way you are going to do it is increase taxes. We cannot afford this on the Australian people. Yeah. So I'm asking, how do you intend to rein in the $3 billion that has been rolled out of the system? What are your answers to it?
Before I call the Minister, I will just remind all senators that we should not interject across the chamber. Minister.
Thank you, Chair. Senator Hanson, the Phillip Review sought to address many of the issues that you're actually raising. And so we commissioned Dr. Pradeep Phillip, and he undertook an independent review of Medicare integrity and compliance. And that's exactly the kinds of things that you are now raising with me. And the amendments that are here before us come out of that review. They're a direct response to that, and they're about making those programs that I think Australians value, such as the Medicare benefits schedule, the pharmaceutical benefits scheme and the child benefits schedule, operate in the way that they're intended. And so what the Phillip Review found was that there are actors in the system who are either unintentionally or dishonestly obtaining payments, and this bill directly responds to those findings. And so the measures in the bill, we expect, will only directly impact on the very small percentage of practitioners and businesses that are engaged in non-compliance and fraud, but it is important. And more generally, patients and practitioners will benefit from better protected health benefit systems that provide more secure access to safe healthcare and services. And so I'll step through some of the measures that are in the bill that we're presently debating, Senator. The bill changes the time frame during which Medicare claims for bulk bill services may be made taking it back from 2 years to 1 year. The Minister will continue to have discretion to allow claims to be submitted after 1 year, and that's important because it will assist with compliance. I mentioned in my answer to your earlier question that investigative powers are inconsistent, they're fragmented, and it results in difficulty for the investigators in identifying which powers of investigation may be used in relation to offences. This bill addresses that challenge. It follows other measures that have been implemented by the government to improve integrity in the system, because I think we all think that our healthcare services are world-leading, they are excellent. It is incredibly important that all Australians have access to services of these kind. We can be really proud of it, but that means taking seriously issues of compliance and integrity, and our government is determined to do so.
Senator Hanson.
Thank you for that bit of a response. I've put up an amendment to actually help with rorting, and that is to do with showing identification when you actually attend the doctors. So apart from Medicare, it's saying, oh, well, this is me. I just haven't picked up my neighbour or my friends or my family's Medicare card. This is actually me. And so when you go into pubs and clubs or wherever you have to sign in, well, can you show identification of who you are? Yeah, no worries, here it is. So in pubs and clubs, if you want to go and have a beer or have a meal, you've got to go and prove who you are. That's actually you entering that club, and you've got to sign in for it. So, you know, we have a driver's licence, you have to provide this identification. Minister, why are you so adamant, and your political party, so adamant about not ensuring that that is the person claiming those benefits from the taxpayer, that they don't have to produce documentation proof that is them, when we know for a fact people are actually rorting the system? When I said in my speech, you've got 100,000 illegals in the country overstaying these visas, I've proven a point that it came from the federal police, that I was told about this person who actually used his friend's card here in Australia. So,
Sorry, Senator Hanson. Could you resume your seat on a point of order?
Yes. I believe this amendment that Senator Hanson is talking to is the one that we've already dealt with, which is sheet 3373, which was a deferred vote, but it was actually called.
It's a deferred vote. However, the senator can continue in the committee stage.
Even though that's been dealt with. Okay.
Vote.
Look,
not on that.
Senator Hanson, could you just resume your seat? I will take further advice, but my understanding is that this is completely in order. It is in order. Senator Hanson. Or, sorry, you'd finished, or?
No, I'm not finished.
Senator Hanson.
So what I was saying, Minister, I'm asking you, why are you knocking back the fact of showing identification for people who go to see the doctor with a Medicare card, and back it up with identification that is actually the person utilising that service funded by the taxpayer, when I'll go back to the point again, $3 billion a year in rorts? Why will you not support this to show identification when we insist pubs and clubs have to show identification, go and have a beer or have a meal?
Minister.
Thanks very much. Senator, I appreciate that you are raising the issues that you raised earlier when you moved your amendment. I gave a response and I indicated that the government wouldn't be supporting your amendment, and that's for a couple of reasons. It's actually that the point of this bill is to give us investigative powers and to look for and to make sure that our investigators have the tools that they need to investigate non-compliance. We take non-compliance very seriously. We also, of course, want to maintain access. In this country, we want people to understand that if they get sick, or if their children get sick, or if they hurt themselves, they can obtain access to medical care. We don't want to place too many barriers in the way of people obtaining that care. And I think many of the people that you might represent, Senator Hanson, in Queensland, would genuinely value their ability to see a doctor and to get the medicines that they and their family need. And those are the issues that the government thinks about when we're making policy around healthcare. And we're very, very proud of the system that we've created that allows people to have access. It's not so in every other country around the world, and Australians can be very, very proud of the system we've created together. It was the subject of very substantial debate, you may recall, in the most recent election, and I think the response that Australians provided to proposals around Medicare demonstrate the value that Australians place in the Medicare system.
Senator Hanson.
Minister, that's very good. I like to see that national health care that we provide for Australians, but if you expect them to hand a Medicare card, I'm sure in their wallet they'll have a driver's licence or some other identification, so I can't see the issue of stopping them from going to see a doctor. And if they're not an Australian citizen, why are providing health care for them where they should be paying from their own health insurance or out of their own pocket, considering they are not Australian citizens? Minister, another point that I want to ask you, you talk about these health centres, super clinics that you're putting up. Just can you tell me how many of them, and you've advocated these super clinics will be running at 24/7. Can you please tell me how many of these, I think it's 87 you proposed, how many of the 87 clinics are actually running 24/7?
Minister.
Chair, the bill before us doesn't deal with urgent care clinics at all. I can inform Senator Hanson that the government's commitments were to create urgent care clinics which would have extended hours. It wasn't a commitment in relation to 24/7 opening, and I can tell you that in those places where urgent care clinics have been opened, we see community members very, very receptive. But there are limits, I think, in there are other times in the program where you can ask the government questions about the operation of urgent care clinics, and I would suggest that this bill is considerably narrower than that and really doesn't extend to that issue.
Senator Thorpe, are you seeking the call? Yes, go ahead.
I move the amendment.
Thank you, Senator Thorpe. Given that we are not able to, I can put the question. Question is that the amendment moved by Senator Thorpe be agreed to. Those of that opinion say aye. Against say no. No. The noes have it. The ayes have it. You don't require a division. No two senators require a division. So, Senator Thorpe, you wish to have your vote recorded in favour of that amendment, and the Australian Greens also wish to have their votes in favour of that amendment recorded. Anybody else seeking the call? No? Not proceed until votes can be taken, and given there are no further contributions, I shall report to the Senate. Pursuant to order, further consideration of the bill in committee as a whole will be in order of the day for the next day of sitting. I call the clerk.
Government business order of the day number 2. Universities Accord National Higher Education Code to Prevent and Respond to Gender-Based Violence Bill 2025. Universities Accord National Higher Education Code to Prevent and Respond to Gender-Based Violence Consequential Amendments Bill 2025. Resumption of second reading debate.
Is quorum required? Quorum is not present. Please ring the bells. No, Senators, you cannot leave the chamber during a quorum call. Senators.
Senators cannot leave the chamber during a quorum call. Quorum is present. I call Senator Duniam.
Thank you, Deputy President, and it's a pleasure to rise to speak to the Universities Accord National Higher Education Code to Prevent and Respond to Gender-Based Violence Bill 2025 and the related bill, the Consequential Amendments Bill. The Coalition unsurprisingly supports this bill and of course the purposes for it to establish a national code to prevent and respond to gender-based violence in higher education. It affirms that everyone on a university campus, be they students or staff and residents as well, have the absolute right to be safe. The 2021 Universities Australia National Student Safety Survey revealed some very alarming figures for all of us to consume, those being that 1 in 20 students report being sexually assaulted and 1 in 6, shockingly, report being sexually harassed. Over half of students didn't understand the formal reporting processes available to them, and almost half were unaware of where they would be able to get support. The bill, of course, is necessary because the Tertiary Education Quality and Standards Agency, TEQSA, failed to hold universities accountable. TEQSA does have existing powers to highlight university failures, but did not act. And the Minister did not strengthen TEQSA's powers or hold the regulator to account. This will establish a specialist unit within the Department of Education to act as the new regulator. The Coalition does have some concerns about placing regulatory responsibility within the Department of Education rather than strengthening the independent regulator, TEQSA. The Coalition does note that embedding this function within the department risks politicising regulation and undermining confidence in impartial enforcement. The Minister is granted broad powers to set and enforce the code via legislative instrument. However, we are committed to supporting new initiatives in the higher education sector that aim to prevent and respond more effectively to the pervasive issue of gender-based violence at university campuses. The Coalition again acknowledges the work of advocates like Fair Agenda, End Rape on Campus and the Stop campaign to improve the safety of students and staff on campus. However, more action, of course, must be taken by this government to respond to this terrible proliferation of not only this activity but also the rise of anti-Semitism on university campuses, which is why we foreshadow a second reading amendment to the bill, which is similar to an amendment that was moved in the last Parliament to this bill's predecessor. The Coalition's amendment seeks to establish an additional national higher education code to prevent and respond to anti-Semitism. It responds to the real and urgent circumstances of anti-Semitism that students are facing at universities. We know that young people under 35 don't recognise the seriousness of anti-Semitism and don't treat it properly, and that is in part because what is happening at our universities. Universities should be life-transforming places where people go to get an education, help give students more opportunities in life, and should be a place where they can freely debate and engage in ideas. Recently, there's been an attempt to silence and intimidate Jewish academics, Jewish staff and Jewish students. In addition to creating a code to prevent and respond to anti-Semitism, this amendment would A, make it clear to all higher education students, staff and providers that everyone on a higher education campus has a right to feel safe. It would also impose on universities a range of obligations concerning student and staff safety, which is very important given the alarming increase in anti-Semitic incidents on university campuses since the 7th of October 2023, and it would also ensure that higher education providers must comply with the recommendations of the National Ombudsman concerning the National Higher Education Code to prevent and respond to anti-Semitism. The Coalition notes that we moved a similar amendment, as I mentioned before, when this bill was before the House of Representatives, the other place, earlier this year. And no student should have to choose between their safety and their education. An August 2023 national survey found that 64% of Jewish university students experienced anti-Semitism, and 57% hid their identity, and 19% avoided campus due to safety fears, well before the sickening events of October the 7th. We've seen clear attempts to silence and intimidate Jewish academic staff and students. That's frankly completely unacceptable. University campuses must be safe for everyone, and that includes Jewish Australians. Of course, the government has had years to act along with universities, but unfortunately to date have failed to provide protection, recourse or cultural change. The Special Envoy to combat anti-Semitism in Australia, Gillian Segal, AO, noted that anti-Semitism is ingrained and normalised in academia and in cultural spaces. The Special Envoy has proposed to work with government and grant authorities to withdraw or terminate public funding from universities where anti-Semitic conduct isn't adequately addressed. And of course, the Special Envoy has recommended that, should significant problems remain at universities by the start of 2026 of that academic year, as assessed by the Envoy's report card, a dedicated judicial inquiry should be undertaken to address systemic issues, including the investigation of foreign sources of funding for anti-Semitic behaviour and activities, and academics at universities. This report shows anti-Semitism is not just a problem of security or law enforcement, it's a cultural and societal cancer that needs attention through our schools, our universities, our media, and indeed even the arts. The report confirms what Jewish Australians have been telling us for months, that anti-Semitism has surged to crisis levels while our Prime Minister has refused to act. The report shows it's not just a problem, as I said, for security and defence forces, but much broader than that. The Prime Minister has failed to commit to the actions required in the plan delivered by the Special Envoy. He says, and he hasn't been able to indicate which ones he will support and which ones he will not. As the Executive Council of Australian Jury Co-Chief Executive Alex Rivchin said, Ms Segal is the government's expert advisor on addressing the specific problem of anti-Semitism, and after deep consultation she's produced a clear and practical roadmap for ending a crisis of more than 21 months and counting. This is something that cannot wait. So it does beg the question why we are waiting for the report relating to the activities related to Islamophobia before we act on the Special Envoy's report. We do commend this second reading amendment to the Senate, and of course, as I indicated before, the Coalition will support this bill.
Senator Marielle Smith.
Thank you, Acting Deputy President. I also rise to speak on the University's Accord National Higher Education Code to Prevent and Respond to Gender-Based Violence Bill. Too many young people over too many years have had a story to share about feeling or being unsafe on campus. We know that's happening right around the country. I started university 20 years ago this year. It wasn't safe enough then, it's not safe enough now. Me and many others can share stories of feeling and being unsafe on campus, and it's a reality lived by too many women, young women around our country today. And I've met with the National Union of Students many times, and I want to acknowledge their work and advocacy and their fight for student safety on campus, and I particularly acknowledge the work of Women's Officer Ellie Venning from South Australia. The NUS have been fighting every day for safer campuses, and they support the implementation of the code. And through their work, they've highlighted that even where universities have protocols for addressing harassment and gender-based violence, staff often lack specific training, and wellbeing counsellors are not equipped to support culturally and linguistically diverse or queer students. According to the National Student Safety Survey 2021, nationally we know 1 in 2 students knew nothing or very little about the reporting processes for harassment. In my home state of South Australia, that number is even higher at 59%. But of course, when we talk about this issue and the many aspects of it, we're not talking just in numbers, we're talking about real people. Our future teachers, our future doctors, our future clinicians, our future engineers, every single one of them taking up that life-changing opportunity that university can present, many of whom have fought extraordinarily hard to take their place on campus and step into the future they want to create themselves. Too many feeling unsafe, too many being unsafe, who have been just fundamentally let down. We know when students do report incidents, many believe that police are their only option, and only if there's CCTV footage. Otherwise, it becomes their word against perpetrators, and we know the stress and anguish of this when students are making decisions about reporting, about their future actions. We know of students going great lengths to avoid their perpetrators, including changing tutorials, disrupting their studies, leaving their studies. We see the burden falling on them to adjust. And while every university sets its standards, we know that we can see perpetrators moving between campuses, moving between universities. The evidence is abundantly clear that gender-based violence, and specifically sexual violence and harassment, is occurring in our higher education institutions at significant and unacceptable rates. And we know that too many students and too many staff members simply don't know where to go for support. They don't know how to make a complaint. We know they have been fundamentally and thoroughly let down, and it simply cannot be left in the too hard basket any longer. The latest student safety survey showed us that a staggering number of students have been sexually assaulted each year in a university setting, hundreds a week. And a third of universities don't have task forces or committees set up to address sexual violence, and many are not meeting the mark, simply not meeting it when it comes to transparency. This just has to change, and acknowledge that I don't think there's a single person in this chamber who doesn't see that. This bill is part of our action plan addressing gender-based violence in higher education, agreed to by all education ministers last year. And the National Student Ombudsman was another key measure of the action plan, which kicked off in February. These measures, when taken together, help ensure greater oversight and accountability of higher education providers, and will help drive the social change we need to see in the higher education sector to prevent and respond to gender-based violence. The Ombudsman was a necessary first step towards keeping students safe and ensuring they are heard when they make a complaint. This bill is a crucial next step. I want to reiterate that many people have been calling for these reforms for a long time. Many have advocated and campaigned for them and supported them. This bill will establish a new standalone regulatory framework to reduce the incidence of gender-based violence. It's about working with our world-class universities to keep staff and students safe. We know from the Universities Accord final report that at least 80% of our workforce will need a vet or university qualification by 2050. Currently, 60% of our workforce has a higher education qualification, and by the year 2050, 80% will need to not just have completed high school, but have gone to university, TAFE, or had some other higher education or tertiary studies. What this means is for our economy to thrive, for states like South Australia to reach their full potential, we need more Australians taking up the opportunities of higher education. Those Australians need to feel safe when they step onto campus. They need to know where to go for support. And we shouldn't accept any reality which sees a single Australian, a single young woman, abandon her study, abandon the future she has marked out for herself, abandon every shred of work she's put to go to university and to set herself on a course to live the future that she desires and sees for herself, because she wasn't safe or she didn't feel safe. That's a future we should all reject. So this bill is long awaited, especially for students, especially for victim survivors, and I commend it to the Senate.
Thank you. Senator Waters.
Thanks very much, Acting Deputy President. I rise today to speak in strong support of the Universities Accord National Higher Education Code to Prevent and Respond to Gender-Based Violence Bill of 2025. This bill enables the Minister to make a national higher education code to prevent and respond to gender-based violence. Not that you'd know that from the contribution from the opposition education spokesperson, but I suppose it's pretty typical of the Liberals to ignore and erase women. But the national code is in fact about gender-based violence, and it's the next step in responding to the Universities Accord interim report, after we've already had the creation of the National Student Ombudsman and the action plan addressing gender-based violence in higher education. The Greens support this bill, and we welcome this next step in both preventing but tackling also sexual violence on campus. This bill will create for the first time meaningful and detailed standards that universities must meet in relation to gender-based violence. These standards will be endorsed by a specialist unit within the Department of Education, and where universities fail to meet these standards for student safety, this unit will finally have the power to enforce penalties, including financial penalties. I want to extend a deep and heartfelt thank you to all of the activists and groups who've campaigned for this outcome, including Fair Agenda's Renee Carr, End Rape on Campus Australia's Shana Bremner, the Stop Campaign's Camille Schloeffel and Dr Alison Henry, who have been working to shape this code, and they've been working on the issue of sexual violence in universities for many years. They've done incredible work, and it's their advocacy that has seen us pass this bill tonight. I'd also would really like to acknowledge the survivors who've faced harmful actions from their universities, compounding the harm of their assault. Too many people, mostly young women, have been left without support for their safety on campus, on res, in exam rooms, and they've been left to drop out or fail as a result of the failure to prevent that sexual assault on campus and as a result of the failure of universities to take action to keep those students safe on a university campus in that setting. It's unforgivable and it has life-changing consequences for people. So the code as tabled will be transformative for students. It will finally provide an avenue to shift university practices to improve outcomes for survivors who've been too often left abandoned by their universities. It will also provide an avenue for the new expert unit in the department to enforce compliance, which TEXA, the tertiary education regulator, has so roundly failed to do. In the Senate inquiry that I participated in, along with Senator Scarr and Senator Green, who I understand will speak next, into sexual consent laws in 2023, it was abundantly clear that TEXA had utterly dropped the ball on its responsibilities, and that women and young people who had suffered legions of sexual abuse and harassment were further damaged and utterly again re-traumatised by the failure of the regulator, TEXA, to do their job. So I'm glad that we're here today, essentially sidelining TEXA for this matter and setting up a process that there is much hope will deliver accountability, and also we need to focus on prevention as well. But through the course of that inquiry, we delivered a unanimous report that recommended an independent task force to hold universities to account on sexual violence, as well as an urgent review into the tertiary education quality and standard, TEXA's response to sexual violence on campus. The conduct of the universities in covering up the sexual assaults and harassments on campus, rather than actually addressing student concerns and keeping students safe, which we revealed through that inquiry, was utterly reprehensible. They were more concerned about protecting themselves and their own reputations than they were about protecting student safety, and that's unforgivable. We even learnt that Universities Australia went so far as to cancel a student-led $1.5 million consent education and sexual assault prevention campaign on campus because a few old dinosaurs, including the then head of Universities Australia, thought it was too risque. It was consent education for adults, student design so that it would meet students where they were at, and it was cancelled, and that money got unilaterally funneled into a staff program. So I'm really glad that all of that work has culminated in the bill that we are debating and hopefully passing shortly. Repeated examples of universities failing to make real changes to protect students mean that the Ombudsman and now the Code must be equipped to do that. Universities have to be safe places for students to learn and to thrive. And that inquiry and its recommendations wouldn't exist without the work of those courageous advocates, some of whom I've known but named already, but a few additional powerful advocates: Saxon Mullins, Nina Fennell, Grace Tame, Chanel Contos, Shana Bremner, Camille Schloeffel, and many, many more, who have consistently pushed for laws and consent education to be informed by the lived experience of sexual assault survivors. We're really eager to see this code mandated as soon as possible so that no more students have to wait for these safety protections. This is long overdue. These survivors deserve this protection. Those assaults should never have happened in the first place, and we've got to work on the cultural changes to prevent that. We've got to make sure that universities don't re-traumatise people by utterly failing them when they're most needed. And we have great hope that this code, developed by survivors, might get us there.
Thank you. Senator Scarr.
Thank you, Mr Acting Deputy President. And can I, at the outset, acknowledge the role that Senator Waters played in terms of the Senate inquiry into current and proposed sexual consent laws in Australia, which went through the Legal and Constitutional Affairs References Committee, and thank her for her role and ongoing advocacy in relation to these issues. And I note Senator Green is going to be speaking after me, and I also acknowledge your role, Senator Green, or maybe somewhat later. Okay, but I acknowledge your role, Senator Green, in relation to the inquiry, and I suspect when I look back on my time in the Senate, this will be some of the most important work I think I've done, and it's hard to imagine anything more important than protecting people on our university campuses. I want to quote from the report which we delivered, and we didn't say this lightly, Acting Deputy President. It is a searing indictment of Australia's university sector and the regulator, TEXA, the dedicated and courageous advocates for university students who have suffered from sexual violence on campus should hold the view that the process of making complaints and how universities and the regulator deal with such complaints is causing great trauma to the victims of sexual violence. In the strongest terms, this committee says that is a shameful state of affairs. It is unacceptable, end quote. So on that basis, I am very, very, very pleased to have the opportunity to speak in favour of this bill. And in doing so, I also would like to acknowledge all the victim survivors who have suffered the unbelievable trauma they've suffered on campuses and then have been re-traumatised by the way in which the institutions have responded, in some cases an absolutely callous and cruel way. And I acknowledge each and every one of those victim survivors. From the bottom of my heart, I would also like to pay tribute to the team at End Rape on campus. I pay tribute to the founder, Shana Bremner, who gave evidence to the committee. I also pay tribute to Nina Fennell, who also gave evidence to the committee. I pay tribute to their advocacy. I pay tribute, and I'm not sure words are sufficient. I'm not sure words are sufficient in this regard, but I pay tribute to the support which they provided victim survivors. And during the course of the committee, I think Senator Green, Senator Waters and I obtained an insight, a small insight into the toll that took on Shana and Nina and indeed other advocates in this space. And the support which they gave victim survivors was to use two terms which are used in the National Code. It was person-centred, and that means that it took into account the needs and preferences of the person at the centre of the incident who suffered traumatic experiences, and it was also trauma-informed, creating that that experience of safety and trust, and providing empowerment to the victim survivor. And if I can, perhaps the best way I can pay tribute to both Shana and Nina is to say, when I read the code, and I've read the code, I went back and read their evidence as to some of the issues they were facing. And I'll quote from Ms Bremner in this regard, and I quote, "A really common theme among the students we've supported over the last 8-9 years now is my rate was bad, but the way my university responded was worse. We hear very often the effects of re-traumatisation once students have reported. They feel incredibly unsupported, even if they can find where to report in the first place. When they are reporting, we're still seeing extensive delays in responses by universities. Once that process starts, students are still finding that simple requests for extensions because they're dealing with trauma are being denied, or that they have to provide material from a psychologist. If they make it through all of that, if they get to a point where they file a complaint and the university decides to look into it, they're then told that they can't tell anyone they filed a complaint. Then if they somehow manage to still forge ahead and get through all of it, they're often told they can't get an outcome in their complaint because of privacy reasons." And then Ms Fennell stated, "We can do simple things to help students stay engaged with their education, such as allowing them to move tutorials so they don't have to sit with the offender." I mean, it's astonishing, absolutely astonishing, that it requires the implementation of a national code through this place to get to force the universities, all universities, to take appropriate action. I continue the quote from Ms Fennell, "Allowing them to have flexibility in their timetabling and their exams, not making them disclose afresh to every single one of their lecturers and every single one of their tutors what happened to them, not having to produce medical documentation over and over again, and also allowing them to move bedrooms in residences so they don't have to sleep in the room where the rape happened." End quote. And that's the evidence we received. And I'm so pleased that when I went through the National Code, that it ticked off all of the issues, every single issue, which Ms Bremner and Ms Fennell raised, has been dealt with in the code. And that is tremendous. Lastly, I want to quote from an announcement which NDIS on Campus actually put up on their website. Quote, "NDIS on Campus Australia has now permanently closed. Almost 9 years to the day since our founding, we've done the thing that organisations like ours should be aiming to do. We've advocated ourselves out of business. We're incredibly thankful to everyone who has supported us over the years," end quote. Well, we're incredibly thankful to you. We're incredibly thankful to you, Shana and Nina, for all the work which you've done. And can I just say, your job is done, but our job continues. Our job continues in terms of making sure that this new system works, analysing and scrutinising disclosures which are made under the new system, and to hold the university sector to continuing account to make sure they're doing the right thing by our students.
Thank you. Senator Whittaker.
Thank you, Acting Deputy President. It's my absolute pleasure to rise this evening and talk to this bill. It's really clear that it's the result of a lot of work by a number of senators in this place, and I particularly want to acknowledge Senator Nita Green for her work on on bringing this bill here. Everyone deserves to feel safe at work and when they're studying at university, wherever that happens to be around the country. And that's why we've taken this step to ensure that higher education providers are proactive in their efforts of preventing gender-based violence on campus, as well as putting in much needed better support for the students who need it and for those victim survivors. For too long, it's clear that students and staff have felt let down by convoluted, unsatisfactory reporting processes. Systems that should have offered protection have instead added pressure, forcing victim survivors to carry the burden of navigating complex complaints pathways just to seek the justice and support that they deserve. We know that inadequate reporting systems and a lack of proper support infrastructure can have serious and long-term consequences, not just for mental and physical health of victim survivors and the people around them, but also for the educational outcomes of students too. Many felt they had no choice but to withdraw from their studies altogether. This works against the sole purpose of a higher education provider, which is to provide education to students. And so that's why we are taking this action now. The National Plan to End Violence Against Women and Children is the blueprint that underpins this bill. It's agreed to by every government and every education minister across the country. It's an ambitious plan to end gender-based violence in a generation. For too long, dealing with gender-based violence has been an issue put in the too hard basket by successive coalition governments. Students, particularly young women, have been let down by institutions who have failed to act, let down by systems that didn't listen, by people that didn't listen, and let down by governments who have looked the other way. It's just not good enough. This is a plan grounded in evidence, taking a trauma-informed approach and putting the voices of victim survivors front and centre, because we say enough is enough. Gender-based violence, we know, is driven by inequality, disproportionately impacting women and people of colour, the queer community, First Nations students and students with a disability. This is such an important bill which aims to protect students vulnerable to systemic oppression and aims to deliver better outcomes, ensuring safety across every element of campus life, whether that be in the classroom, at student accommodation, or in university clubs. I too want to acknowledge the many victim survivors that participated in the committee processes and shared their stories, which have been really key in putting together the plan that is laid out in this bill. The plan lays out 7 actions that will guide implementation and ongoing accountability. The first step is the establishment of the National Student Ombudsman, a truly independent pathway to justice for students and staff impacted by gender-based violence on campus. The second is to have all higher education providers embed a whole-of-organisation approach to prevent and support gender-based violences within their organisations, prevent and report gender-based violences within their organisations, led by the most senior executives and governance bodies. Universities are so often the ground for social movements. For many students, it's the place where they find their voice, share their passions, and form their beliefs. These are environments where often we're first challenged and taught to challenge what we know, what we believe. Universities deliver leaders, thinkers, workers. And so this is an opportunity to make lasting change, not only on campus, but for a generation of young people. It's why a whole organisation approach is so important. The third action under this bill is to strengthen provider accountability for systemic issues relating to gender-based violence by introducing a new National Higher Education Code to prevent and respond to gender-based violence. This code will be led by a new expert unit, initially sitting within the Department of Education. The purpose of this unit will be to assist higher education providers by building their capacity to prevent and respond to instances of gender-based violence, as well as ensuring that the work being undertaken is informed by the latest and evolving evidence. Ensuring there is space for best practice to grow and change with the times is crucial for these programs to become part of real and lasting cultural change. Another really important area is, of course, student accommodation, a place where we know that safety is particularly important and often, unfortunately, particularly at risk. And safety, of course, doesn't just stop at the classroom door. That's why this plan calls on student accommodation operated both by universities and by other independent providers for more seamless collaboration between those universities and accommodation, including in cases where the university doesn't directly manage that accommodation. This is really important so that victim survivors don't have to make multiple reports and recounts of what has happened. And if a student does suffer harm in residential housing linked to a university, then the institution, the university themselves, will still be expected to respond in the appropriate way. These are not just one-time initiatives, it's long-term structural change because we're in it for the long haul. Gender-based violence has no place in our lecture halls, our labs, our libraries, student accommodation. And with this plan, these reforms, with this shared commitment, we're building a future where higher education ensures every person is safe, respected, and able to thrive. The evidence is stark and it bears repeating. 1 in 20 university students report being sexually assaulted during their studies. 1 in 6 has experienced sexual harassment. Half feel they were not heard when attempting to report those experiences. So this legislation is about something that should never be up for debate, that every student, every staff member on every campus across our country feels safe in their place of study or work. And this bill is a critical part of this government's response to those failures. Part of the action plan on addressing gender-based violence in higher education, agreed to by every education minister across the states and territories, which was agreed to earlier this year, sets out some really important objectives. Firstly, to reduce the incidence of gender-based violence in higher education, to establish national standards for prevention and response to gender-based violence, and to create a regulatory framework to monitor and enforce compliance. This builds on the establishment of the National Student Ombudsman, which began its work in February, giving students a new independent avenue to escalate complaints, with real powers to investigate, recommend, and now, through this bill, see those recommendations enforced. What this does, and why it matters so much, is that it moves us from a patchwork of voluntary efforts to a really clear set of national standards. A national code which is underpinned by legislation that all providers must meet. And really critically, accountability will no longer be sat by, within a committee or a task force or buried in some report somewhere that just sits on someone's desk and is ignored. Accountability sits at the very top of our universities with vice-chancellors and governing bodies. They will be required to report on what they're doing, not just in responding to gender-based violence when it occurs, but also in preventing it. There will be an obligation for them to train staff and student leaders so that everyone on campus has an understanding of what they can do to be a part of this change, to provide trauma-informed care to victim survivors who need it, to track and publish data, to provide accountability so we can see the true depth of where and when this is happening, and importantly, to listen to students, especially those who have lived experiences. And where, in unfortunate circumstances where a university fails to act, the government will now have the tools to intervene. because universities must be responsible for what happens on their campuses. They have an obligation to keep every student, every staff member safe, and that should be a proactive obligation. I understand that there are some in the sector that have raised concerns about the regulatory burden that this may create. But to them, I would say this. The burden of inaction for too long has fallen on students. For too long it has fallen on victim survivors. And those costs, be them psychological, educational and social, they are far greater than the cost of any compliance requirements in this bill and in our broader plan to tackle this issue. That's why the government is establishing this gender-based violence unit not just as a watchdog, but as a partner, offering guidance to provide support and to meet their obligations. It's not just about punishing institutions for the sake of it. It's about driving cultural change. It's about making sure that no student, no staff member is ever made to feel like their problem is being managed away or ignored, that their experiences aren't important and that action won't be taken. We know that many universities across the country, including in my home state of Western Australia, have already taken steps in the right direction. There is, of course, more work to do. This legislation supports those efforts and provides consistency right across the country to make sure no one falls through the cracks simply because of where they study. This bill, of course, follows many, many months of broad consultation within the sector, with advocates, victim survivors, experts, accommodation providers and students. Not just a project that began in isolation but was shaped by real experiences, and I think that's one of the things that makes this so important and makes it a bill that really will deliver the kind of lasting change that we need. Why does this matter so much? Why is it so significant? Well, it's the first time that accountability has been clearly assigned to senior leadership at institutions, at universities, with governing bodies of those universities to receive biannual progress reports. It mandates prevention education built from evidence, built from lived experience. It brings student accommodation clearly within a university's responsibility, regardless of whether they run or own it or not. It builds a national database on prevalence and outcomes so we can measure whether interventions are working or not and take action if they are not. And it provides enforcement powers where voluntary reporting has repeatedly failed. Because we believe that students should not have to fight for safety. They should not have to navigate trauma alone. And they shouldn't be asked to settle for less from the institutions that are meant to support them. This is about doing better for university students. It's about doing better for young people. It's about doing better for the staff at those university campuses. And it's about making our higher education system stronger. It's about making our higher education system better. And it's about making our higher education system one that we can all be proud of. Thank you.
Yeah. Senator Faruqi.
Thank you, Acting Deputy President. I rise to speak on this bill, which sets up a code to prevent and respond to gender-based violence in higher education. Every year, our nation is shaken by violence against women, and a wave of public outcry happens against this gendered violence. Anger and grief erupt across the country, with thousands of people marching in cities and towns across the country, demanding an end to this epidemic of violence against women and urging our leaders to declare a national emergency and to take strong and meaningful action to end gender-based violence. Because gender-based violence is a scourge in society. No workplace and no institution is safe from this violence. It is perpetrated on streets, in homes, in workplaces, in online spaces, and universities are not immune or safe either. but they should be. That's why this bill is an important step in achieving change. This change is only happening because of activists and advocates who have worked so tirelessly for such a long time to see the National Code come to fruition. So many courageous victim survivors have bravely stepped forward and shared their stories to ensure that one day others won't have to face the same pain and trauma that they have had to endure. End Rape on Campus, Fair Agenda, the Stop Campaign, the National Union of Students, and many others have campaigned across the country for their universities and leaders to do more to make students and staff safe. And I thank you all from the bottom of my heart for doing this very difficult work, but work that needed to be done. The reports of sexual assault in unis is shocking and horrifying. Research conducted in 2021 found that on average, 275 students were sexually assaulted on Australian university campuses each week. The National Tertiary Education Union's 2023 survey on sexual harassment, sexism, and gender-based bias in higher education revealed alarming results as well. And it showed that the number of staff who have personally experienced sexual harassment had increased from 19% in 2018 to 29% in 2023. Women continue to bear the brunt, with 38% of respondents reporting personal experiences of harassment. Staff who were aware of others who had experienced sexual assault had increased from 36% in 2018 to 50% in 2023. I mean, these are devastating statistics, and the traumatic experience of the people behind these numbers can totally upend and ruin lives. The extent of sexual violence at our higher education institutions across the country is a failure of universities and governments, and it has taken far too long to implement change. Too many students have experienced sexual harassment and sexual violence at a university, including online, on campus, or in university accommodation. And we know that it is women, non-binary people, people with disabilities, First Nations people, and other marginalized groups who have experienced the brunt of this violence. The 2021 National Student Safety Survey also found that 1 in 6 university students had experienced sexual harassment, and that 1 in 20 had experienced sexual assault in a university context. That is truly horrifying. Of those who experience sexual violence, only very few make reports, and almost half of those who did report an assault to their university felt dissatisfied with this process. And the situation is similar for staff, where only a small percentage make complaints. So it is beyond clear that expecting universities to act on their own did fail. Too many victim survivors have faced harmful actions from their universities, compounding the harm of their assault. Too many have been left without support for their safety on campus or in exam spaces, and have been left to drop out or fail as a result. The actions of universities in covering up the sexual assaults and harassment, rather than seriously addressing student concerns and keeping students safe, has been reprehensible. Every student has the right to study in a safe environment without fear of being sexually assaulted or harassed. Every student has the right to learn and live in spaces that are respectful, safe, and free from violence and discrimination. And every staff member has a right to be safe and free of the fear of harassment and violence while they teach and support students. This bill has the power to create meaningful change that will make universities safer places for all. And again, I'm so grateful to individuals and organizations who have bravely shone a light on sexual violence, assault, and harassment on campus. They have held universities to account for their abject failures, and they have pushed the government to deliver this important legislation. And it is because of you all that we are here today voting on this bill. and it is because of you that our universities will become safer places. The impact of this bill will be that universities must comply with meaningful and detailed standards to prevent gender-based violence and sexual violence at universities. The National Code will require universities to develop a whole-of-organisation approach to responding to violence and make their gender-based violence prevention plans public. It contains important standards and transparency measures to ensure that that change does happen. The Code requires universities to ask prospective employees if they have been investigated for an offence of gender-based violence and bans the use of non-disclosure agreements in handling reports of gender-based violence on campus. It requires high standards of trauma-informed response and care where students do experience sexual violence. It is a way of shifting university practices to make them more transparent, to finally start to focus on prevention, and to improve outcomes for victim survivors who have too often been left unsafe in university spaces. The Greens are proud to support this bill. We have worked for years with advocates and activists and welcome this step in preventing and tackling sexual violence on campus, something my colleague Senator Waters and I have passionately pushed for years. And we look forward to seeing the code mandated as soon as possible, so students don't have to wait any longer for these crucial safety protections. Gendered violence does not happen in a vacuum. It happens largely against women and is perpetrated by men. Misogyny is actually life and death. We must reckon with that fact. We must go to the heart of tackling inequity and dismantle power imbalances and patriarchy. We must recognize that First Nations women, women of color, trans women, queer women, and disabled women face extra barriers due to lack of appropriate support and services. So most importantly, each and every policy and action must be developed through intersectional, feminist, and anti-racist lenses if we truly want to make sure that no one is left behind. Otherwise, the untold heartache and sorrow of women being killed and abused will continue. I will conclude by saying a few words about Senator Duniam's amendments to this bill. The Liberals just last week refused to criticize Pauline Hanson's One Nation for their racism against First Nations people. The Liberals also think Islamophobia does not exist. And here they are, again, weaponizing anti-Semitism with the sole purpose of silencing and suppressing criticism of Israel and targeting students and staff who are anti-genocide. The People's Inquiry into Campus Free Speech on Palestine is shining a light on Palestine repression at Australian universities and the methods and tools being used to restrict and crack down on academic freedom and freedom of speech are just horrific. Good on the brave students and staff for speaking up during this inquiry, despite a culture of fear created by the suppression and punishment that they have been subjected to. The Universities Accord report itself highlighted instances of racism at higher education providers against First Nation staff and students, and a much broader study into all forms of racism across the university sector is being conducted by the Race Discrimination Commissioner. We have a national anti-racism framework waiting to be funded and implemented. But the Liberals and also Labor have created this weird hierarchy of racism which helps no one. Racism is racism. Its need to be tackled in its horrific entirety and grounded in the reality that to tackle systemic racism, we must confront our bloody colonial history and the ongoing violence against First Nations people. So no, the Greens will not be supporting the Liberals' thinly veiled attempt to shut down anyone who speaks up for justice for Palestine.
Senator Blythe, just a reminder, we've only got about 2 minutes before you'll be interrupted for adjournment.
Thank you very much, Acting Deputy President. Creating a national code to prevent and respond to gender-based violence in universities is, of course, a noble intention, and the Coalition is supporting this bill. I worked within universities for over 2 decades, and I support the approach to ensure that all students, staff, residents and visitors to university campuses are safe. It's shocking to learn from the 2021 Universities Australia National Student Survey that 1 in 20 students reported being sexually assaulted. 1 in 6 reported being sexually harassed. Over half of the respondents did not understand formal reporting processes, and almost half were unaware of where to get support. It is clear that there is much work to be done in communication with staff, students and residents, the support and processes that are available to them. There are some fundamental questions that must be answered about whether the government's approach is appropriate. This bill empowers the Minister to make a national code that can lead to higher education providers losing accreditation and be subject to civil penalties if they do not comply. That is an incredibly serious consequence for tertiary education providers to threaten tertiary education providers. Thank you.
I have to interrupt you. I propose that the Senate now adjourn. Senator Cash.
Thank you. And tonight I rise to pay tribute to one of the stalwarts of the Liberal Party of Western Australia for well over 50 years, and who unfortunately and sadly passed away peacefully on Tuesday the 1st of July, aged 85, surrounded by his loving family, and that is, of course, Terry Jackson. Another Life member, Jeremy Buxton, was kind enough to write this tribute to him on behalf of the Liberal Party of Western Australia, and I would like to have it officially recorded in the Hansard. Born in England, Terry emigrated to Australia at the age of 15. He quickly fell in love with his adopted country, drawn to its spirit of opportunity, optimism and reward for effort. A trained engineer, Terry would go on to build an extraordinary life. Terry was one of the very active Liberals in the Stirling division, who formed the core of the Honourable Ian Viner's landmark campaign that won the federal division of Stirling at the 1972 election, the best Liberal result in Australia that year. Terry was also the founder of Sherwood Overseas Co. Pty Ltd, and he played a pioneering role in developing and bringing to the market the now iconic Creepy Crawly pool cleaner. It became an Australian success story exported to the world. Terry enjoyed a happy marriage with Val until her death in 2020. Beyond business, Terry was a steadfast and generous supporter of the Liberal Party over many, many decades. He believed deeply in enterprise, personal responsibility and giving back to the country that had given him so very much. In the difficult years of the late 1980s, he provided the party with a central headquarters in a West Perth Murray Street building that he proudly named Menzies House. And in doing so, he sustained the WA Liberal Party for nearly 30 years until we moved to Parliament Place a decade ago. Terry will be remembered as a gentle and principled man, a devoted father, a loving grandfather, and a lifelong Liberal who embodied the values we hold so dear. In 1993, he was most appropriately awarded one of the first life memberships of the Western Australian division of the Liberal Party. At the 2015 Federal Council of the Liberal Party, he became one of the very few people across Australia to become a national Liberal Life member. His contributions to our party and our country will not be forgotten. His community philanthropy, that included the restoration of the roof of St George's Cathedral with authentic slate tiles, resulted in membership of the Order of Australia and recognition as a Chevalier of the Order of St Lazarus. On behalf of the Liberal Party of Western Australia, we extend our deepest condolences to his children Victoria, Andrew and Sarah, and to his beloved grandchildren. We take comfort in knowing that Terry is now reunited with his wife Val, and we honour a life well lived.
Thank you, Senator Cash. Senator Shoebridge.
Oh, thanks, President.
This week, as we meet in this chamber, the Northern Territory Government is rushing dangerous changes to youth justice laws through its parliament. Laws that we know will harm vulnerable children, that will not protect our community, that are contrary to all the evidence. And they're getting away with it because the media focus is away from the Northern Territory, often on this place. But let's be clear who will be targeted under these changes to NT laws. As we speak, 95 to 100% of the children in NT jails will be First Nations kids. And you look at the data and it's been consistent for years and years. Some nights, every child in an NT prison is a First Nations child. And the changes that the NT government is seeking to ram through without even a skerrick of proper process include moving youth justice out of territory, families, housing and communities and into corrections. And the symbolism is clear and intentional. They now see First Nations kids as criminals to punish, not children to help. And these reforms are also intended to remove from the Youth Justice Act in the NT the requirement that detention only be used as a last resort. And I heard the Chief Minister this morning aggressively pushing this and saying it now means judges can lock up children without trying community support, without counselling or without putting children and families through programs, celebrating lowering the bar to put more and more kids in jail. And they're making it easier when they put kids in jail, remember almost always First Nations kids, to use restraints on kids in custody. And they're ensuring that childhood mistakes will follow children into adulthood as well. This is all about punching down from the Northern Territory Government. It's about blaming the most vulnerable and marginalised members of the community for systemic failures on housing, on jobs and on education. And the NT Office of the Children's Commissioner has correctly said that these changes are not evidence-based. But the Chief Minister in the Northern Territory, with almost no scrutiny, just blows those concerns off, blows the concerns of land councils off, and she doesn't seem to care. Young people don't commit crimes because the punishment isn't tough enough. All the evidence tells us this. Children are committing crimes because of homelessness, family violence, mental health issues, being kicked out of schools, and racist laws seeking only to lock up traumatised kids will just make this worse. Yesterday, Prime Minister Albanese announced federal intervention into childcare using Commonwealth funding powers to protect children. Good, good. But if the federal government can step in for daycare safety, why can't they act and intervene when a state or a territory is deliberately, consciously harming vulnerable young people in their jurisdiction? These reforms abandon evidence, they ignore experts, and they'll make our communities less safe while traumatising children. It's not justice, it's political grandstanding at the expense of our most vulnerable young people. President, I, like so many, have been horrified by the violence we're seeing in Syria. After generation of violence, the people of Syria deserve peace. And it's always, always civilians who pay the price when governments and armed groups escalate. The Syrian civil war saw people from every religious and ethnic group killed, displaced, traumatised, and there needs to be an end to the bloodshed. The targeting of ethnic and religious communities by extremists entrenches violence, and we know that the vast majority of Syrians want what we all want, peace. The new Syrian government must be doing everything in its power to end violence and conflict and make sure that Syria, which is a diverse and multicultural country, is also one of peace. And Israel has only made this pathway to de-escalation harder with its bombing of Damascus. We've seen Israel being given again a blank cheque by the US and unfortunately the Australian government, and that must stop. The Australian government, like all governments, needs to play a proactive role in protecting vulnerable communities, and for us, that should mean raising the humanitarian intake to find an additional pathway for those who have been traumatised in Syria and have connections here in Australia fleeing persecution. And I want to make particular note of the letter from the Druze community, calling on the Albanese government to A, publicly condemn ethnic and religious violence, to demand independent international investigations into war crimes and religiously motivated massacres, to support humanitarian aid, resettlement programs for persecuted minorities and targeted sanctions against those responsible, and to engage the Syrian diaspora communities to help document crimes, raise awareness and support justice initiatives. And we call on the Albanese government to listen to the community, and we support these calls coming from the community.
Thank you, Senator Shoebridge. Senator Blythe.
Thank you very much, Madam President. Last week, Australians were greeted with the extraordinary news that the nation's First Nations ambassador had run up a travel bill exceeding $730,000 in just 2 years. This included travel to destinations such as Hawaii, New York, Geneva, Dubai and Paris. This eye-watering sum would be galling at the best of times, in the midst of a cost of living crisis being presided over by the present Labor government. It is nothing short of an insult to hard-working Australians. This is not an isolated lapse in judgment. It is the inevitable result of a role that should never have been created. The First Nations ambassador is a needless and divisive appointment, an expensive political indulgence dressed up as progressive diplomacy. It's a role without a clear purpose, delivering no measurable outcomes, and now exposed as a vehicle for exorbitant travel and unjustifiable perks. Australians work hard and expect their taxes to be spent wisely on hospitals, schools, roads and defence. They do not expect to fund luxury international junkets for divisive public officials with vague or non-existent mandates. No other country has an ambassador for a dedicated race of people. There is simply no credible rationale for a taxpayer-funded ambassador spending hundreds of thousands of dollars travelling the globe to implement a First Nations approach to foreign policy. What exactly has been achieved since this appointment? The government can't say, and ministers defending the role only offer generic platitudes, but they have not identified a single tangible outcome. No major trade deals, no improvements for local communities, no measurable return on this extraordinary investment. The role of the First Nations ambassador is another example of Labor's taxpayer-funded virtue signalling, hard-working Australians footing the bill so that Labor can seem like it is doing something about Indigenous disadvantage. The very concept of a separate ambassador for First Nations people is flawed. It suggests that Indigenous Australians speak with a fundamentally different voice to other Australians on the world stage, a racist proposition that undermines our unity. Australia is one nation. We should present one voice, inclusive of all Australians, not segregate our diplomacy along racial lines. We already have a highly capable diplomatic service that promotes inclusive values and represents all Australians, Indigenous and non-Indigenous alike. Our embassies showcase Aboriginal and Torres Strait Islander art and culture. Our international envoys acknowledge and celebrate Indigenous heritage. There is no need to create a pointless and expensive diplomatic post to do what our existing institutions already do. The First Nations ambassador role is not only redundant, it is divisive. It reflects a broader mindset within the Labor government that Australians should be categorised by identity, race and grievance. We saw it with the failed voice to Parliament. We see it in persistent talk of treaty and truth-telling commissions. Labor's instinct is always to separate, to classify, to divide, not to unite. Australians have rightly had enough. Voters overwhelmingly rejected the idea that some Australians should have more say than others based on their ancestry. They want unity, not division. They want practical outcomes, not symbolic gestures. They want a government that treats every citizen equally, regardless of their heritage. This is not about denying the importance of Indigenous voices. It is about ensuring that those voices are heard where it matters, in Parliament, in local communities, and in national policy making. We don't need a globe-trotting ambassador to validate Indigenous Australians. We need to walk the walk at home together as one united nation. The First Nations ambassador role must be abolished immediately. Not wound down, not reviewed, not quietly sidelined. It is a waste of taxpayer money and a symbol of the very division that all Australians have rejected. Thank you.
Senator Blind. The Senate stands adjourned and will meet again tomorrow at 12 noon. Good night, Senators.